Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly.
please take your seats. Before we commence, members, I advise the House that I was notified on the 20th of January 2021 that Ms Linda Dillon has resigned as chairperson of the Committee on Procedures with immediate effect. At the same time, I received notification from the nominating officer for Sinn Féin that Ms Carol Killen has been nominated to fill the vacancy of chairperson of the Committee on Procedures, also with immediate effect. I am satisfied that the requirements of standing orders have been met. Well done. Next item on the order paper. I have received notice from the Minister of Justice that she wishes to make a statement. Before I call the Minister, I remind members that in light of social distancing being observed by the parties, the Speaker's ruling that members must be in the chamber to hear a statement if they wish to ask a question has been relaxed. Members do still have to make sure that their name is on the speaking list, and if they wish to be called, but if they can do this by rising in their place, as well as notifying the Business Office or Speaker's table directly. I remind members that to be concise in asking their question. I also remind members that in accordance with long-established procedure, points of order are not normally taken during a statement or the question period after. And I call the Minister of Justice. Minister.
Thank you, Mr Speaker, and I'm pleased to publish two reports that I commissioned last summer, one in relation to the support services provided for operational prison staff and one dealing with the support services provided to retired prison staff. Both reports are well researched and evidence-based, and I believe it would be difficult to disagree with any of the recommendations that have been made. Before I comment further on the reports, I want to place on record my thanks to the authors, Siobhan Keating, Gillian Robinson and Graham Walker, for the work that they have undertaken. They deserve considerable credit. All three have busy, full-time jobs in the public sector, and much of the work they did was completed in their own time. I have no doubt that all members, when they have time to read and digest the reports, will recognise the significant contribution these three individuals have made. Mr Speaker, let me begin by putting these reports in context. The work of our prison service is hugely important. Prison staff provide a vital public service. They work in a challenging, complex and at times volatile environment that for most of society is out of sight and out of mind. They deal with some of the most difficult and dangerous members of our community, and they do so in a way that is professional, compassionate and caring. The reality is that many who find themselves in our prisons are themselves vulnerable. Understanding some of their adverse childhood experiences, while not excusing their behaviours and offences, is important in helping staff manage them within the prison and also prepare them for successful rehabilitation in the community. The scale of the challenge prison staff face in seeking to reduce the likelihood of prisoners reoffending should never be underestimated. The truth is that when everyone else in society has failed to address their often complex needs and the underlying causes of their offending behaviour, we ask our prison staff to step in and challenge and support them to change. It is a matter of record that 80% of those coming into our care left school under the age of 16. 47% had no qualifications and 69% were not in employment. Over half had a history of alcohol and or drug misuse, a third had mental health issues, and 58% had a history of self-harm. That is a challenging cohort of individuals who represent a microcosm many of the wider societal challenges we observe in our community. And prison service have an incredibly demanding role in dealing with all of those complex factors, whilst maintaining good order and safety for themselves and those in their care. Mr Speaker, it is also worth reflecting on the transformational change that prison staff have delivered in recent years. The latest reports completed by inspectors for each of our prisons are very positive. Indeed, in 2019, Hydebank Wood received a total of 15 out of a possible 16 marks available from inspectors. All our prisons have received top marks for the resettlement and rehabilitation work they do, and inspectors have commented on the very positive relationships that exist between staff and those in their care. Our prison service has been on a remarkable journey as it has delivered its Prisons 2020 programme, and it is encouraging that inspectors now state that levels of violence have reduced, as have the levels of self-harm, while the outcomes we are delivering for prisoners are amongst the best they are seeing anywhere. In 2014-15, there were 112 assaults on staff and 260 prisoner-on-prisoner assaults. Those statistics have been improving year on year, and in this current year, 2020-21, The respective figures are 26 and 33. While there is no room for complacency, that is a very significant improvement. Further evidence of the progress made by staff can be seen in the way prison services manage the ongoing COVID pandemic. In many other jurisdictions, prisoners are being locked in their cells for up to 23 hours per day. We have taken a very different approach, and we have worked hard to keep prisoners out of their cells and COVID out of our prisons. We have placed every prisoner in single-cell accommodation, and with the exception of committal prisoners who are required to self-isolate in our quarantine units, all of our prisoners are out of their cells and participating in a landing-based regime during the day and for evening association. We have delivered 35,000 virtual family and legal visits, and within the constraints we must operate, we are delivering virtual learning and skills. To date, since March of 2020, only 3 prisoners in our general population have tested positive, and I'm sure members will agree that that is a remarkable statistic. It is appropriate on this occasion that we acknowledge this achievement and recognise that this is a credit to everyone working within our prisons. Mr Speaker, when we consider the immense contribution prison staff have made in the past and are making under difficult circumstances right now, it is right that we also do everything we can to support them. That is why I welcome the reports that I'm publishing today. Dealing firstly with the provision for operational staff, that is those currently serving, the report recognises the efforts the Prison Service has been making as part of its Prisons 2020 programme and commends the service for what has been delivered within the finite resources available. But it will be no surprise to members that much more needs to be done. The report makes 12 key recommendations which focus on staff recruitment, staff training, supervision, mental health awareness and resilience, HR systems and processes, critical incident procedures and psychological interventions and counselling. While many of the recommendations will be straightforward to implement, others will take more time because services will have to be procured and additional funding secured. A small number of recommendations will also require discussion with the Department of Finance as the department with responsibility for Northern Ireland Civil Service HR policies, procedures and practices. In publishing the recommendations, I am also publishing an action plan with very clear timescales for implementation. I believe, and my view is shared by the authors of the report, that those plans are approaching implementation with commitment and ambition, not least in the context of the current pressures caused by the pandemic. In reading this report, one thing is clear. There is no easy or quick solution. A menu of measures is needed if we are to support our prison staff in the way we should. That is what this report highlights and what I am committed to provide as we move forward. I have asked the Director-General to lead an internal implementation group and to report to me on progress as it is made. I will also be asking Siobhan and Gillian to evaluate the progress we are making. It will of course be important to ensure staff are kept updated as progress on implementing these recommendations is made. Turning to the report focusing on retired staff, I share the view expressed by many members of this House that the lack of bespoke support available for former prison officers when compared to that available to former members of the police through the Police Rehabilitation and Retraining Trust is a glaring omission. That is something that must and will be addressed, and I want to assure members that I am committed to putting a delivery model, as recommended by Graham Walker, in place later this year. It will take time to make the necessary arrangements, and funding, all in a very challenging financial environment, will have to be secured. But I am aiming to have a provider in place by October 2021. We should not underestimate the scale of the challenge we will face in addressing the needs of former staff, and it will take considerable time.
The Minister that for my part on the Justice Committee, this will be something that we will want to engage with her department on. Can I welcome the PRRT recommendation for retired officers? I've said it before, I have family members that served in the prison service, and the Minister is right. This was a glaring omission at the time. People paid off when the maids were closed and then felt abandoned and not given the support that they should have been given. And so I want to particularly welcome the outworkings of that. I want to also thank the member for East Belfast, Mr Little and Mr Beattie from Upper Bann, because they've shown an interest in all of this as well, and indeed this is the outworkings of some of those endeavours, and I know that they'll continue to raise these issues going forward. In terms of the resources that will be needed for this, has there been an estimate around the costings associated with the full implementations of these recommendations, and how soon will those figures crystallise so that we can get into engaging with the Department of Finance in respect of that?
Well, I mean, I thank the Chairman for his remarks and his very supportive remarks around these reports. I agree with him entirely that whilst serving prison officers have access to the police PRRT, unfortunately that same access is not available currently to former prison officers, and I do think that that is a glaring omission and something which we want to address. Since taking office just over a year ago, I have met prison officers and I've seen it firsthand, the very vital role that they play in keeping people in their care safe, and I'm also well aware of the challenges that they face. Many of the recommendations will be relatively straightforward and can be met within our current budgets. But however, there are others that will have to be about reprioritising some of our funding, and that's something obviously that we will want to discuss with the committee in due course. However, there are others, and the member is of course right, that will require additional new funding, some of which could be significant, and it will be challenging, I think, in the context of the challenges that already face the department. However, I'm committed to working with the Department of Finance and indeed with other executive colleagues, because we should remember that the mental health of our prison officers is not a standalone issue for the Department of Justice. It is a matter for the entire executive, because these are citizens in Northern Ireland who may be struggling with their mental health because of the service that they're giving in respect of the community, and therefore I think all departments have a role to play in terms of assisting us to reach our objective of having proper support in place. So I will be engaging with the committee when we have more detailed figures around the costings, and we'll also be engaging with them, hopefully constructively, in order to be able to get support as we discuss some of the more complex HR issues, in particular with the Department of Finance, as we take this forward.
Thank you, and I call Linda Dillon.
Thank you, and thank the Minister for her statement. And I would also like to thank the authors of both these reports. And I welcome the fact that Siobhan and Gillian will be evaluating the progress of the recommendations. I think that's really important. There seems to be an expectation almost that stress is an inevitable consequence of working in the prison system, and I think that in the right conditions staff shouldn't have to think that this is what awaits them, that this is what lies before them. And I did actually meet with staff in McGabry. It seems like a long time ago. I think it was around October time. It was whenever obviously things were loosening up a wee bit, and I was able to go in and meet with them, and I think it was a really important process to meet with staff, and that was without management, to give them an opportunity to highlight the issues that they have and what concerns they have, but it also gave them an opportunity to tell me about the things that they think is working and the improvements that they have made. So I just think the key to dealing with this is in recognising the signs early, and early intervention is absolutely vital, and also obviously prevention. We can't prevent it in all cases, but early intervention is vital. And does the Minister's action plan include actions relating to early intervention and prevention?
Well, I thank the member, and I know that she has a particular interest and has visited the prisons and spoken with officers, and will be aware of the particularly challenging circumstances under which they've been working, and particularly, I have to say, during the COVID situation. And they have, I think, done an incredible job in that regard, Mr. Speaker. In terms of the wider issue of early intervention, I think that is absolutely crucial, and I think that not just responding to issues which may cause people distress and harm, but actually building resilience prior to that is included within the report, particularly in terms, first of all, of engaging with families during the recruitment and training process, because I think that there is a family resilience issue. We know that when prison officers go home, the threat against them follows them there, and that can often be very distressing for members of their family, but also those, for example, who have come across extremely distressing incidents while they're in the prison, whether that be an act of violence, whether it be an act of self-harm, an attempted suicide, or indeed a suicide that has taken place in the prison. It can be a very traumatic experience for those officers who come across that in the course of their work. And just dealing with people who have, at times, very complex needs in itself can provide a challenge. So I think engaging with families in a more holistic way is one part of the early intervention. I think trying to build resilience in terms of individual officers, so people have coping strategies, but also I think having the opportunity for them to know exactly where to go and improving signposting to access services, because I think it's important to say that whilst the report sets out the work that needs to be done, it also recognises that there is a considerable amount of work already happening within the prisons. As you know, the Prison Service launched Prisons Well in March 2019, which is an employee wellbeing programme based around 4 key strands: support, inform, prevent and assist. And that has been ongoing within the prison system over the last year. So there are important pieces of progress being made already. What we hope to do through these reports is be able to consolidate and build on that, and I think particularly focus on trying to build resilience, but also support those who perhaps, despite the investment that they've made in resilience, still find some of the work that they do quite traumatic and disturbing.
I call Matthew O'Toole.
Thank you, Mr. Speaker. Thank the Minister for coming in and briefing us on this today. Certainly as a party we would welcome both of these reports, the findings, very welcome that action is being taken on them. Can I just ask to go back to the question of budget allocations? I know the Minister touched on it earlier on, but I'm not entirely clear what the position is. Has an allocation been, will there be an allocation made in 2021-22 in the draft budget that's just been published, or will you be seeking a specific allocation from the Finance Minister in the weeks ahead as he goes through the consultation period?
Just to clarify, in terms of many of the recommendations that will be able to be implemented quickly, we would see most of those being relatively straightforward and able to be implemented within a few months, and those would mainly be able to be implemented from existing resources or from reprioritising current funding that we have available to the department. There are others for which more significant funding will have to be secured, but I think that that will be done in discussion with the Department of Finance, both during the current budget round, but also, I think, crucially, in future monitoring rounds, because I think that some of this will have, if you like, an initial start-up cost that may be able to be funded out of one particular year, and that the running costs may be something that we would be able to absorb within the department going forward.
I call Doug Beattie.
Thank you, Mr. Speaker, and I thank the Minister for bringing this report forward. I think it's a really good report, and I must commend those people who brought it to us. I mean, it really does address so many issues, and there's so many questions that you need to ask, and we are only down to one. But you know, I guess for me, recommendation 6, which talks about human resource, looking at our prison officers and making this point that those suffering from mental health issues are not inefficient, and that is a motion I brought before this Assembly previously. Unfortunately, it did not carry. But sometimes you can lose the battle, but you can win the war. But can I just ask the Minister, you will know that mental health issues can be exacerbated by increase in workload. And this increase in workload can be due to serious staffing issues, and I know the night custody officers have serious staffing issues, and that might be adding to that. Could you outline how we are in the short, medium or long term trying to address those staffing issues?
I thank Doug Beattie for his question, but also I want to thank him for the work that he has done on this in respect of raising issues around prison service, because I think, as the chairman of the committee recognises, it is an area where he's shown particular interest, and I appreciate very much the questions that he has raised on this and the light that he has shone on these issues. I think it's hugely important that members of the Assembly do take an active interest. As I've said, Linda Dillon also is somebody who has visited the prisons and engaged with officers on site and actually seen some of the work that they're doing, and I think that that is important, because so often people don't understand the prison system and indeed the work that is done. Prison Service has continued to recruit operational staff throughout 2020, including custody prison officers, night custody officers and prisoner custody officers. Since January 2020, 114 people have been recruited, and there are 18 individuals currently undergoing training, including 16 night custody officers. There are also plans to bring in further night custody officers before the end of this financial year. However, as with other frontline services, prisons has been impacted by the pandemic and the recent increase in community transmission. While the numbers of operational prison staff who have contracted the virus or are self-isolating are fluid, approximately 8% of the staff are currently unavailable. I think it is to the credit, Mr. Speaker, of the management and staff that this has not impacted on the support being provided to people in their care, and a landing-based regime has been maintained throughout the pandemic. However, the member has rightly stated that often additional workload can lead to additional stress. and of course mental health issues are a particular concern and consideration. As of the 20th of January, out of an operational staffing level of approximately 1,350 officers, 36 officers were absent on sickness absence due to stress, depression or anxiety, including both work-related and personal mental health issues. There are currently 29 officers attending PRRT in relation to psychology, and additional 3 waiting to start.
I call Chris Little.
Thank you, Mr Speaker. I thank the Minister for her important statement and for the work of the review team she appointed. I believe this is a significant day in the ongoing work to deliver adequate support services for our prison officers, and I'm grateful and proud that it's an Alliance Party Justice Minister showing leadership on this issue. Particularly welcome the recommendation to extend PRT support services to former prison officers who sacrificed everything for everyone in our community. And can I ask the Minister if there is a timescale for the implementation of this particular recommendation, and if she will need executive support to fund this vital provision?
Well, I thank the member for his question, and again, he is one of the members of this House who has shown a particular interest in the well-being of prison officers and the challenges, particularly in relation to retired prison officers, but not solely in relation to them. He is also somebody who has very actively campaigned for the extension of PRRT services to prison officers, and so I anticipated that he would be delighted at that particular recommendation, and I'm not surprised that that's the one that he has honed in on, though there are many other good recommendations in the report. In terms of the time frame, the hope would be that we are able to commission a service around October of this year. And yes, it will be one that will require some additional funding and investment. And again, that is where the cooperation, I think, of other executive ministers and indeed the Department of Finance will be required, because I think that this is an important part of ensuring that staff who are about to leave the prison service and move on after a period of service with us are able to go back out into the community and play a constructive role and be economically active and healthy. And that has a benefit in terms of our economy, in terms of our health service, and in terms indeed of the benefit system, if we can have people transition successfully from prison service into other lines of work at the end of their career. So it's certainly not only a justice matter, and it's one that we will want to work on in a cross-cutting way, but it is one that I anticipate we can take forward at pace. And I wouldn't anticipate, I have to say, resistance from the executive on this point, because to date they have been hugely supportive of the work we've undertaken in this regard, in terms of trying to develop the right support services for frontline workers.
I call Orlia Flynn.
And I also thank the Minister for today's important statement. Minister, we know that levels of sickness and absenteeism are disproportionately higher here in comparison with other jurisdictions. And I'm just wondering on that basis if the Department of the Minister, if there has been any assessments carried out on looking at how those levels vary across the different prison sites. Thank you.
I mean, it is a valid point, because if you look at prison systems in other parts of these islands, the levels of absenteeism are lower. However, it is worth bearing in mind that unlike in Northern Ireland, prison officers there, when they go home at night, are by and large removed from the influence of the people whom they're serving during the day. Unfortunately, with our prison staff, they go home often under severe threat, and we should remember that that causes a lot of stress and anxiety that members of the community more widely may not be necessarily aware of. We have all seen the incidents where names of prison officers have been placed on walls, on placards, on bonfires and other places, and that kind of intimidation takes its toll, not only on the mental health of the prison officer themselves, but of their family and their friends. And so we are very conscious that there are additional stresses in terms of prison work here that perhaps don't exist in other places. However, when the member has time, I think, to read the full report, you will see that there has been good analysis done in terms of the different causes of stress stress for prison officers, and the evidence base within the reports is quite robust. I think the key for us is to look at what we can do to try to help those officers who genuinely are struggling with anxiety and with stress and with depression, in order that they can find a way through that and be able to continue to work as prison officers in an environment that is supportive and safe for them. And I believe that that is what the vast majority of people who are currently off sick within prison service actually want to be able to do. I think it's also worth noting that absenteeism within prison service, whilst it's higher than in other parts of these islands, and indeed whilst it's higher than, for example, within the PSNI, it is an incredibly unique environment, and I think we do need to take that into account when we look at the figures, because, as I say, people are spending all day in quite intense situations which are quite emotionally draining in some cases. I have to say that much of the work that has been done in terms of the existing support for our prison staff has shown an improvement in terms of being able to get people back into their employment, but it's not obviously possible in all cases.
Call Gordon Dunn.
Thank the Minister for her statement, and we appreciate the effort that has been put in to try and address these issues. We all appreciate the good work of the prison service as they carry out their business against the ongoing threat and the risks from COVID-19 in the workplace. In relation to Recommendation 12, which focuses on HR and occupational health support, does the Minister recognise the need for further investment to save? I think we're all concerned about the sickness level. As mentioned in Recommendation 12, it talks about the sickness absence being in excess of £3 million per year for the last 3 years, which I think we're all concerned about. I think more needs to be done, obviously, to support prison staff and to increase the efficiency of the workplace, of the workforce.
Mr. Speaker, I think the member makes a very valid point, because, I mean, absenteeism does cost the prison service money, does cost us money in terms of running the prison service, and obviously, as other members have already alluded, it also puts other members under pressure because people are having to take up the slack when people are absent, even if that absence is justified and with very good reason. My hope would be that people would see the opportunity through this report and the recommendations within it to be able to support people to be able to work through the issues that they have, to be able to continue to be able to come to the workplace confidently and well, and be able to continue to work with shorter absences or indeed no absences at all. And the money that would be saved from that upfront investment, I think, would more than justify the investment that we would have to put in at the start to make that happen. But as with all finances, and members are aware, having seen draft budgets and other things, money is very tight. But I agree with the member that an invest to save argument can definitely be made in this context, because I think that the money that we invest at this stage will be recouped in more and better attendance down the line, where people feel better supported and where their mental health is in a better position.
And I call John O'Dowd.
Minister, quite rightly in your statement you point out that many people in our prisons are vulnerable, suffering from mental health issues, and if we had a different system, maybe in different centres of care. But with the high levels of sick leave for prison officers, what is the Minister doing to ensure that staffing levels are correct, to ensure that the vulnerable are being looked after and there's not more pressure being placed on those prison officers who are in post? So we have a service that is about care and rehabilitation.
Well, the member will be aware from my answer to a previous question in that regard that as things happen, we are also recruiting new officers and have continued to do so. We continue to recruit new night custody officers, prisoner custody officers and custody prison officers, and we have recruited, I think, since January last year, 114 officers, and we have 18 individuals currently undergoing training at the moment. So we continue to recruit. We also continue to manage very carefully the resources we have, and members will be aware of the work that I did during COVID to ensure that prison officers who did have to work longer shifts, for example, in order to be able to manage the particular risks of COVID, were able to be recompensed adequately for that, because we do recognise that it is a challenging environment and that we do have to be properly staffed. One of the things that we did at the outset of COVID-19 was make a strategic decision that where it was possible we would not have a 23-hour, 24-hour-a-day lockdown for prisoners, because I don't believe that that is sustainable, and I think that that's obvious now that we're over a year into this. While some people may have thought it was an easy way forward when we expected this crisis might last 6 weeks, we didn't feel that it was tolerable. We also didn't believe that it was good for prisoners' mental health or indeed for the staff mental health, because I have to say that the two are intimately linked. If you find somebody who has been self-harming or attempted suicide, that is a very traumatic experience, and so it's in everybody's interest for people to have better mental health and well-being within the prisons. We've worked very hard to ensure that we've ended doubling up within the prisons as one means of transmission control, but also to put the kind of controls in to ensure that COVID is not being spread within the prisons. And we've worked on a landing-based regime that allows us to use our staff to best effect, so that people still have some association time, they still have the opportunity to get some training, but also they have the opportunity to get exercise and all of the other things that contribute well to people's mental health and well-being. Because I recognise very much that keeping people in their cells for long periods of time, whilst it looks like a simple solution, is actually the cause of much more harm and much more difficulty. What we have found, I have to say, as a result of that and the work that the Director General and others have done in terms of their communication with prisoners about the regime and how it would be managed, is that we have seen, I think, quite extraordinary levels of cooperation between the prisoners and the prison staff. And I think that stands testament to the fact that there has been a huge transformation in the environment in the prisons and in the overall relationships between the prison officers and the prisoners themselves, where people recognise that the prison officers are acting in their best interests and are willing to cooperate and work with them. I think that was most notable when virtual visiting was first being introduced, and indeed when in-person visiting was reintroduced, where many prisoners discussed it with the prison staff and decided on balance not to ask family to come to the prison even though they could, because they felt it was safer not to, and they continued with virtual visiting and have been really, I think, finding some benefit from it. I suppose one of the things that we have noticed from virtual visiting is just the benefit of prisoners being able to see inside their own home, to see their family interacting in a more normal setting than perhaps in a visitor centre, being able to see their pets. These seem like small things, but when you haven't seen them for a long time, they make a huge difference to people in terms of their mental health. And all of those things, I think, have helped, but obviously they're not a replacement for in-person visiting, though we do intend to keep virtual visiting in place afterwards. So all in all, in terms of staffing, it has required really careful management by the prison management, but it hasn't impacted negatively in terms of prisoners being able to have access to some training and skills via virtual means, and also access to association and exercise, because we do believe genuinely that we have to still focus on rehabilitation. Many prisoners will finish their sentence during the COVID crisis, and so it isn't just or fair that they would be deprived in some way unnecessarily of the preparatory work that needs to go into giving them the best possible start when they come out of prison.
I call Robbie Butler.
Thank you, Mr Deputy Speaker, and I thank the Minister for bringing the report to us today. And the review is indeed very positive. I want to thank the team for the work they've put into the review for supporting prison officers and those that are retired. Minister, the issue of high levels of sickness has been brought up on a number of occasions. I'd also like to bring to your attention what I believe to be high rates of early ill health retirement, predominantly due to mental ill health, work-related stress and sometimes PTSD. And I want to thank the Minister for her positive response to my first iteration of a private member's bill to help tackle that. But Minister, looking at the report, there's just something I want to take issue with, and hopefully you can pour some light on. It says that incidents of assaults went down from 2014-15 from 112 to around 26 to 33 recently. But I have been told, Minister, that assaults aren't being recorded in the manner in which they would have been when I worked there. I've been told, for instance, that if someone empties a cup of urine on a prison officer, it's not counted as an assault. Are we confident that when we're looking at a reduction in assaults that we're talking about the same thing, and that we're not looking at figures that might not mean what they do?
Well, look, I thank the member for bringing that to my attention. Yes, as far as I'm aware, the figures in terms of the recordings would still qualify as assaults in terms of what would be recorded. However, they may be recorded, if you like, there may be nuance in the recording that wasn't there previously. But I'm happy to return to that with the member in due course and get some confirmation of that on his behalf, because I recognise that assaults are not just physical and violent assaults. There can be other assaults that are exerted on people when they're in the prisons, and there can be very challenging environments. There can also be people who, through mental health issues and indeed other behavioural issues, can be very challenging and difficult to deal with, but might not qualify, if you like, as an assault on an officer. It's simply a behavioural problem that you're managing, and that can be challenging for officers. But I will come back to the member on that, because it's important that we have confidence where we see this kind of improvement. However, one of the things that I would say is, if you look at the overall picture, the reduction in self-harming, the reduction in the number of suicide attempts and suicides in the prisons, the reduction in the number of violent assaults, all of those things are moving in the right direction, and the trajectory is the right direction. So whilst I'm not for a minute saying that we can be complacent, because any life lost in the prison system, anyone harmed in the prison system is one too many. But I think the overall pattern is improving dramatically, and I think that that is in large part due to leadership, not just from the management of the prison service, but actually from the officers themselves.
I call Kelly Armstrong.
Thank you, Deputy Speaker, and thank you, Minister, for your statement today. It's not very often on Monday morning, or Monday afternoon, that we get good news, and this is certainly good news coming forward. I will always support any actions that help people to do their job and support their mental health. With respect to former prison officers, could I ask if the Minister agrees that we should be basing this all on need, given the glaring admission that retired prison officers have not been able to avail of PRRT, and knowing that many have been suffering in silence, unsure where to go to seek the support that they need in an appropriate environment?
I agree entirely with the member that it is important that this is needs-based, and also that it is trauma-informed work that we do with prison officers, because it is a unique environment and it is a challenging environment, and it's important that the offer that we present to them is one that is bespoke to the service. I think it's also important to recognise that it is potentially quite a large cohort of people, many of whom have left the prison service in recent years, but some who will have left the prison service quite a while ago, but still not fully rehabilitated, still not being able to find employment, and still require more support in terms of their own mental health and well-being. So I think the important thing is that we're able to establish the services, and then we can start to address how we meet those needs and how we make sure that people are aware of it through signposting and other things. And I think the Prison Officers Association and others indeed would be, I think, more than able to ensure that former officers as well as current officers would be fully aware of the services that we hope to be able to commission later this year.
I call Rachel Woods.
Mr Deputy Speaker, and I thank the Minister for her statement today and the reports, and also thanks to the review team who I was able to meet with, along with a number of constituents, to raise their issues. And some of the recommendations do reflect the conversations that we had. But like Mr Beattie, I wish to ask with regard to recommendation 6 and the wording of letters sent to staff. And I'm aware that this is under the Department of Finance, but is the Minister content with the revised wording? And is she aware if the use of the term inefficiency is still being used?
With respect to NIC's HR policy, as you'll be aware, it is a matter for the Department of Finance. However, I think with this report, and the member I'm sure will agree with me, what it shows is that a one-size-fits-all policy when it comes to HR for people who perhaps are desk-bound in their jobs, and comparing that in terms of management to those who are within the prison system may not be the best way forward. And I think we've discussed this on a number of occasions. As things stand at the moment, it is a matter for the Department of Finance, but it is one of the areas where I believe that we do need to have further discussions, because I believe that there has to be some consideration given to the particular context in which people are working. And I agree with the challenges around the wording of such letters, because whilst it may be standard in terms of saying that there are issues of inefficiency, and indeed it may be appropriate in some cases to say that there are issues of inefficiency. Where it relates to someone's mental health, I think we do have to tread very carefully, because I think to suggest that someone who has mental health issues is simply inefficient sufficient is not a helpful start in terms of trying to rehabilitate and support them through what may be very difficult times. We're acutely aware of that challenge, and I think that that's reflected in the detail of the reports, and hopefully will be reflected also if the member looks at the action plan and the engagement that I hope to have with the Department of Finance on these issues.
I call Jim Allister.
Minister, there would be a number of former prison officers who, having been injured and otherwise suffered in the terrorist campaign, would be expecting to be beneficiaries of the victims' pension. Have you any news for them? And can you comment on the fact that at last Wednesday's Finance Committee meeting, we were told from an official from the Executive Office that the cost of the pension for next year, if it was in payment, would be £21.6 million, which is a long way shy of the exaggerated figures that some have been putting around.
Well, Mr Speaker, you'll be conscious that this does only tangentially touch on this issue, but I'm more than happy to provide the member with an update. With respect to the opening date for applications for the scheme, we are currently on track to meet the opening application of the beginning of March, which is what I'd set out in the department. He will appreciate that there are a lot of moving parts, and so that I say that with a degree of caution. I would give it a green rating, but given the high-risk nature of the work and the fact that it is being done in a very pressured environment, I would have to maybe downgrade that to an amber risk, just simply because anything at this stage could go wrong and not all things are within my gift. However, we're making good progress in terms of the applications process itself, in terms of the design of the forms, in terms of being able to have the medical assessment contracts in place, in terms of being able to have the computer systems in place in order to receive applications, and all of those things which are within my remit have moved as I would have hoped. And so we are hopeful that we will be able to open in mid-March. With respect to the issue of funding, the funding that has been discussed publicly are whole life costs, not one-year costs. So we need to be cautious about comparing what is a one-year cost with a whole life cost. The costs that were estimated, I think I said at the time, those that ran through the Government Actuarial Service ranged, I think, around 165 million initially, and that was when the focus was mainly on those who were severely physically injured. We then have a scheme that has both expanded in terms of, first of all, the geography of who can apply, has expanded in terms of the fact that psychological injury has also been introduced into the mix, but also at a reduced level of psychological injury that they would qualify. And the initial estimates around that were that there could be 7 to 8 times the number of people who could apply than were initially estimated when it was estimated at 168,000. So the member will be able very quickly in his head to see where the upper estimate came from. However, as I said at the time, it came with a health warning because it was a very rough back-of-the-envelope type calculation. It hadn't been through the government actuary, and indeed there would be overlap between those who had both psychological and physical injury, so it wouldn't necessarily be as straightforward. The work on that is being taken forward by the Executive Office. They are working very hard to try to identify the cohort of people who may apply and to work out to what degree that is likely to increase cost. My expectation is, Mr Speaker, that it will be greater in terms of whole life cost than the 165 million, and significantly so. However, I would also expect that it will be less than the 800 million upper figure, which was always a ceiling in terms of our preparedness. I think what also has to be borne in mind, and I say this to members, is that some people, given their age and their ill health, may decide that rather than take the pension as a regular payment, they may choose to take a 10-year lump sum in lieu. And so the start-up costs, given that we also have back payments to make with respect to the pension, because obviously we have to pay back to the date when this was actually commenced. So when you add all that together, the start-up costs are likely to be quite challenging for the Executive to meet, and I would be fairly confident in saying that that will be difficult. The routine costs, the annual costs in terms of paying out the pension, may be more manageable for Executive finances. So the discussion that we hope to have, and we have requested with the Secretary of State, is to what degree they can assist us with the start-up costs of the scheme. because I believe that if we can get over that hurdle, we will be in a much stronger position to be able to put the pension in place. And I also believe that it is right that the Executive and Assembly should make a contribution to the scheme, but I also believe that the UK Government have a significant contribution that they ought to make with respect to the scheme. However, the finances notwithstanding, that is not my role. It is for TEO, and the courts have ruled on this. It is for TEO to get the funding and deliver it to my department to deliver the scheme. My focus is on making sure that there is a scheme to deliver it to, and that people can start to submit their applications come March of this year.
And that concludes questions to the Minister on the statement. I would ask members to take their ease for a few moments. Order, members. The Speaker has also received notice from the Finance Minister that he wishes to make a statement. Minister.
I wish to provide members with an update on the 2020-21 January monitoring round. Members will be aware after the October monitoring round £100 million of COVID funding was held in reserve. All other available resource funding had been allocated and Capital Dale was overcommitted by £12.7 million. On the 5th of November, the British Government announced a further £400 million in COVID resource funding. On the 23rd of November, the Executive agreed allocations which included £300 million of support for businesses. £150 million was held in the hope that it could be carried over for rate support in 2021 to 22. £26 million of resource was held in reserve to meet any unforeseen emerging pressures over the remaining 4 months of the year. Shortly before Christmas, the Treasury increased the guaranteed COVID funding available to the Executive to £3 billion, an uplift of a further £200 million. Due to the late stage of the financial year in which this has been provided, it is anticipated that the Treasury will agree to our request to carry this forward. Therefore, this amount has not been considered as part of this monitoring round. Departments have declared significant level of reduced requirements in relation to previous COVID allocations, resulting in £219.2 million resource being available for allocation. In view of the additional £200 million now available, which the Executive should be able to carry forward to next year, I have made the £150 million previously held for further rate support available for allocation now. Reduced requirements for totaling £105.4 million resource have been declared by the Department for the Economy, the most significant of which is the £93 million allocated for the High Street Support Scheme. The Department of Health has surrendered £90 million of the funding previously provided for the COVID response. It has now been confirmed the Treasury will directly fund pressures arising from an increased carry forward of annual leave, and this, along with the contribution for the Department for Transport for airport support, will free up £66.6 million of previously allocated COVID funding. Latest forecasts of the regional rate income show that £46.4 million previously provided for rate relief measures will not now be required, reflecting a reduced cost rather than a reduction in the support being provided. Taking account of these changes, the total amount of COVID funding available for allocation is now £509.8 million. The £60 million previously held centrally to support business and the £1.6 million held for the transport sector have now been provided to the Department of Economy and the Department of Infrastructure. In addition, departments have bid for a further £215.6 million in relation to COVID support. And while ministers are considering what further support can be provided, it is important that there is no delay in delivering the support already identified. Therefore, departmental bids have been met in full. Details of the allocations are shown in the tables provided with this statement. Including the £60 million previously held centrally, the Department for the Economy has been provided with £154.5 million to provide much-needed support to individuals and businesses in the financial year. This includes further support for tourism and hospitality, small businesses and company directors. The Department for Education will receive £7.5 million to continue the response to COVID-19 in schools and to extend the Lost Learning programme to special schools. My own department will receive £101.6 million, including £100 million to extend the localised restriction support scheme in view of the new restrictions, and £0.6 million to provide rate relief for local newspapers, which are a key part of the fabric of our society. The Department for Infrastructure will receive £20.1 million to help address the impact of COVID on that department. And there remains some £294 million of COVID funding available for allocation, and I have asked all ministers to bring forward proposals for further support as a matter of urgency. Turning now to non-COVID spending, departments have surrendered £93.9 million resource DEL, £55.7 million capital DEL and £12 million financial transactions capital in this exercise. On resource DEL, reduced requirements include £23.8 million declared by the Department of Health, £10.9 million from the Department of Finance, reflecting the anticipated return of rate relief funding from large supermarkets, £8 million declared by the Department for Communities as a result of housing benefit for tenants being lower than forecast, and £3.5 million due to delays in recruiting staff for universal credit due to COVID. The Executive Office has surrendered £8.3 million in relation to funding for the historical institutional abuse, and a total of £9.5 million has been returned by the Department for Agriculture, Environmental and Rural Affairs and the Food Standards Agency in relation to the executive funds provided to give certainty ahead of Treasury funding, provided funding in relation to the Brexit Protocol. The Department of Education has surrendered £16.2 million in relation to the Education End-of-Year Flexibility Scheme, a mechanism to facilitate local management of the school's budget. On the capital DEL, the majority of the reduced requirements are a result of project delays, but also reflect some additional receipts. The Department of Health has surrendered £19 million as a result of delays in ICT projects. In the Department for Economy, a reduced requirement has arisen as a result of a £7.8 million repayment of the loan to the Presbyterian Mutual Society. Factoring in changes to centrally held funding, there is £110 million resource DEL, £46.4 million capital DEL and £55.7 million financial transaction capital of non-COVID funding available for allocation in January monitoring. Departments have bid for £98.2 million resource DEL, £24.2 million capital DEL of non-COVID related pressures. However, some of these pressures have been funded directly by the Treasury, leaving remaining pressures of £58.4 million resource DEL and £18.1 million capital DEL. These bids have been met in full, and the allocations include £9.7 million to the Department for the Economy for higher education, quality research and further education colleges pay remit. £45 million has been allocated to the Department for Infrastructure to support the Driver and Vehicle Agency and TransLink. A detail of these allocations is shown in the table accompanying this statement. In order to ensure transparency, the funding provided in relation to COVID response and that from the Executive existing funds has been separately identified. However, it is the overall financial position which should ultimately be considered. After meeting all the department bids and taking COVID and non-COVID funding together, there is unallocated funding of £346.4 million resource DEL, £28.3 million capital DEL and £55.7 million of financial transaction capital. I have encouraged my executive colleagues to utilise the funding available in this financial year. A number of significant proposals have already been identified which the executive will consider later this week. In addition, alongside the Scottish and Welsh Finance Ministers, I have requested increased flexibility to carry forward COVID funding, and I expect a response from Treasury shortly.
I now call the Chair of the Finance Committee, Steve Aiken.
Thank you very much indeed, and may I thank the Minister for meeting with me earlier today. And probably one of the more unusual conversations we'll ever have with the Finance Minister and the Chair of the Finance Committee is how we get to spend an underspend of a close on £435 million in a very, very short period of time. Mr Deputy Speaker, I think the committee would welcome that all the departmental bids have been met in full, including particularly a further £100 million for the COVID localised restriction support scheme, the replacement funding for the European Social Fund, the £20 million for the company's directors scheme, as well as the Treasury's capital funding for improved broadband through Project Stratum. There are, however, a number of features of this monitoring round which make it very unusual and worthy of deeper scrutiny. Firstly, the Minister advises of £200 million of reduced COVID resource requirements and £100 million of non-COVID reduced resource requirements. After all of the allocations have been made, this has left over £346 million of resources which are still available after this, the final monitoring round of the financial year. That in itself is remarkable. However, this of course has been a remarkable financial year for all, unfortunately for the wrong reasons. In terms of questions, can I ask the Minister if, given the very substantial sums that are left unspent, is the Department to undertake another monitoring round before the end of the financial year? And will he make a further statement on the anticipated other allocations in a timely manner? Can the Minister also advise on the likelihood of a substantially increased carryover facility for unspent funding into the next financial years? This is particularly important in areas of health. Will such carried over amounts be hypothecated as COVID, or will the Executive have full discretion in respect of its spending? I welcome the discussions the Minister is having with the other finance ministers, but obviously it would be very welcome if we had a statement from the Treasury sooner rather than later, if we were capable of doing this. Can the Minister also explain something about some of the other issues? And I'll be brief, Mr Deputy Speaker. I refer to the £35 million of reduced capital requirements relating to ICT projects in different departments. Can the Minister advise, is there a department-wide problem getting ICT project money spent, as there appears to be? And finally, can he explain about the allocations from the Treasury in respect of the £8.5 million for annual leave accrual in the departments for the economy, education and infrastructure? The reduction in the taking of annual leave in year appears to coincide, fairly neatly, with the reduction in sick leave which NISRA has reported in the civil service in the first quarter of this financial year and coinciding with the lockdown. Can the Minister therefore advise if there is a problem with the management of civil service sick leave and annual leave?
The member has asked several questions there. Latitude is given to chair of committees, but I would urge all members and chair of the committees to be more concise. Minister.
Thank you very much, Minister, and I must indeed thank the Deputy of the Committee
Minister,
for his remarks.
Order. We're at question time here. Question to the Minister. Minister.
I thank the Chairman for his range of questions. I'll try and deal with them as briefly as I can. The first question was, would we be doing a further monitoring round? As I had advised him, my intention is, and of course this is a matter for the Executive to agree, but given the amount of money that we need to spend out before the end of the financial year and the shortness of time, that we allocate as schemes come in, rather than kind of corral them all into a single statement. But there may be an opportunity at various stages during that to make additional statements, which he went on to ask. So I don't anticipate another monitoring round, but I do anticipate keeping the Assembly and obviously with executive approval, the Assembly advised, and the Finance Committee in particular advised, in relation to spending over the next number of weeks. The question in terms of carryover, of course, we are alongside Wales and Scotland, who are facing similar issues in terms of trying to deal with the COVID allocations they have had. Our pressing Treasury for flexibility to carry over more. We have some degree, I suppose, of assurance in terms of the money we received very late on, just prior to Christmas, £200 million. Some degree of assurance in that, but of course I think the more that we could carry over into the new financial year of the money that we have available, then the better for us, because we face very significant pressures next year. Now, the question around discretion in terms of how that is spent is something that we'll have to bottom out with Treasury once we get the flexibility explored. But I do expect to hear something from them this week. And of course I can advise Assembly once I do hear that. The ICT, the issue that I related to in the statement was specifically in relation to the Department of Health, and so I don't know if it points up to any bigger particular problem across departments other than that, but we can certainly make some inquiries. And the annual leave accrual, these were costs that people had set aside COVID money for, but were then met by Treasury. So there was a range of costs that had been met by Treasury, I think it amounted to some 60-odd million, which then meant that money was back in the pot again for dispersal as part of COVID. It's added to our pot. So whether that is the cost in terms of reduction of that and the costs that have been met by Treasury, obviously, in relation to some of that, but whether that coincides with the sick leave issue, I don't know. We're going to have to, I suppose, analyse that. But I know that there has been a reduction in sick leave over the course of the year, and perhaps that does, I think, maybe point to a way of working going forward. I don't know which to extend this, but the flexibility that people have working from home and be able to do family arrangements perhaps does lead to a reduction in sick leave, where people are obliged to take that to meet other family pressures. So I think we will be into different ways of working when we come out the other side of this pandemic, and hopefully better ways of working which are more productive for staff all around.
I call Paul Free.
Thank you, Mr Deputy Speaker. 430 million unallocated. 346 million of that is resource. The Health Minister, with all the department's pressures and waiting lists, has returned 90 million alone. What explanation goes from this House and this Finance Minister to the plethora of people who have been deprived of earning a living, of providing for their family, who have received very little support this past month, if at all? And all the people relying on healthcare at this time, waiting, sitting, waiting on waiting lists. What explanation, Minister, can you give?
Well, in relation to people who have not yet received support, firstly, I've urged all ministers to come forward with propositions to spend this money. As I said at the beginning of my statement, in November we had allocated all the COVID money available to us. So there wasn't a question of people sitting on this pot and then running out of time at the end of the year. We had allocated all, bar 150 million we were carrying over for rates relief next year, which was something that was very widely requested by the business community, and 26 million. We actually had a concern that we left ourselves short if we ended up in a situation post-Christmas where we had now the situation we're in of extended lockdown scenario. I have asked ministers to bring forward propositions to assist in spending this out. I've asked them to prioritise sectors within their remit that have not yet received funding for whatever reason, and some schemes are very difficult to put together. Verification of who's in various sectors and how much they've earned or lost, all of these things are very challenging. But I've asked people to prioritise, in particular those who have not yet received any support, because I think they would be most aggrieved if we ended up with some return money at the end of the financial year. In relation to the Health Department, it will be up for the Minister for Health to explain, I suppose, where the 90 million was surrendered from. I have to say, though, and this is just my general experience, the Health Department and health has been so under-resourced for many years that their ability to do too many things at one time is severely restricted because capacity is not there. That's a consequence of years and years of austerity cuts to the Health Department. And it's not a consequence just of this year, because the Health Department struggles every year with winter pressures, and this year they have a pandemic on top of that. So the ability to concentrate in other areas in terms of waiting lists and things like that, I have no doubt have been very challenging, but the Health Minister could explain all of that better.
I call John O'Dowd.
Minister, students have had an awful year. They're paying rent for accommodation they cannot use. Their educational experience is less than optimum despite the best efforts of their tutors and their colleges and universities. Minister, would you look sympathetically on a bid from Diane Dawes, the Economy Minister, if she was to come forward with a bid to compensate our students for their rent and tuition fees?
Well, I concur with them entirely in relation to the difficulties students have faced. Many people, I suppose, like the rest of us, not knowing the course the pandemic was going to take, undertook contracts for rental of properties, which they then weren't able to use, and their ability to attend schools and get the adequate level of tuition that they would have expected in normal circumstances has obviously been much restricted, and as a consequence hardship among students has grown, and there is evidence for that. So I have spoken to the Economy Minister. I have said that I think students is one area where they should try and identify some additional support. I think she's intent on doing that, so I look forward to some bid from her. Quite precisely what it's intended to address, I suppose, will be a matter for the Department for the Economy, but I would encourage them to talk to student organisations and to get some advice from them as to where the pressures are being most felt by students at this time, and to make sure that they apply sufficient resource to try and address that.
I call Matthew O'Toole.
Thank you, Deputy Speaker. I don't know whether the Finance Minister is a Pink Floyd fan or whether he's ever listened to Dark Side of the Moon, but when I look through the monitoring returns, I'm reminded of the lyric Minister plans that either come to naught or half a page of scribbled lines. Notwithstanding the incompetence of departments like Economy and the indifference of London, wasn't it the job of his department to corral a single strategy to make financial allocations to get us through this COVID crisis? When will he come forward with that plan, and will he guarantee that we'll avoid the huge underspends that now, I'm afraid, look very likely?
Well, I am a fan of Pink Floyd, and I have listened to Dark Side of the Moon. I can't recall that particular lyric, I have to say, but I obviously haven't listened to it enough. But can I say, he knows this because he's been in for every statement I've done in relation to COVID allocations over the course. We have received, over the course of the year, funds with literally maybe 2 days' notice. So when we did all of the allocations in October, we then received a further £400 million in November. We then received a further £200 million in December. So the ability to do any financial plan as to how we were to spend out all of that is impossible, because we have never had any advance notice of the totality of what we were receiving. When we did receive some funds at the end of the summer, in my recollection, we were told that that was it for the year. And in October, we had allocated all of the money available to us. In November, we received an additional £400 million, and we allocated all of that. What we have now and what we're dealing with now is returns from departments who bid for funding to say, give us this money, we can spend it on X, Y and Z schemes, and they now have returned that to us. So that's the difficulty we face. It's not a lack of allocation of money over the period of time, even though it came to us with no forewarning, with no ability to plan out what was available over the course of the year. Had we been told at the start of the financial year, as we entered the pandemic, we were getting £3 billion over the course of the year, I'm sure the Executive could have put together a plan in order to spend that out, but we never had any notice of what the totality of the amount would be. Yet we did manage to allocate all. What we're now dealing with is returned from the department's allocations which they haven't spent.
I call Andrew Muir.
Thank you very much, Mr Deputy Speaker. Back in September, I asked the Communities Minister about the risk of handing money back to Treasury, and she responded and said no surrender, and that it would be a mortal sin to hand money back. But it's very disappointing that risk is now real. Can I ask the Minister, in relation to the LRSS and CBRSS grant schemes, they're very welcome for businesses, but they don't cover all the overheads. Has consideration been given to making a one-off top-up payment to assist those businesses?
Well, can I say in relation to those, and I'm sure ministers with all good intent did intend to spend the money they have. Some of the funding they got is demand-led, and I know, for instance, in particular, the retail, non-essential retail, we were expecting a very significant demand for support of that pre-Christmas, which didn't actually materialise. So we can't go out there and force businesses to apply for some schemes that either you make an assumption, and I'm sure similarly with communities that there are some things that didn't materialise the way they had anticipated. But nonetheless, it does leave us with a significant problem, which we have to address. In relation to the LRSS and the economy scheme, we have sufficient funds because now we're into a much more extended period of lockdown, and some are suggesting, certainly the Health Minister suggested in his last public commentary on this, that even to where he has now brought us in terms of their recommendation to March, that we could be looking at the other side of Easter, possibly. So there will need to be sufficient funds to continue to roll out the payments that we've already established with them. So the ability to make a one-off then a higher level payment in relation to that is restricted. But we are looking, and this morning I was engaged with senior officials in the department to look at where we can get support out to businesses through the information that has been gathered over the year by LPS in terms of the work they've done with a whole variety of businesses. And there are some businesses who didn't avail, for instance, of the 10 and 25k grants earlier in the year, who were above the level of the threshold for that, and they are continuing to struggle. So that's a particular area that we may look at, but we will do all we can, I can assure them, to try and get support out where it's needed.
I call Paul Given.
Deputy Speaker, I have some sympathy for the arguments the Finance Minister makes around the late notice of receiving additional funding from Treasury. However, the public won't have any sympathy. And when they hear the 430 million global figure, they'll be rightly outraged if this money is not spent, given the Executive's decisions to close down businesses, to deprive people of a living. So there is a really big onus upon the Finance Minister to lead the Executive to get this money out. In doing that, whilst departments can make bids, will the Minister in his own department amend the LRRS scheme to support sports clubs? Will he take forward a scheme for travel agents, which I know he met in November, who've asked for a scheme, who have been decimated and had to refund a lot of people that had made bids? And will he ensure that the Department of Health commission the private sector, because individual citizens are commissioning the private sector and there is capacity to do surgeries? It is wholly unacceptable that the Department of Health has handed back £90 million when people should be getting surgery, if not through the NHS, through the private independent sector.
Well, can I say in relation to his general points, I am leading the response in the executive. I have spoken at length in the last number of executive meetings about the need for all ministers to get their departments going and get this money allocated out. I have spoken about the priority being given to people who haven't received support before. In relation to the sports sector, I mean, there are sports funding available through the Department for Communities, which do take into account loss of income, loss of revenue, for including hospitality part. So it's because the difficulty for LPS in relation to that is that the hospitality side of a sports complex, whatever it is, should it be a soccer ground or a Gaelic ground or a rugby ground, is often a very small part of it and is not independently rated from the rest. So there is a problem there. So in order to ensure there's, if you like, a one-stop shop for sports organisations, the Department of Communities will handle that, and they will allocate according to lost income, including lost income from hospitality. In relation to the travel agents, I have every sympathy. I've met them. I've asked my own officials to work with them in the absence of any other department standing up. It's not our responsibility, but I asked my officials to work with them to gather up the information. Again, the difficulty is we have only one paying out agency, which is LPS, which was actually a rates collection agency which repurposed itself to pay out. But most of these people, are certainly a strong proportion of them, don't operate from a premises. They operate from their houses, they operate online, so therefore they don't have a premises which we can attach a payment to. So I have asked the Economy Minister to come forward, because that is a definite sector that have missed out, and to come forward with a scheme in relation to that. And I hope that over the course of this week we will see some attention drawn to that, because there are a small number of sectors that have, for one reason or another, missed out, and the travel agent sector is certainly one of them, and I have every sympathy for finding support for them.
I call Orlia Flynn.
And I thank the Minister for bringing the statement to the House today, and indeed for all of the work that he's done over these past number of months. Would the Minister agree with me that some of the COVID money that's available to the Executive could be or should be used to award a thank you payment to all of our health and social care workers, including our student nurses and our domiciliary care workers, basically as a gesture of gratitude from all of us, to say thank you for the enormous work that they've been carrying out over the past 10-11 months during this unprecedented health crisis. Thank you.
Well, can I say I'm very sympathetic to that idea, and it has been discussed at the Executive, and I know the Health Minister is looking very closely at a proposition in that regard. I think he has the resources within his own department to do that, and I spoke to him at the last Executive meeting about that, because it's something that I think there's a broad level of support across the Executive for. So I would hope to see that proposals around that come forward in the not too distant future. I neglected to answer Mr Gibbons' last question in relation to the Health Department. I apologise, it went out, but I can't direct the Health Department what to do. I mean, others will have to raise questions and issues with the Health Minister. Part of our rules of the department here is that ministers do have autonomy, which is a good thing in many regards, and so it will be up to the Health Department to bring forward propositions. But the point I made to Mr Frew, I have no doubt that there are capacity issues in the Health Department to deal with more than one thing at once, and that's a consequence of years of austerity policies.
I call Gary Middleton.
Thank you, Mr Deputy Speaker. The Minister will be aware that many of the public will be concerned about the currently over £400 million that's currently unspent. Would the Minister agree, and would he be able to address the situation where, for example, the Economy Department, approximately 90 million of theirs was for the voucher scheme, the lack of flexibility for being able to move that ring-fence funding into other areas within the department? Is that something that the Minister can address? Because that would go some way in ensuring that money can be spent.
Well, I think we did address some of the issues with the Department of Economy in terms of ring-fenced and money that they had in flexibility, but the voucher scheme, and we pressed them very hard to try and at least do some portion of the voucher scheme in this financial year to spend out some of the money, but it wasn't possible. So if they had come forward with any ideas to spend out any of that, we would absolutely have supported that, and we give them flexibility in relation to some other COVID money that they had. And that's why we will continue to press Treasury, because while we have money to spend this year, which has come very late on in the financial year to us, we have a real challenge next year because we have a poor budget settlement for next year. And so the more we can get flexibility from Treasury to carry over into the new financial year, then the more pressures that can ease on departments in the next year.
I call Sinead Ennis.
I get last Concolia, and the Minister's statement is very welcome indeed. Mr Deputy Speaker, January monitoring is often a time when funding is allocated to repair roads. Now, I notice that the Infrastructure Minister has not made any bids, any funding bids in that regard, which is disappointing because I know many roads in South Down could certainly benefit from funding of that nature. Would the Minister be open to allocating funding for this purpose if you did receive a bid from the Minister for Infrastructure? Thank you.
Yes, I certainly would. I mean, I live in South Armagh where the roads are equally bad, but I know that the officials were in front of the Infrastructure Committee and they seemed to indicate there was some capacity issue in terms of getting money out on the ground and spent in terms of roads maintenance and resurfacing and all of the other things that traditionally road service would have done in the first couple of months of a new year, the end of the financial year. I think that there was a discussion, and I think the Minister indicated that she had received sufficient money over the course of the year and didn't require any further money in relation to roads. So that's a matter, I think, that would have to be taken up with the Department for Infrastructure. But if there were further bids coming in, of course, I would look favourably on them.
I call Sinead McLaughlin.
Thank you, Deputy Speaker, and thank you, Minister, for your statement and answer so far. Minister, the Finance Minister in Wales, Rebecca Evans, last week announced a £40 million coronavirus student support scheme. She indicated that it was vital to support people currently in education, and she also indicated that it would help tackle inequality by ensuring that the most vulnerable students affected by the pandemic would complete their studies, help them complete their studies. Minister, why can you not do the same here in Northern Ireland for our students in Northern Ireland that have been so adversely affected by this pandemic, are paying for accommodation that can't even stay in, are unable to claim any benefits and can't even carry out any part-time work because obviously hospitality and retail are closed? If it's within the remit of the Welsh Finance Minister, why is it not within yours?
Well, can I say that I'm not surprised that the Welsh Finance Minister announced the allocation, but I'm sure she didn't bid for it. I'm sure she didn't devise a scheme for it. So the Welsh system, and I don't know it intimately, will have the Finance Minister doesn't deal with students. What they do is they accept a bid and they'll make an announcement to the money that they have in terms of the funding that they have allocated towards that. So as I had answered to my colleague here in one earlier question, it will be a matter for the Minister for the Economy, and I have urged her in recognition of the particular problems that students are facing to bring forward a bid for further support to them. And I would look very favourably on that and making a recommendation to the Executive. But I can't go into the Department of the Economy and devise a programme for students because it's not within my remit, and I would be fairly sure it isn't within the remit of the Welsh Finance Minister either. What they have done is they have announced the money that the bid has come out of the Department with responsibility for students in Wales for, and similarly I'm very happy to look at any bids for the Department of Economy in relation to students.
I call Gordon Dunn.
Deputy Speaker, and I thank the Minister for his statement. I do welcome your commitment on the rates for businesses, which will, I understand, continue into the new financial year. But would you take some responsibility for the delay and the build-up there has been in the underspend? Certainly from the Department of Economy, several bids were undercut and not fully funded. For example, directors. We have been pushing for support for directors for some time, and the bid was very much undersubscribed, and as a result, £1,000 was offered for directors from March of last year. I understand now that has been increased significantly. Perhaps you were too slow and too tight with the money. Would that be fair?
Well, can I say I only make recommendations to the Executive, as he knows. He's here a long time too. And the Executive approves the funding allocations. The Executive can change and amend any funding proposition that I bring. So when it comes out the other end, and I'm making a statement here today, it's on the basis of Executive approval for these allocations, and similarly with that. And so if a department hadn't got sufficient money, it didn't slow down the scheme, it might have reduced the amount they were paying out, and of course that has been added to since, and I would encourage that to go out. But I'm responsible for the schemes that my department administered, and there were difficulties with them as well, as I acknowledge in all departments who had their budgets to spend, and then on top of that collectively we'd have £3 billion additional to spend, and while that's a welcome challenge, nonetheless it does present problems, particularly in relation to the pandemic when staff are working from home and there are communication issues as well. So there have been challenges in all departments to try and spend this out, but we have allocated according to what the Executive agreed were the priorities at any given time, and what we want to see now is departments acting with urgency over the next number of weeks to get schemes out.
I call Pat Sheehan.
I thank the Minister for this statement today. And could I ask the Minister, given the move to online learning, it's clear that this has highlighted the digital divide between students with unequal access to suitable devices as well as Wi-Fi. I wonder would the Minister join with me in calling on the Education Minister to make a bid for money to purchase iPads, to purchase online teaching resources, and to ensure that all students have access to Wi-Fi in their homes.
Well, I think it's a good idea. There have been particular challenges, and if you speak to anybody in the education field, they will tell you that particularly students who don't have access to Wi-Fi, and that affects a lot of rural areas, including the one I represent, where there are communication issues, and communication infrastructure is not the same as it would be in perhaps more urban areas. But also, in particularly the poorer students have difficulty in access to the right type of equipment in order to do that, and as a consequence, then they suffer more in terms of the closure of schools than perhaps those who have access to such things. I do understand, in conversation with private interests, that some support was offered to the Department for Education in terms of communication, certainly in terms of broadband improvement to schools or to homes where young people were having difficulty, but I'm not certain that offer has been taken up. And I do intend to raise that with the Minister for Education. I know our own department is starting to look at a scheme in relation to providing some IT support to vulnerable people generally, not the school population, but vulnerable people, and there's a very significant uptake in relation to that. And I think it is worth doing because, as he says, certainly the experience of the pandemic is one where that whole communication thing has become a real challenge for very many people, school-age people, but vulnerable people at home as well. And so I think any bids for support for that would be looked on very favourably by the Executive.
I call Stuart Dixon.
Deputy Speaker, and thank you, Minister, for your statement. Minister, while I appreciate that you don't have direct responsibility for running individual departments other than your own, nevertheless, do you not have concerns about those that underperform in relation to the delivery of funds that you have given to them? I'm thinking particularly of every scheme that the Department of the Economy has come up for those who find themselves under stress at this point in time from their businesses because they are closed. But every time a scheme is devised, there remain many who are excluded. There's a great deal of frustration out there, particularly around the reality that funds may be returned to Treasury. So what action will you be taking to ensure, to encourage departmental ministers that that will not be the situation?
Well, I accept entirely that if we do end up in a situation where we aren't able to spend out the fund available to us, that those who haven't received will be obviously justifiably particularly aggrieved with that situation, and that's why I have asked ministers to prioritise getting funding to those sectors who, for one reason or another, have missed out to date, and then to try and support other sectors who are very much in need as well. And so I have raised that at executive meetings. I'm now writing to ministers to reaffirm that and to encourage them to come forward with schemes. I'm expecting to hear from ministers over the course of this week so we can take some decisions at Thursday's executive. And so I intend to keep the pressure on over the next couple of weeks to try and get that sorted.
I call Jonathan Buckley.
Speaker, I note this morning the Minister for Infrastructure talking about the new fund to clean up and restore alleyways that funding has been released from the department. And while I welcome that in normal times, I do note that there's nothing in this to help support uncompleted developments going on for some 10 years, and I think in particular of my own constituency, Birchwood Manor, and I know many others across the country. The Minister has said in this chamber that if the funds were given, she would act on this, but we have no completed road surfaces, faulty sewage systems, no lights, and not enough money in bonds to complete out developments. This is second-class developments, and it should not be tolerated. If the Minister for Infrastructure came forward with such a scheme, would the Minister be minded to support that?
Well, can I say in relation to the budget statement I did last week, I did announce as part of that we had made a very significant capital bid from the Department for Infrastructure. We had also supplemented that with a promise to access £70 million of RRI borrowing to support Northern Ireland Water in terms of sewage and wastewater infrastructure. I mean, there are no specific bids being made for that type, because I know there are legal issues that complicate unfinished estates, because there are questions if the bond is activated, and if the Department for Infrastructure do that, you effectively bankrupt the contractor who was involved, and that's obviously a big decision to be taken. But people can't be left for years in substandard housing estates and have to wheel their willy bins out to the front of the road from all of the houses in it over the course of time. And I know there are similar estates in my own constituency as well. So there is a significant, I mean, the Department for Infrastructure had the largest capital budget they had ever received in last year's allocation. They have received a significant, albeit no department got all that they wanted this year because it's a challenging situation, but we've added to that of £70 million of RRI borrowing for infrastructure. And so I think it will be up for the Minister for Infrastructure to allocate according to her own priorities, and I think it's up to members, and I'm sure this situation pertains in every constituency across the north to raise that issue of addressing these unfinished housing estates, to make sure that that becomes a priority for the Minister for Infrastructure.
I call Mark Durkan.
The Speaker, and I thank the Minister for his statement. It will seem somewhat perverse, I think, to the public at a time when we have never had so many in so much need. We have businesses struggling to survive. We have people struggling to survive, and departments are now in Brewster's Millions territory, struggling and scurrying to spend hundreds of millions of pounds against the clock. With specific regard to Department for Communities' reduced requirement of £2 million for the COVID discretionary support grant, does the Minister see merit in the creation, even at this late stage, of an accessible and effective COVID isolation support grant that workers can avail of, as exists in other regions?
Well, I know there has been some discussion in relation to that, and bear in mind, when we did the last allocation of this in December, we allocated everything out to departments, with the exception of the £150 million we're carrying over for rates for the next financial year, and £26 million of resources we'd left. And as I said, we were concerned at that stage we perhaps hadn't carried enough over into this part of the financial year. So what we're dealing with now are returns from departments who made bids for funding that they said they needed and wanted to spend and haven't, for a variety of reasons, been able to do so. So of course it's a big challenge, and if there are specific projects, I know that there has been some discussion in relation to that. I know there's a concern that the lack of support means that people are less likely to isolate and less likely to take time off, and thereby perhaps lead more in terms of spreading of the virus because they can't financially do anything else but go to work. So I'm very sympathetic to such a scheme, and of course it will be for the Department of Communities to try and devise something coming forward, but I'm sure this virus is going to be with us not just for the end of this financial year but into the new financial year as well, and such support is needed.
I call Jim Allister.
Okay. So for all the whining about Her Majesty's Treasury, it turns out there's loads of money, with 400 million unspent. I I've been in this House a number of years. I think this is the first time in a monitoring round I've ever heard of all departments having all their bids fully met. What a blessing to be in the United Kingdom. Could I ask the Minister, where does the incompetence lie in regard to the failure to get this money out? You can't blame London. They've given it to you. The failure is in Stormont. Where is the incompetence?
Well, can I say that, I mean, if his argument for the union is that our begging bowl is occasionally filled, then I think there are a lot of people in this part of the world who have much higher ambitions than just the occasional filling of our begging bowl in London. I think we'd be much better in charge of our own affairs. Then we might have known over the course of the year how much money we were intending to give out in relation to COVID and be able to allocate it accordingly. But what we are dealing with here are returns from a range of departments. And while I know he wants to poke the finger at somebody and allocate the blame and punish the guilty and all of the things that he normally does, the reality is that I'm more concerned about getting this money spent and getting support to where it's needed.
I call Jerry Carroll.
Thank you. The fact that so much money has been unspent and maybe handed back while so many have fell through the cracks is a cruel joke. I wanted to ask the Minister, has he or his department costed a zero-COVID strategy for the North? And what work, if any, has his department done with his counterpart in the Irish Government to cost an all-Ireland zero-COVID strategy to protect people from this deadly virus and new variants?
Well, COVID strategies specifically will come from the Department of Health. They don't come from the Department of Finance. We allocate the funding according to the agreed priorities of the Executive. And so if there were, and I would absolutely encourage a zero-COVID strategy, and I would absolutely encourage North-South, all-island approach to all of this. I think there are many examples from across the world where all-island approaches have been very effective in reducing transmission and keeping people safe. So it will be a matter for the Department of Health, and I know they do have collaboration and cooperation with the Department of Health in the South, but I do think there is much more that can and should be done in that regard.
And that concludes questions to the Minister on his statement. I'd ask members to take their ease for a few moments before the next item of business.
Next item of business is the final stage of the Harbours Grants and Loans Limit Bill. I call on the Minister to move the final stage.
I beg to move that the Harbours Grants and Loans Limit Bill do now pass.
Thank you. And the final stage of the Harbours Grants and Loans Limit Bill has been moved. The Business Committee has agreed that there should be no time limit on this debate, and I call on the Minister to open the debate on the bill. Minister.
Thank you, Mr Speaker. I do not intend to address the content of the bill to any great extent. This is a straightforward three-clause bill with a single purpose: to raise the existing total loan and grant limit from £35 million to £90 million. This will enable the Department to continue to provide our loans and grants to our ports. The existing limit has almost been reached, and there are major challenges being faced by the ports at this time, particularly as a result of the COVID-19 crisis and the need to grow business post-Brexit. The bill was introduced to the House on the 23rd of November, and accelerated passage and second stage debates took place on the 1st of December. I am grateful to the members of the Assembly for the contributions they made to the debates. Mr Speaker, I would like to place on record my thanks to the Chair and the members of the Committee for Infrastructure, and to all my Assembly colleagues for their cooperation and agreement to the bill proceeding by way of the accelerated passage process. Without that cooperation, it would not be possible for the bill to have reached all its Assembly stages within this mandate. That the members of this Assembly were content with the purpose of the bill was, I believe, further indicated by the fact that there were no amendments tabled at either consideration stage on the 14th of December or at further consideration stage on the 19th of January. I am happy, Mr Speaker, to respond to any comments members may wish to make during the debate.
Thank you, Minister. And I call the Chairperson of the Infrastructure Committee, Michelle McElveen.
Thank you, Mr Speaker, and I welcome the opportunity to speak at the final stage of the Harbours Bill. And as I said before, the bill in itself is not contentious. However, the procedure used to bring forward the bill is something which the committee found less than agreeable. Agreeing to the accelerated passage of any bill does not sit well with the Committee for Infrastructure. Our frustration was compounded by the fact that it was left to the last minute to amend legislation which could have been updated at any stage over the last 31 years, the last time that this was carried out. The Committee, like most members of this Assembly, believes that legislation should be afforded the full scrutiny of the Assembly processes, including committee scrutiny. However, I have made the Committee's views on this clear at the previous stages of the bill, and as I know the vast majority of this House is sympathetic with those concerns, I'll not rehearse them again. As previously noted, the Committee was notified about the proposal for the Harbours Bill at the start of September 2020, and the Minister briefed the Committee on the bill on the 23rd of September. During the briefing, the Minister and her officials explained to the Committee that Northern Ireland's ports are governed by the Harbours Act, Northern Ireland 1970, and that includes their funding. Under the 1970 Act, the ports are expected to fund their own capital investment, while the Department is able to make loans and grants to assist with major developments. As the Minister has indicated, this assistance from her Department is limited under the Act to a maximum of £35 million. The Minister outlined to the Committee the urgent need to raise the existing level of £35 million to a more substantial £90 million as set out in the legislation before us. Mr Speaker, the motivation for the increase was made to the Committee when we met with representatives of the seaports on the 1st of July last year, when they made the Committee aware of their need to grow and strengthen their businesses. However, the Committee also noted the financial impact COVID-19 has had on the ports and the limitations this has placed upon them. The Committee is cognisant that it is vital that our ports are ready for the challenges and opportunities facing them. Mr Speaker, the Committee understands the need of the Department to provide adequate support in order that, for the benefit of our economy, the ports can develop the infrastructure required. In its discussion with the Minister and her officials, the Committee sought assurance that the sole purpose of the bill is to raise the loan and grant limit and that there will be no other consequences from it. The Minister gave that assurance, noting that this is a short and concise bill. Given the context within which we are operating and the assurances given, both myself and the Committee for Infrastructure supports the bill. Thank you.
Thank you. And I call Cathal Boylan.
Sorry, I'm late. Just to say, Chair, what do you call it? That I just support the final stage of the bill. Okay,
Well said. I call Roy Beggs.
I'm quite pleased that we've got to this in a relatively short period. I wish to indicate the continued support of the Ulster Unionist Party for the Minister on this particular bill. And as the Minister has said, it's a very short, straightforward bill, 3 clause, primarily just increasing in line with inflation the maximum grant and loans that can be passed to our harbours. Our harbours, our ports are essential for trade. Without trade, our economy crumbles. So it's important that there is an ability to support when necessary. Regrettably, over the past year, they have suffered as a result of COVID. There's been a downturn in certain trades. Manufacturing on occasions has not been in operation as it would normally be. People's purchasing habits will have changed as a result of that, particularly business to business, and trade has been down. That in turn has put stress on our harbours. In addition, the normal tourist traffic has not been around, and it is yet essential, particularly for Northern Ireland, that we have regular transits of our ferries to GB, with our agricultural goods having to reach market on a timely basis. It is important that we do have reliable, regular ferries to Great Britain. The additional burden that has now come to our harbours and our ports, and yet, as of yet, we do not know the final outworking of it and how exactly it will impact on the future of our ports and their ability to provide those regular ferry services, is the Northern Ireland Protocol. As part of that protocol, there has been a huge burden of administrative extra requirements passed to GB suppliers, particularly who are passing goods to Northern Ireland. There's been burdens passed to hauliers in terms of delays in the process of perhaps picking up their goods and getting the necessary paperwork, and again, delays in ports. All of that is resulting in less freight coming from Great Britain to Northern Ireland, and again, there's a risk to our ports as a result of that. So it's important that there is a flexibility built into our system, that if there's a need to intervene, that the Department, the Executive can intervene, and this bill simply increases that loan capacity, the grant capacity, roughly in line with inflation over the many years since it was last upgraded. And I welcome that. It is important that if there's a need to respond to the significant change in trade which is happening, and there is a lack of response by the Westminster Government and Europe to enable that trade to happen, there may need to be further emergency intervention. And this bill will create that little bit of headroom should it be needed. I would also, in welcoming this final passage, ask the Minister to reflect within her department so that perhaps there may be a need to upgrade the grant on a more regular basis, rather than waiting for a good pressure or point or emergency situation that this bill has had to come forward at relatively short notice. It would be much better if such changes happened in a more timely basis, and the ability would always be there if it were needed. Continue to support the bill. Thank you.
Thank you. And I call Andrew Muir.
Thank you very much, Mr Speaker. As the Alliance Party's infrastructure spokesperson and also a member of the Assembly's Infrastructure Committee, I rise to support the bill on behalf of my party. At the second stage of this debate, I spoke about the need for the ports to be able to access finance to tackle the challenges of decarbonisation, COVID-19 and Brexit. The intervening 2 months have brought home the scale of the challenges our ports now face. We support this overdue increase in the loans and grants limit. We regret, however, that the bill has come through accelerated passage, but are satisfied with the content of the legislation. I look forward to further engagement with the Port Authorities via the Infrastructure Committee in the future as we work together to navigate this challenging environment. I thank the Minister and officials for bringing forward this bill and would like to end by paying tribute to all those who are working in our ports for the invaluable and often unrecognised service they provide to Northern Ireland. Thank you very much.
Thank you, and I call the Minister for Infrastructure, Nicola Mullen, to conclude the final stage. Minister.
Thank you, Mr. Speaker, and I'm grateful to the members who have contributed to this debate. I believe the bill will help to ensure that we are able to continue to provide financial assistance to the ports during these challenging times. During second stage debate, the bill received cross-community support, and I would again like to thank all members for that support. I would again like to thank the Chair and the members of the Committee for Infrastructure, and indeed all Assembly members, for their cooperation and agreement to this matter, proceeding by way of the accelerated passage procedure. A number of members have spoken about the use of accelerated passage, and I again want to reiterate my view that I took that decision, and I certainly didn't take it lightly, but it was required to enable me to introduce the legislation and ensure that it could pass within this mandate to, as all members who have spoken have highlighted, to enable our ports to strengthen their resilience and to expand their facilities and to grow their businesses for the benefit of our economy. I thank Mr Boylan and Mr Beggs and indeed all members for their support and for speaking on this matter. And I know that Mr Beggs had raised the issue of the impact of Brexit on our ports, and I'm sure he, like me, will continue to remind the British Government that they have committed to funding all Brexit-related works at our ports, and it is essential that they honour that commitment. Can I end by echoing the words of Mr Moore and putting on record my appreciation for the efforts and the tireless hard work of all of the staff at our ports who do tremendously important work and yet do so very quietly without seeking any recognition. Mr Speaker, I commend the Harbours, Grants and Loan Limits Bill to the House.
Thank you. And the question is that the Harbours, Grants and Loans Limit Bill do now pass. All those in favour say aye. Contrary, no. The ayes have it. The ayes have it. Thank you. The next item of business on the order paper is question time, and I propose, therefore, by leave of the Assembly, to suspend the sitting until 2 p.m. The sitting is by leave suspended. Thank you all.
This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed.
Okay, members. It's now time for questions to the Executive Office, and I call David Hilditch to ask the first question. Mr. Hilditch, and I call the Deputy First Minister. I call the Deputy First Minister.
And thanks to the member for his question. We've taken a multifaceted approach to dealing with matters associated with the protocol so that we can respond effectively to any issues as we become aware of them. We're closely engaging with the British Government at both ministerial and official level to deal with the impacts that our businesses, citizens are currently facing. This engagement has included daily ministerial attendance along with Scotland and Wales at the XO Exit Operations Cabinet Committee, where we have taken the opportunity to highlight the significant issues that we're dealing with and to press for rapid solutions. In parallel to that, we're continuing to engage closely with our business community to ensure that their issues are addressed and to work together to seek resolutions. We've also been engaging closely with the Irish Government, particularly on the delays that hauliers are experiencing on the Holyhead to Dublin route, and we will continue to seek solutions to issues as they arise and to engage with the British Government to ensure timely planning for the end of grace periods.
David Hilditch, supplementary.
Thank you, Mr. Speaker, and I thank the Minister for her answer. Will the Deputy First Minister agree or acknowledge that the rush to get the rigorous implementation of the Northern Ireland Protocol and the amendments inserted in the Belfast Agreement by the Secretary of State have breached the Belfast Agreement on cross-community consent on the protections?
Well, firstly, I don't agree, no, certainly not. I think the protocol gives us protections which we weren't afforded throughout the whole of the Brexit debate. So our job as an executive is to ensure the rigorous implementation of the protocol, and we'll continue to work with both the Irish Government, with the British Government, with the EU side in terms of any issues that we see in terms of that are problematic. But as we know, and this is my own political opinion, as we know, Brexit, there isn't anything good to come from Brexit, and the problems that we foresee, that were foreseen then, are now coming to life. However, our job as an executive is to make sure that we minimise any disruption. both be that north, south, or east or west, and we work to find solutions to a number of the issues that have been identified in these early days.
I call Jim Allister.
Having demanded and voted for the rigorous implementation of the protocol, and indeed told us today that the Executive wants the rigorous implementation of the protocol, it's pretty clear to me that the Deputy First Minister cares little for the resulting damage to our businesses and consumers. So could I ask, what does she say to people like Beth Lunny, Robin Mercer, who are trying to run garden centres and have been told by their GB suppliers that they can't bring in roses or azaleas because there might be soil on or in the pots because the protocol ludicrously imposes an EU ban on the importing of soil? Surely, if the Deputy First Minister cared anything for business, she'd be concerned about that.
The member resume his seat. The member should be mindful whenever you ask a question, without a long introduction, and then you finish when you ask your first question. Thank you.
I think perhaps the member should explain to his constituents that he himself endorsed Brexit, voted for Brexit and championed Brexit, and these were always going to be the implications. But let me say to your constituents in terms of the issue, in terms of soil, that we are aware of this issue in relation to the movement of soil from Bitten to here, and we're also liaising with DAERA on this issue and hope to try and find a resolution.
I call Matthew O'Toole.
Speaker, all of the issues to do with east-west trade, along with the issues we face in north-south, are a product of Brexit. The protocol is a product of Brexit. Just specifically, briefly, in relation to soil, the island of Ireland shares soil. The UK has chosen to leave the EU SPS zone. It is a direct consequence of that decision that means that there is no plausible way. It's not a nationalist or Remainer plot to have us in the same SPS zone in the island of Ireland. Sorry, Mr. Speaker.
The member asked the question that you have tabled and you've been called to ask. We don't need to answer anybody else's question.
Very, very briefly, Mr. Speaker, the question I want to ask is, has the Executive Office, understanding the limitations that Brexit places on our trade, has the Executive Office commissioned InvestNI, Intertrade Ireland and others to urgently develop a strategy for maximising the benefits of Northern Ireland's dual market access into both the UK and EU markets? That's something we should all be able to agree on. What is the Executive Office doing to maximise the benefits to businesses here from investment from both the EU and GB into this market and this economy?
Well, just again, thanks to the member for his questions, and I concur with a lot of the commentary that's been made there. I think that we're very early days in terms of being post the 31st of December, so obviously there are a lot of issues to be worked through. There are a number of current issues, whether that be soil or the issue of seed potatoes, fisheries, eels, steel. There's a raft of things that need to find that we need to find resolution to, and we will work with those who are appropriate in order to try to find resolutions to those things where we can. In terms of the future, then we have to look about the economy in a post-Brexit era. What does that look like? Certainly, as an executive, and certainly the Department of the Economy will have to come forward with economic strategy around where is our target markets, where can we look to for the future, and how can we build a very strong economy.
I call Martina Anderson.
I'm sure the First Minister will agree that the problems we are facing has got to do with the Brexit that the majority of the people here in the North didn't vote for. So does the Joint First Minister agree that the lateness of the advice that was given to British businesses, coupled with a lack of preparation by the British government, has resulted in the problems that we are facing and businesses are facing today?
Again, just to say that there's no doubt that the businesses here have been quite well prepared for the changes, and it's also very clear from all the engagements that we've done as an executive office, even with the business community, that there is a lack of similar preparedness among businesses in England and indeed in Scotland and in Wales to comply with the new processes for sending goods here. We've been raising this issue directly with the British government and encouraged them to do more to make sure that there's a better state of preparedness from their businesses. The disruption at the short straits before Christmas due to the requirements for hauliers to have a negative COVID-19 test before entering France also had a knock-on effect on the supply chain, and that also led to some delays. However, I'm glad to say that stock levels have now stabilised, with only a few product brands that are now not available to consumers here. Fulfilment of food deliveries to the major retailer stores has risen to 85% compared to 65% at the beginning of the year. Groupage, or the transport of mixed loads in a single lorry, has proven to be a major issue for our hauliers, who operate to tight margins and also to very tight turnaround times. It also affects smaller companies who are not benefiting from the grace periods from supermarkets. This issue has been raised on a regular basis at ministerial and official level, and I understand also that DAERA, in liaison with DAERA and the industry, are working, or DEFRA and the industry are working to identify options to address these issues, and that hopefully there will be a resolution shortly.
Moving on, I call Paula Bradley.
Question 2. Corley, with your permission, I'll answer questions 2, 4 and 8 together. The Executive's response to the COVID-19 pandemic continues to be led by the latest medical and scientific advice. Our decisions have been informed by the health and well-being of our citizens, the economic impacts of any interventions, and our societal and community well-being. Any decisions on the Executive's next steps are informed by the impact they may have on us all as individuals, as families, and the wider community within which we all live. The Executive has established a COVID-19 task force to lead and to coordinate an integrated programme of work of response to and recovery from the COVID-19 pandemic. The task force has initially structured its work under 4 work streams: protect, recovery, adherence and strategic communications. Since the current regulations were put in place on the 26th of December, we have been encouraged that the majority of people are adhering to them and that they are doing their utmost to help limit the spread of COVID-19. This can be clearly seen in the falling R numbers and the reduction in the number of positive cases. However, pressure on our hospitals will remain for some time, and as such, we cannot be complacent. The Executive's task force is also looking at ways of further increasing adherence to the public health regulations and guidance, which includes providing input into the design of any restrictions proposed. Clearly, we would like everyone to continue to play their part in following the public health guidance. However, there are blatant breaches of the regulations. The PSNI and local government will ensure enforcement activity is rigorous. Recovery from the pandemic is another key area of focus for the Executive's task force and will be focused on progressing an economic, health and societal recovery, which has the citizen at its centre. Any recovery work will complement the longer-term programme for government, which is currently being developed. Central to our recovery from COVID-19 is the vaccination programme, and while we have significant progress over recent weeks, it will take some months for this programme to be fully rolled out. We want to recognise the dedication and commitment of the teams implementing the programme and thank them for it. We recognise huge sacrifices are being made by many to protect lives and our health service, and we're also very thankful to you all. We must continue to protect each other by following 3 simple rules to stop the spread of the virus: to wash your hands, wear your face covering and keep your distance.
Okay, Paula Bradley, supplementary.
Deputy First Minister, for our answer. We know that whenever there are stricter regulations in place, compliance is generally much better. We know that from the figures. But looking forward, we are going to have to reopen the economy, as you'd said there, at some stage. How do we continue with that messaging to ensure that people do not fall back on the old habits that we've seen over the months leading up to Christmas that ended up in the situation that we ended up at Christmas time?
So I think you're right. The challenge is going to be, we'll be back in the position that we were certainly moving through the summer months, where we tried to transition back into allowing some things to open up. But clearly, that's not the space we're in today. As of today, we're still in a very, very difficult position. We've seen what's happened in our hospitals over the weekend, clearly increased numbers again today. So I think that our challenge as an executive is going to be this. It's going to be, how do we continue on with the public health message, get as many people vaccinated as possible, but then provide a pathway to recovery. And if you remember, the member might remember last year we published a document that actually set out sort of staging posts of when we thought we could maybe reverse out of some of the restrictions. We hope to be able to get to that point again in the coming weeks to allow us to communicate to the public this is what recovery could look like. But at the same time, in a tandem way, we need to have also the restrictions still in place. Last week, the Executive has discussed the current restrictions, deemed them to be necessary for a further period of time. The Health Minister also pointed to the fact that they may be necessary even further beyond the period that we outlined, so perhaps even up as far as Easter. We said that to give people forewarning. However, we won't keep restrictions in place for longer than necessary. But as of today, we're still in a desperate situation. As of today, we need the public to work with us, and we hope that over the course of the number of weeks we will be able to publish a pathway to recovery.
Call Tom Buchanan, supplementary.
Mr. Speaker, and thank the Minister for her response so far. But I'm sure, like the rest of us over the weekend, she will have heard the disgraceful comments of Micheál Martin, who made reference to the COVID testing in Northern Ireland not covering the new strains of the virus, which we know was totally untrue. But in light of that, what discussions has taken place with the Southern Government in relation to the continual disgraceful refusal to share data with the Health Minister and his department in relation to those travelling into Northern Ireland through the south, which must be of huge concern to the Executive, given that the Southern Government is struggling so much with their vaccinating and testing programmes?
I think a number of things I would say there. I mean, I think the approach to travel here could be much better. I mean, I think the issue in terms, this is my own personal view in terms of the issue of travel, but I think that in terms of the issue of travel locator forms, which you refer to, I spoke with the Taoiseach just actually an hour ago. We discussed his commentary at the weekend. I'm hopeful there's going to be a resolution to the issue of the travel locator forms and that data will be shared. I also see that there's a conversation underway both in the South but also in Britain around mandatory quarantining in terms of people travelling in. I think that that's something that absolutely needs to be looked at. So I look forward to the conversation at the Executive tomorrow, where we hopefully can discuss this issue of travel again. But it's very clear that we need to have an all-island approach to travel. But a two-islands approach to travel actually is what I personally have called for. I think that's what we should be doing here, because when it comes to issues in the north, whether that be when the two governments diverge, then the north, any issue in the north becomes an orange and green issue. Travel isn't an issue of that nature. This is an issue about dealing with a public health pandemic, and something that we need to respond to collectively across these islands.
Paul Matthew O'Toole, supplementary.
Mr. Speaker, the Minister mentioned in an earlier answer that the Executive would be looking at a plan in terms of easing restrictions, or how you would get to easing restrictions. Shouldn't that also be a broader COVID recovery strategy that matches the economic recovery? We haven't had that yet, frankly, for 6 months, and there's been failure from both the Economy Department and I'm afraid the Finance Department on that, given the hundreds of millions of underspend we're now expecting. Will TU drive forward the production of a full COVID recovery plan that joins together the economy with the public health response?
Well, just firstly, I would remind the member that he has a minister in the Executive. This is a collective Executive effort. The Executive as a whole has been discussing the issue of recovery, how we move forward. We now have this task force that's going to be focused on the 4 different elements, so whether that's strategic communications, whether that's recovery as a whole, and that's going to take all of our efforts, not just one department or indeed 2 departments' efforts. And I can assure you that the Finance Minister has written to all ministers, including your own minister, to ask her to maybe bid for some of the money that's left and hopefully should be spent before the end of the year. It's certainly our collective will that all of the money will be spent to invest in people in what is the most challenging of times.
Agus buegas leis an ara as Octa Fragri and you. Thank the Minister for her answers today. I wonder, could the Minister outline for the Assembly the work that has been undertaken to date by the Executive COVID Task Force Group?
Thanks to the member for his question. I just briefly had touched on it that given the extent of and the surge of this current sort of phase that we're in, we recognise that there was a need for a broader plan. So the task force has been established. I think it's a necessary step change in the Executive's response to the evolving nature of the pandemic. The task force itself is going to lead and coordinate the integrated programme of work and the response to and the recovery from the pandemic. It's led by the interim Hawks, who has convened a strategic oversight board that also meets regularly. And as I said previously, there are 4 work streams, so protect and recovery, and then also adherence and strategic communications. And work on each of these areas is being led by the permanent secretaries of Health, Economy, Communities and Justice, and the head of EIS, each of whom all sit on the strategic oversight board. So over the next sort of 4 to 8 weeks, the task force priorities are going to include the ongoing focus on the vaccination programme, development of the pathway to recovery that I've spoken about, that will provide a road out of the current restrictions. It's about looking at ways of increasing adherence to the public health guidance and regulations, and it's also about enhancing the Executive's strategic communications capacity, because it's really vitally important that we're reaching people right now in terms of what happens next.
I call Rachel Woods.
Can I ask the Deputy First Minister, she mentioned there about the plan for recovering from COVID and the document that was published last year. Is that what we're still operating on? Because that clearly didn't work whenever it was implemented last summer.
The point I was making is that it was a useful tool in order to allow people to be able to chart in terms of a progress to take us out of the current restrictions and ease our way out, because it's very clear there's going to be no big bang. We're not going to wake up one day and decide that the Executive can release or relax all the restrictions. So the reference to the document that we had last year is merely a reference to say, here's what it would look like. And I think that's a communication tool also for the public, because they need to be able to understand exactly what that looks like. And it's going to be very difficult. And as we know, in previous waves, whenever we come to reversing, it's always more difficult than whenever you're bringing restrictions in. And then each sector will fight their own case, which is very natural. You absolutely understand that. So our communication with sectors is going to be really, really important. But I do think, and we certainly think as an Executive, that this is the way to go to try to communicate better with the public.
Moving on, I call Joanne Bunting.
Question 3, please.
I will ask Junior Minister Kearney to respond to this question.
While the restrictions associated with COVID-19 have impacted on the scale and method of delivery of our programmes, we do not envisage any of our departmental strategies being delayed as a result of the financial pressures arising from COVID-19. Due to a combination of funding from the Department of Finance and budgetary easements within the Executive Office, there have not been any unmet financial pressures arising from COVID-19 in the current financial year. The final budget for 2021 to 22 has not been finally determined, and our department continues to engage with the Department of Finance to ensure that all budgetary requirements for both COVID-19 and non-COVID-19 are understood and addressed at the earliest opportunity.
Supplementary, Joanne Bunting.
Thank you, Mr Speaker. There are only 14 months left of this mandate and many priorities within NDNA. How will the Executive Office ensure that prioritisation is given to commitments that affect everybody, rather than items which could be viewed by some as niche?
Well, I thank the member for her supplementary. You're right to highlight the fact that we only have 14 months left, and that it is essential that we attempt as an Executive, as a power-sharing government, to address as many of the priorities that affect us, particularly the challenges set out by NDNA. And the commitments contained within NDNA are in themselves, as you will appreciate, extremely challenging. We are mindful that affordability within our constrained budget position, as is the Executive, and it is an important consideration in terms of how we take forward the programme for government itself. So work is taking place in relation to ensuring that by April we have a high-level strategic programme for government in place. The NDNA financial package announced set out funding for specific purposes, including the support for language, cultural and identity, and funds to support expression of identities and progressive cultural development, in addition to tackling social deprivation and paramilitarism. And it is intended that the NDNA Joint Board will identify the specific purposes for which the funding for those unique challenges will be used. The member will also be aware that the Executive Office is responsible for a broad cross-section of programmes, good relations, communities in transition, urban villages, ethnic relations, international relations themselves, as well as addressing the extremely important issue of historical institutional abuse, and also those who are victims of our own conflict. That work continues apace, and to date, in this financial year, all of the requirements arising from those programmes of work have been met, and I'm hopeful and confident that that will continue to be the case in the new financial year beginning April 2021.
Thank you, and I call John O'Dowd.
And thank the Minister for his answers thus far. The Minister has touched on some of the points I wish to raise with him. Could he go into greater detail in terms of the areas of work the Executive Office is carrying out?
There is no doubt that in some areas we would have wanted to have made much more progress, and some of our work has been fettered and delayed as a direct result of the pressures which have been brought about by the health pandemic. And that's not specific only to TEO, but I think that it has adversely impacted on the efficiency and the targets set by all of the departments within the Executive. The Executive's priority and focus, as the member will appreciate, has been on steering our health service and society through all of these challenging times and on supporting all of our people. And that will be work which will, in the coming period, develop into COVID recovery, which will present new challenges as well. Despite that, we have delivered on a number of important commitments. And, for example, the health workers' pay dispute was immediately settled when we restored our power-sharing institutions 1 year ago. We are on track to deliver the graduate entry medical school at Magee, and the first cohort of 70 students due to commence in September 21. A mental health action plan has been published. A feasibility study is being taken forward for a potential high-speed rail connection between Belfast, Dublin and Cork. Work has been done to publish the new ministerial and special advisor codes. Legislation has been introduced to reclassify housing associations to protect social and affordable housing supply and the delivery of homes who most need them. And as I mentioned in my earlier response, the Historical Institutional Abuse Redress Board has been established, with payments being made to victims and survivors.
Thank you. And I call Colin McGrath.
Mr Speaker, child poverty is now at its highest level in years, with 1 in 4 children living in poverty here. And there was a commitment within NDNA to deliver an anti-poverty strategy. Could the Minister detail to me when this will be published and what plans are in place to implement this critical strategy to try and address poverty?
The member is quite right to underline the absolute critical importance of that strategy being brought forward. It is a commitment under NDNA, but it reflects on the challenges within the society. We remain, as a society within this region, exhibiting very, very high levels of social disadvantage, deprivation, in terms of the working wage. The incomes that families can rely upon, they are less here in this region than they are across these islands. So work is being taken forward in relation to addressing this particular priority. It's taking place at pace, and I'm confident that within the very near term we will in fact be bringing forward that strategy. And I hope that it then provides the toolkit for us all to work together as members in this House and within our Executive to ensure that this particular priority is absolutely and categorically addressed in the time ahead.
Call Doug Beattie.
Speaker, thank you, Minister, for your answer so far. I guess we've all witnessed the unedifying disagreement between the NIO and the TEO in regards to the Troubles Permanent Disablement Payment Scheme. Rolls off the tongue, doesn't it? But I guess the question is, are we in solution mode with this? And have TEO looked at asking the Secretary of State if the £150 million, which has been set aside for the Stormont House Agreement legacy mechanisms, and regardless of the arguments about whether you want it or not, forget that, could actually be used to make sure that the Justice Department has the money to make sure that gets up and running on time?
Well, I thank the member for his question, and to answer the preamble, I can assure you absolutely that this Executive is very much in solution mode to addressing this particular issue. It's certainly a key priority within TEO. It has been addressed at our most recent Executive meeting. The two First Ministers are directly in contact with our Finance Minister, who in turn has been attempting to ensure that the financial deficit required is in fact addressed. I think the member will sympathise with and understand that we will not potentially have within our budget limits the capacity, the resource to address this particular issue. That's why discussions remain extant with the NIO on this particular point. I would say to the member that it has become an extremely frustrating process, because I don't think, and I think I'm reflecting a general view held within TEO and probably within our broader executive, we're not satisfied with the degree of engagement from the British Secretary of State or the NIO in assisting us to identify from where we can obtain the type of financial resource that is required to ensure that we can deliver on the commitment for victims' payments.
I call Dolores Kelly, and you may not get a supplementary.
Thank you. Question 5, please, Minister.
The First Minister and I have asked for a review of the Commission for Victims and Survivors to be undertaken, and we're currently considering the terms of reference for this. We will review and consider areas such as how the Commission services should be delivered in the future, and what structure is also best suited for to be delivering responsive, focused, efficient and quality services. In tandem, our officials are currently preparing the comprehensive documentation required to begin the recruitment process for a new Commissioner for Victims and Survivors. This will be submitted to us for consideration by the end of January and to allow us to progress to the next stage of the recruitment exercise. In the meantime, we'll also recognise that continuity is important for victims and survivors, and so we have ensured that interim arrangements are in place within the Commission to allow the provision of continued support for victims and survivors. The Victims and Survivors Service will also continue to deliver its services to the victims and survivors, which are obviously tailored to the individual needs.
That ends questions. Time for the list of questions, unfortunately, and we will now move on to 15 minutes of topical questions, and I call on Mark Durkin.
3 weeks ago, almost 3 weeks ago, at the ad hoc committee, when I raised the plight of our students with the First and Deputy First Ministers, both gave this Assembly an assurance that they would work with the Economy Minister and executive colleagues to ensure our students are supported. Can the Ministers please give this House an update on what discussions have taken place since around students and what decisions, if any, have been made?
Thanks to the member for his question, and he'll remember from that ad hoc committee I had responded to him and said that I fully supported the need for us to support our students who found themselves in a very difficult situation this year, not least because they paid tuition fees and they're not there in person. They've committed themselves to rent agreements and then they're not able to be there either. So I listen very carefully with the students and engage with them on an ongoing basis. One of the things that the Executive actually has discussed are what else can we do to support students, particularly before the end of the financial year when we have some extra resource. So we look forward to that conversation continuing, but certainly I don't think anybody is dismissing the fact that we need to support our students right now.
Supplementary, Mark Durkin.
And to thank the Minister for her answer and welcome her support, but our students would really love to be in a position to welcome action from the Executive at this stage. The Deputy First Minister in particular will know of the vital role that our student nurses and midwives are playing, supporting our struggling health service in the battle against COVID, yet they're not getting paid for it. The Health Minister previously justified this to me as being a UK-wide position, but the Nursing and Midwifery Council has reintroduced paid clinical placements for student nurses in England. Will the Executive look at this again and pay our student nurses for their invaluable, priceless work?
Again, the member might be aware that I'm on the public record of saying that the Health Department should pay student nurses. Also, I believe that there are opportunities to pay nurses in their final year clinical placement. So I think that's something that I very much urge the Health Minister to take on board. Again, huge financial conversations for the Executive to be had over the course of the next number of days, particularly as we come towards the end of the financial year. But certainly I am on record as having said that I believe that this should be paid, and I hope that there is a positive outcome for those student nurses who have been on the front line of the pandemic, who have been supporting the health service at a very, very trying time. So I hope that there's a good outcome for them.
I call Harry Harvey.
Mr. Speaker, does the Deputy First Minister support the call from the supermarkets for a less full and less rigorous implementation of the protocol to ensure food shelves remain full after the 1st of April? Thank you.
I can say to the member that I support the protocol in its entirety being implemented, and that is also the role and responsibility of the Executive. That is an international agreement in terms of the withdrawal agreement, and the protocol provides protections for us. There were some teething issues in terms of food over the course of the first early weeks in January. That has in the main been resolved, and that's something that I very much welcome. But we're also very clear in terms of the fact that the reason for that is because of the fact that the businesses in the British end weren't ready to trade because of the lateness of the deal, and unfortunately then they weren't in the place that they should be. But I'm glad to say there's been a lot of resolution to the food supply issue.
Harvey, supplementary.
Thank you, Speaker. Does the Deputy First Minister call on the European Commission to respond swiftly and substantially to the national government's efforts to agree new systems and not just grace periods? Thank you.
Unfortunately, the outworkings of Brexit are being laid bare for all to see. I said previously, as part of an answer to a previous question, that there are a number of issues that need to be resolved. They need to be resolved at both the EU and British Government level. Certainly we'll play our part in raising the issues that need to be ironed out. I'm glad to see there has been solutions on some of those issues. There are other issues that are still outstanding, but hopefully we'll see a resolution on them also.
I call Daniel McCrossan.
Thank you, Mr. Speaker, and I'd like to thank the Deputy First Minister for the answers to questions so far. Mr. Speaker, while I appreciate there will be an inquiry into the events that led to the death of Noah Donoghue on the 21st of June 2020, can the Deputy First Minister give a commitment that she, with the First Minister, will do all that is possible to ensure the Donoghue family finally get truth and the answers they deserve? Thank you.
Can I say that I have met with the Donoghue family, continue to engage with them, have my full support in terms of getting truth and justice around what happened to Noah. I think any mummy in that position that Fiona's sitting in today, not having answers about what happened to her wee boy, couldn't fail to be heartbroken, and we'll all do and should do everything we can to make sure that every piece of information is uncovered and that Fiona has the answers that she needs to have.
Supplementary, Daniel McCrossan.
I thank the Deputy First Minister for the answer to the question and also for her commitment. The Noah Donoghue story has touched the hearts of our entire community. There's been a massive public support for the Donoghue family right across the north, and I too fully support them in their search for answers as to what happened to Noah. Last year we held a minute's silence in Strabane, for example, and I know there was a large cavalcade that arrived at the gates of this institution just a few weeks ago calling for action. Does the Deputy First Minister agree that Noah's case is of such public interest among our constituents right across the north that it is important that we must show our support and intervene where possible to ensure this grieving family finally get the truth that they have campaigned for? And will the Deputy First Minister join with me in calling for anyone with information to come forward and to help ease the pain on this family at the present time? Thank you.
Again, just because of the sensitivity of the issue, can I say all of our hearts break for Fiona Donoghue and the loss of her wee baby boy. And I think that his loss certainly has touched everybody. So I think that we all need to work together. I absolutely encourage anybody with information to please bring it forward to help the PSNI in their inquiry. I want Fiona to have, not that she'll ever find peace in terms of the loss of her baby, but certainly she needs to have all the answers, and certainly we all need to do whatever we can to support both the family, the PSNI in terms of the investigation, making sure that everything is uncovered, and I hope that we get to a point at some stage in the near future where Fiona does get the answers that she's rightly seeking.
I call Mr. Paul Frew.
We note the desperation of Micheál Martin with his commentary over the weekend, and given United Kingdom is a world leader in virus genoming and Northern Ireland's per capita levels of SARS-CoV genoming is amongst the highest in the world, should we be offering our expertise to help the Irish Republic authorities who have much lower rates of genoming?
So, firstly, let me say that, yes, I think it's recognised that in terms of what happens in Britain in terms of the genome testing is somewhat advanced compared to other parts of the world. That's a good thing. But it's also clear that we have more to do here in terms of our own testing. Clearly, some commentary that we've seen this morning from the various experts involved in the testing that's happening here, identify the need to expand our testing. I think that, and you weren't in the chamber when I raised this earlier, but I spoke to the Taoiseach before we come in to question time today. He made it very clear that it wasn't about taking a swipe at anybody, but it was in recognition of the fact that there is an anomaly. The anomaly being that in the 26 counties in the south of Ireland, there is an identification that this new variant was spreading far more rapidly, and that didn't seem to be the case here. And I think that is an anomaly that needs to be resolved. Clearly, we live on an island. The virus has spread in the same pattern the whole way through the pandemic. I can't see how the new variant is behaving any differently. Needless to say, what we need is proper identification of the new variant. We need to know where it is. We need to know how to deal with it. We need to know that it's also it will respond to the vaccine. And so tomorrow at the executive meeting, I hope that the Health Minister will be able to bring us up to date around where we're at on this, because it's really, really important, again, that we communicate that to the public. People understand where the current situation sits, and that they can understand then exactly what health is doing to respond to that.
Paul Free, supplementary.
Thank you, Mr. Speaker. And given what the Deputy First Minister has just outlined, and given the tremendous rollout of vaccines in Northern Ireland in comparison with the Republic of Ireland, with their torturous delays in vaccines for its citizens, would the Deputy First Minister agree with me that the Irish authorities should look towards the UK with regards to support in this regard, rather than the EU, who have let them down quite badly?
Again, it's my personal view, but I think that we'd be in a far better situation today if across these two islands there had been more cooperation from the very onset of this pandemic. I think it would have served all the people much, much better. We have continually called for more cooperation across the island, across the two islands. As a matter of fact, TEO has called for a meeting of the British Irish Council. I think that would be really, really important. Now's the time to have this conversation. If we're going to get to the stage where we can get the R rates down again, then that's the time in which to act together collectively, and I would much prefer we did it across the two islands, particularly when it comes to the issue of travel.
Trevor Lunn's not in his place, and I call Michelle McElveen.
Mr Speaker, and following on from the Deputy First Minister's comments in relation to cooperation, can she outline how long and in what ways the Northern Ireland Executive has been engaging with the Irish Government to access the passenger locator forms of people entering the Irish Republic?
For some time. I don't know exactly the length of time, but certainly for some time. And it's really, really important that we have this information shared. I've made that point again with the Taoiseach. I've made it with every engagement which we've had, both at Taoiseach to Joint First Minister level, or indeed between the meetings with health ministers. I'm glad to say we're going to have a meeting. I believe it was a rescheduled meeting from last week. It's going to happen this week, and that will involve the health ministers across this island, and then ourselves, Minister Simon Coveney and Brandon Lewis, again where the issue of travel will be discussed. The Taoiseach has indicated today that they believe that there's going to be a resolution to the issue, and I hope that's the case.
Supplementary, Michelle McElveen.
And thank you. Does the Deputy First Minister share my concern that perhaps the reluctance of the Irish Government to share this is an indication that the system being used is maybe not being managed properly by the Irish authorities, and obviously has the potential to have serious consequences for people living in Northern Ireland?
Again, I'm going to say that I think that the best approach to this would be on a north, south, east, west basis. I think that the issue of travel into here from Britain, an issue which the Executive has grappled with on many of occasions, I think is another issue. This is not to be political about this issue. I think the best way we all could deal with it is actually to work together across the two islands. I again made that clear to the Taoiseach today. I think that it needs to be a political solution at a Taoiseach to Prime Minister level, and I think that's, if we can get a political solution, then we all can walk through that space.
They call Robin Newton.
Mr Speaker, and I thank the Deputy First Minister for her answers so far. Does the Deputy First Minister share the outrage of Unison members and indeed the general public at the politicalisation of the arrival of the British military to actually support our doctors and nurses during this critical time?
I think that certainly all trade unions have a legitimate right to ask questions on behalf of their members. They wouldn't be doing their job if they weren't. Their job is to question working conditions and practices of their members in any scenario. But I think that the Health Minister, this is well rehearsed, the Health Minister made a request for support staff and support from the British Ministry of Defence. And, you know, our priority the whole way through this has been to keep people safe and to save lives and to protect the health service. So no measure was ruled out, but the health service made the request. That has now been met, and that's a matter of fact.
Robin Newton, supplementary.
Thank you, Mr. Speaker, and thank the Deputy First Minister for that answer. Can I ask the Deputy First Minister, does she regard the military that have arrived here in support of our doctors and nurses to be either unprofessional or inadequately trained?
My only priority throughout all of the pandemic has been to save lives, keep people safe and protect the health service. We're in a hugely difficult position right now, so it's really, really important that we support the healthcare staff that are there day and daily, stretched to the limit, doing a great job on behalf of all of us who may at some stage need the health service. So I want to commend all the health service staff for the work that they are doing.
I call Jerry Kelly.
Would the Minister join me to thank our healthcare staff for the enormous contribution they have made in protecting us through the pandemic, and would she agree that the Executive should consider using some of the COVID funding available as set out by the Finance Minister earlier to provide a thank you payment to health workers as a gesture of our gratitude to them throughout this unprecedented health crisis?
Yes, and again, just to share with the commentary around how amazing the healthcare staff have been throughout. In general terms, they're always amazing, but certainly throughout this pandemic, what they've had to do has just been immense, and the pressure that they're under must be immense, and none of us can even imagine being in that situation day and daily and the circumstances in which they're having to work. So if there's a way for the Executive to be able to pay one-off thank you payment, then that's absolutely where we should be. I'm glad to say this is something that the Executive will discuss. Certainly the Finance Minister is urging the Department of Health to come forward and bid for that, and I hope that we can get a positive resolution to that.
Unfortunately for the member, the time's up. And I ask members to take a raise for a moment or two to switch the tables. All right, members, we now move on to questions to the Minister for the Economy. I call Rosemary Barton to ask the first question. Ms Barton.
Thank you. Minister, question 1.
Call the Minister for the Economy.
Thank you, Mr. Speaker. Mr. Speaker, with your permission, I would like to group together questions 1 and 10, and also to avail of an additional minute for answering the question. So can I thank the members for their questions on this very important issue. While my department is responsible for higher education policy in relation to teaching and research in Northern Ireland, student accommodation, whether it is university halls of residence or private rental housing, is a matter between the individual student and their landlord. Whilst my department has no remit or legal basis for determining whether students should receive a refund or reduction of their accommodation fees as a result of the disruption caused by the COVID pandemic, I do recognise the very difficult position many students find themselves in as a result of the COVID restrictions. I have therefore been examining ways in which to provide additional levels of support, speaking with the Student Loan Company to investigate whether they could deliver payments to all Northern Ireland students. I have written also to local universities to encourage them to widen the criteria for assessing hardship, and I have spoken to the Vice-Chancellors of both Queen's and Ulster to reiterate my commitment to making more funds available for student hardship support. I am pleased to see our universities taking some steps to support students who have experienced difficulties with their accommodation contracts. My department, through the universities, continues to provide support to any students who are facing financial hardship for whatever reason, including difficulties with their accommodation contracts. In recognition of these difficulties and the ongoing impact of the COVID-19 pandemic, I have indicated to the Finance Minister that I will be seeking additional funding, increasing the total amount that will be available for student hardship in the current financial year. I have also instructed the universities to publicise and promote the availability of these additional funds to ensure that they reach eligible students as quickly as possible, and to consider whether any requirements set by their institutions for students to access funds can be relaxed or removed. Thank you, Mr. Speaker.
And I call that Rosemary Barton supplementary.
Thank you. Thank you, Minister, for your answer. Minister, you talked about seeking additional funding for student hardship. That's very well and very fine, but many students have had difficulty meeting the criteria for this student hardship fund, and in particular when they've had trouble with the private student accommodation providers, and they've already signed contracts and they can't get out of these contracts. Minister, what conversations have you had with the private student accommodation providers who are unable to get out of these contracts?
Can I thank the member again for her question? The member will recognise that the contract between the student and a private landlord is a matter for them and is legally binding between them. However, just this morning, in fact, I spoke again to the Vice-Chancellors of both Queen's and Ulster and indicated to them that there is additional funding available for hardship funding, that funding needs to be available for those students who are having increasing difficulties with their rental contracts because they have been unable to, for example, to seek additional employment and part-time employment that students would normally have during this period of time. So I would hope that in the reasonably near future we would be able to bring forward a fuller paper in relation to this issue and will revert to the member in due course.
I call Mark Durgan.
Cian Collier, and I thank the Minister for her answers thus far. Listening to the many students who have been in contact with the SDLP, the Student Hardship Fund does not seem fit for purpose. The eligibility criteria is restrictive, the process arduous, and the waiting time very lengthy. Does the Minister agree that we need a dedicated COVID-19 student support fund that gets money out fast and directly into the pockets of those who need it? It's our view we needed this 8 months ago, and students desperately need it now.
Again, can I thank the member for his question? The one thing that I have learnt in all of the funds that we have administered within the department, and those have been a very wide-ranging number of funds, is that we don't need to replicate, but rather use more effectively what is already there. And with that in mind, as I said this morning, I was speaking to both the Vice-Chancellors of Queen's and Ulster, urging them to bring forward proposals as to how they might look at the eligibility for the existing hardship fund, how that might be improved to ensure that students have greater knowledge of it, greater access to it, and that we will be making further funding available to them on this particular issue. Last week, I also wrote to the Vice-Chancellors at Queen's and Ulster and reminded them of their duty to ensure that students have access to these funds that have been made available within Northern Ireland. I also reminded them that they should review their compliance with consumer protection law in relation to the way that courses are being offered and the levels of fees that are being charged. They have assured me this morning that they will be following up on my letter to them, but I want to make it clear to universities that they need to be clear up front with their students as to the teaching and the type of teaching that each one will have as they go through university in what has been a really difficult year for many students.
I call Sinead McLaughlin.
Thank you, Mr. Speaker, for letting me in. Minister, over the weekend, our party put out a survey for students to see how they felt they were impacted by this pandemic. 75% of them have said that they are really badly affected in terms of finance. Also, 50% have said that they're paying for accommodation that they're not living in. But very harrowingly, 94% said that it's affecting their mental well-being. And that, to me, is something that we all have to sit up straight and take on board. Minister, your colleague in the Welsh Government has put together a £40 million support package for students. This is on top of the Student Hardship Fund. An additional £10 million was put into the Student Hardship Fund. I think we need something of that magnitude. I think just feeding the Student Hardship Fund as it stands now is not good enough. This has to be an all-student support fund that helps all of our young people. Thank you.
The member raises a really important question, and one which has been communicated to me as a constituency MLA and also as Minister, and one which I spoke specifically this morning to the Vice-Chancellors about. All of them report increased demand for mental health services for young people who feel under significant levels of stress, either through financial hardship or just the remoteness of the way that their course is being taught, etc. I have asked the universities to look again at their provision for mental health on campus and bring me proposals that would add to the provision for those young people while they are students at university here in Northern Ireland, and we will do our best to make sure that we meet those needs as identified by the universities. And indeed, I hope to have a conversation later on in the week with student representatives as well. This is an extremely important issue that has, I think, been exacerbated because of the COVID restrictions. I could list the interventions that we have already made in relation to additional help for higher education, including an uplift in the number of students, and that was before we had the uplift for those additional requirements after A-levels, additional support for part-time the Open University, providing a safer environment and taking into account COVID restrictions, additional money for research and development, additional funding of over £2 million for the postgraduate awards scheme, the additional funding that we've given for the COVID rapid response research and innovation funding, the student support loans that we've currently done. That and more will be required, and as I say, I'm committed to bringing forward that paper to the Executive.
I call John O'Dowd.
Gurmia Cancrolia, and thank the Minister for her answers thus far. Minister, you'll be aware that over this last number of months, on behalf of Sinn Féin, I've been raising this issue with you. The Student Hardship Fund is not fit for the purpose a task in terms of compensating our students in relation to the COVID-19 pandemic. I note your comments that you don't want to replicate the system, but you want to get the money out the door. So if the Student Hardship Fund is going to be used, then you have to ensure that it's going to compensate our students for rent for accommodation they're not using. In relation to the student loans, I welcome the fact that you're now engaging with the Students' Loan Company and that students hopefully now will be compensated for their fees. But there's going to have to be a substantial amount of money bid for, because students and their hard-pressed families cannot afford another false dawn. Minister, will you commit to ensure that the package you bring forward is fit for purpose and does compensate our students? And can I also add, we also have to remember our higher education colleges, our further education colleges as well.
I'll start with the last one first, because one of the things that we are accused of is always focusing on universities, and there are a significant number of young people and students of all ages who do their degrees or their foundation courses through our further education colleges, and of course anything that we will do will be replicated there as well, and it's very important to say that. Again, I will reiterate that I have been speaking with the two Vice-Chancellors. I've asked them to work with my officials to look at how we can get more funding out through the Student Hardship Fund and make that available to students in Northern Ireland. I have had a conversation with the Student Loan Company. I must say, not the most fruitful of conversations, but we will continue to pursue that conversation to see is there a mechanism there whereby we can help students in this most difficult of years. And of course, I have also told universities and reminded them of their requirements under consumer protection law to work with students, provide clear information to students as to how their course is delivered, and to see if they ensure themselves that they are providing value for money to each young student in Northern Ireland.
I call Rachel Wood.
Thank you, Mr. Speaker. Can I ask the Minister if, in any review of the support for students, if she intends to negotiate with universities to allow tenancies in universities to be terminated without notice or without penalty?
This was part of our conversation this morning. My understanding is that for those young people who have asked, Queen's have offered to allow them a holiday from their accommodation fees. This originally was up to the end of January, but the Vice-Chancellor there assures me that this will be up until the restrictions end, but I've asked them to look at that again. I understand that Ulster have taken a slightly different approach of looking at this on a case-by-case basis, and I've asked them to review that as well and to come forward with proposals.
Moving on, I call Paul Frew.
Mr. Speaker, question number 2.
The North-South interconnector would increase the capacity to transfer electricity into Northern Ireland and reduce the risk to Northern Ireland electricity consumers of insufficient generation supply to meet demand. Pressure on maintaining security of supply can be affected by a range of factors, including low wind, resulting in reduced renewable generation, thermal plant generator outages due to maintenance or repair, and traded export of electricity to Great Britain through the Moyle interconnector. Northern Ireland has a relatively small electricity network with a limited number of thermal power stations, and there is a greater risk of loss of supply than would be the case in a large and highly interconnected system, where a large number of power stations can depend upon each other for support in the event of unforeseen disturbances. The electricity transmission network operates on an all-island basis. However, there is currently only one high-capacity interconnector linking both jurisdictions. This restricts the amount of electricity that can flow from north to south to support security of supply. North-South interconnection is therefore critical to ensuring electricity security of supply for Northern Ireland electricity consumers in the long term.
Supplementary, Paul Frew.
Thank you, Mr. Speaker, and I thank the Minister for her answer. And whilst I agree that interconnection in general is very, very good because it adds flexibility, it can also cause issues, especially in our environment, whereby EirGrid owns Sony and are quite aggressive around governance issues. In 2013, the NLLS, which is the No Load Loss Sharing Policy, was changed without any consultation or explicit approval by the utility regulator or the department. It was reduced to only 100 megawatts, which means that in stress or alert positions of low capacity, where both jurisdictions will be struggling, but the Republic of Ireland more so because of data centres, they can then suck power from Northern Ireland, leaving us very vulnerable. Can the Minister undertake to investigate this matter?
I do take all of these issues very seriously and recognise the danger that there is to supply in Northern Ireland. In recent weeks, as I know the member is aware, there have been a number of amber alerts in Northern Ireland driven by high demand, low levels of wind and corresponding tight conditions in Great Britain. Had the second North-South interconnector been present, security supply in Northern Ireland would have been substantially stronger, with power from excess capacity across the Same able to be transported to Northern Ireland. The second North-South line, along with the introduction of the Green Link and Celtic interconnectors, are expected to strongly improve security of supply in both jurisdictions as these assets come online in the next few years. My officials are working to ensure that the benefits of these connections are available to consumers here in terms of both lower prices and security of supply. The calculation of adequacy for the purposes of forecasting by the systems operator deploys a 4.9-hour loss of load expectation standard in Northern Ireland and an 8-hour loss of load expectation standard in the Republic of Ireland. An 8-hour loss of load expectation is used for the same capacity auctions, which also seeks to procure local capacity when and where it is necessary in the absence of sufficient interconnection.
And I call Steve Egan.
Thank you very much indeed. May I thank the Ministers for her answers so far, and indeed from the questions from my honourable friend from North Antrim. There is indeed a question of base load capacity within Northern Ireland that needs to be identified. But the question, Minister, is the fact that under the Northern Ireland Protocol, there are significant issues with the ISEM and the use of electricity trading, particularly across the east-west links. Could the Minister explain to us what discussions she's had, particularly with Michael Gove, to make sure there's an equitable use of the east-west interconnection process, to make sure we're not over-reliant on just a north-south or very limited baseload capacity in Northern Ireland?
Again, can I thank the member who brings up an interesting and important question on the impact of the Northern Ireland Protocol on the SEM and indeed on capacity. Can I answer in the general at first, which is really to say that the Northern Ireland Protocol in this instance has provided the level playing field necessary for the continuation of the single electricity market. And one inevitable consequence of EU exit is the loss to European platforms for cross-border trading in electricity. As a result, trading between the SEM and GB has moved to baseline arrangements which are less efficient and more difficult. The market operator reports that the changeover to the new arrangements has gone smoothly. All systems are working well. The full impact of the change in the GB SEM trading arrangements is still being assessed, but it is clear that, as expected, the loss of efficiency is placing an upward pressure on prices.
I call Cathal Boylan.
Thank you, Mr. Speaker, and thank the Minister for her answer so far. Minister, just in relation to, in the context of an economic recovery strategy, decarbonisation needs to be a priority. So, in the development of the new energy strategy, will the Minister ensure that community-owned energy projects are supported and facilitated to provide opportunities for local groups and develop proposals on projects to support the local community through renewable energy itself?
Can I thank the member for his question? And we are well on our way to, I hope in the late spring of this year, producing our consultation paper on our new energy strategy for Northern Ireland, which I hope will be a catalyst not just for energy efficiency, but also for that green growth recovery that Northern Ireland requires, and indeed many of its citizens expect. I want to see a wide-ranging consultation, including those with local communities and their contribution to the decarbonisation of energy within Northern Ireland. And therefore, I hope that the member will take this out, the consultation, to his local community, so that we can talk to people about how we can together decarbonise energy for the future, and in doing so not just create a more sustainable environment and climate for Northern Ireland, but also produce jobs and prosperity.
And I call Michelle McElveen.
Question 3.
Thank you for the question. And Mr. Speaker, with your permission, could I group questions 3, 4 and 12? And again, Mr. Speaker, with your permission, I would like to avail of an extra minute to answer this. I have always been clear that despite extensive business preparedness activity here in Northern Ireland, a lack of detail on trading arrangements after the end of the transmission period would impact our economy. Late clarity in the operation of the protocol and the UK-EU Trade and Cooperation Agreement has left businesses in a difficult position, and this has been exacerbated by COVID restrictions. I remain concerned with the lack of preparedness by GB suppliers for customs requirements for goods destined for Northern Ireland, leading to disruption to the haulage and logistics sector and difficulties with supply chains. Late guidance on parcel deliveries has led to firms suspending deliveries to Northern Ireland, although many have since resumed. Over the last number of days, I have been working with my Westminster colleagues and industry representatives, and I'm glad to report that we have found a resolution to the issue of steel, which, if 25% tariffs had been implemented, would have decimated our local manufacturing economy. I continue to work with Government to secure wider clarity and guidance on the complex situation with at-risk goods, rules of origins, tariffs, and importantly, and little talked about by our Government, the reimbursement scheme that has been promised. I will continue to engage with our Government on all of these issues, and also welcome the reintroduction of the VAT margin scheme for second-hand cars. However, I am mindful that many of the mitigations that have been found are short-term and require longer-term solutions. Every option should be explored here, including that of Article 16 of the Protocol. My department continues to provide guidance and support to businesses navigating the new trading environment and continues to offer support through Invest NI and Intertrade Ireland. Despite these challenges, I remain ambitious for our economy. I want to ensure that we can resolve issues, seize opportunities for growth within our own UK internal market, secure foreign direct investment and increase exports to the rest of the world.
Michelle McIlveen, supplementary.
Thank you, Mr Speaker. I'd like to thank the Minister for her answer and welcome the resolution to the issues around steel, which is critical for manufacturing in Northern Ireland. Last Wednesday, the Infrastructure Committee heard from a delegation of haulage sector representatives about the challenges that they are facing as a consequence of the implementation of the protocol, and they were united in their call for the simplification of the systems now being imposed. Can the Minister give an assurance that she will use her influence to articulate these views with the relevant HMG departments and those in a position to bring forward easements to allow trade to resume to a level which is required for Northern Ireland?
Again, can I thank the member for her question. I have been meeting with members from the haulage industry in Northern Ireland, and they report significant and ongoing problems. Some of these problems, as I have said at my first answer, are related to the lack of preparedness by GB businesses who simply are unprepared for the level of paperwork that is now required for that access between parts of the United Kingdom's internal market. They report that while trade is flowing reasonably well between Northern Ireland and GB, because of this lack of preparedness, they are left at times with empty lorries to be brought back and a significant cost to the consumer. And Mr Speaker, one of the things that I have warned against in speaking about the protocol on many, many occasions in this House and in other places is the fact that the protocol would bring more cost, less choice and more difficulties for the United Kingdom's internal market and its interaction here in Northern Ireland. Indeed, last week I spoke with my colleagues from Scotland, Wales and the new Business Minister, Paul Scully, and we are going to have a dedicated conversation around this particular issue because we need to resolve this, particularly since, as I said in my previous answer, many of the mitigations are short-term and will come back and visit us over and over again unless we find those long-term solutions. And our hauliers and logistics industry must be part of that solution.
Nicole Roy-Beggs.
Question number 4.
That's supplementary. Your questions grouped.
Apologies. The Northern Ireland Protocol has resulted in significant additional costs. Some suppliers are choosing not to supply Northern Ireland. Some are not able to supply Northern Ireland. I'm thinking of seed suppliers, plant suppliers, animal product suppliers. And there is concern that in the future the requirement for vets and animal health inspectors to sign off goods and food items in particular, that they will not be able to do so on a timely basis. So my question to the Minister is, are you and the Executive as a whole collectively leaving the past behind, the past battles behind, and moving to try and find collective solutions by engaging with Her Majesty's Government, the EU, the Joint Committee Working Group to get practical working outcomes, simplification, so that trade can continue and costs can be kept to a minimum?
The member raises a really pertinent point, and one, again, I will repeat for this House. For those parties in this House who call for the full implementation of the protocol, we are now seeing what that full implementation, or shall I say, rigorous implementation, now looks like. And it looks like greater cost, less choice, more bureaucracy for our firms as they do business with our biggest market. I have said over and over again in my department and on behalf of my party that my greatest challenge is to ensure that we are able to do trade within the United Kingdom's internal market, which is our greatest market, the market where we do more trade than with the Republic of Ireland, the rest of Europe and the rest of the world all added together. That is crucial for Northern Ireland's prosperity and for all sectors of our economy. I therefore would indicate also to the member that, as he knows, I have been working on issues of second-hand cars, on steel, on a wide variety of issues to bring practical solutions to this most difficult of issues.
And the time is up for list of questions, and I move to topical questions, and I call on Justin McNulty.
Minister, the delays in paying out the support schemes have been hugely frustrating for businesses and families. Despite the welcome furlough scheme, there are still costs for businesses to retain staff, and there are serious cash flow issues. Does the Minister agree that if she does not get the financial support out the door urgently, businesses will be at risk of going to the wall and will be forced to make redundancies and let workers go?
And I thank the member for his question, and may I just remind the House that during this pandemic, my department has made available to businesses by now almost 400 million in support of tens of thousands of businesses within Northern Ireland. We are currently working on a range of schemes for businesses in Northern Ireland, including the COVID restriction support scheme, the tourism schemes, and a range of other schemes. I understand that businesses need to have their finance also in a timely fashion, and will continue to push Invest Northern Ireland to make sure that that happens. But I would also remind the member that there are many other schemes across government for financial support for businesses not administered by my department.
Just McNulty, supplementary.
Can I thank the Minister for her answer. And whilst I welcome that there have been financial payments made to numerous businesses, judging by the volume of issues being raised with me on a daily basis from businesses who are on their hands and knees seeking payments, it doesn't ring true. Can the Minister tell me of how she intends to produce, tell me if she intends to produce a comprehensive COVID-19 recovery plan, and outline how she will seek to rebuild and reboot our economy and get people back to work?
We are currently working on a recovery plan in conjunction with other executive colleagues. The member will be aware that as of the latest figures, around 68,000 people in Northern Ireland still remain on furlough. And therefore, I would suggest that one of the things that, and indeed I have already done it, but the Executive may well feel that they should do it, is to write to our national government to ensure that those national support schemes, like the Job Retention Scheme, continue, particularly for sectors like aerospace and hospitality, where I believe that the tail of recovery will be longer. I am also working on a specific and tailored plan for the Northern Ireland economy. In that, I want us not just to look at the here and now, but I want us to look at the economy of the next 10 years in Northern Ireland, where we see the opportunities and how we see the economy developing. Crucial to all of this, and something that I will be bidding for funding for, will be a dedicated skills fund for Northern Ireland. Northern Ireland is the only part of the United Kingdom that now spends less on skills than it did in 2012. We need to rebalance that equation, and we need to understand that for us to have economic recovery, then we need the skills to match that recovery, and we need to be flexible and urgent in bringing forward those skills and the schemes for that. And I look forward to the member's support when I ask for funding for a dedicated skills fund for Northern Ireland.
I call Paula Bradley.
Thank you, Mr Speaker. Minister, you will know from during your question time and the questions that were laid down the various issues that are facing students, and we know housing was one of them, but there are other issues as well. Can I ask what discussions you have had with our local universities about additional support for students?
Again, can I thank the member for her question. I have been, as I said previously on this occasion, speaking with the Vice-Chancellors of both Queen's and Ulster University. And I want to ensure that what we're doing for universities is appropriate for students and meets the needs of students. So therefore we need to look at the hardship fund, how that hardship fund is administered, and if there are relaxations that we can bring to bear on that hardship fund. This morning I also spoke with the universities around issues of mental health and how we can continue to support students who sadly are reporting increased need in this particular area. And perhaps something that hasn't received a lot of conversation in this particular question time is the issue of providing data for students who now have to conduct much of their courses online. We are looking at all of those issues and will bring forward a package in due course.
Paula Bradley, supplementary.
Thank you, Mr Speaker, and can I thank the Minister for her answer. Minister, you raised some very valid points there, especially around mental health, and we are hearing through our constituency offices just how this is affecting our students. You also mentioned there about the hardship fund, and we know with all of these funds there are criteria, and criteria is quite limited. So can you give us your assurance that you will speak to the universities to see about broadening that criteria to encompass more people to receive this hardship fund?
Yes, I think that one of the things we need to look at is how more people can access the hardship fund and how more students know about the hardship fund and how to apply. So I will be working with the universities over the next short period to look at those issues, and also with student representatives to hear their views on this as well.
I call Dolores Kelly.
Thank you, Mr Speaker. Minister, late last year, I think about 4 months ago, you made an announcement about help for apprentices, and yet there's been very little, if any, money paid out. I think out of the Challenge Fund there's been nothing paid out as yet, and in the other out of 197 applications to the new apprentice recruitment incentive scheme, only 32 payments have been made. Minister, are you aware of where the problems are, and how do you intend to fix them to ensure that these hard-pressed young people and businesses get the support they so desperately need?
Can I thank the member for bringing forward this question, because this is one of the things that I think is hugely important for young people, but also for the future of the Northern Ireland economy. I would like to see us place value in our apprenticeship system. I would like to see increases in, for example, all-age apprenticeships, and over the next year we'll be bringing forward to set the pathway for all of those things, because I think apprenticeships offer real opportunities for young people. Our apprenticeship fund was to do three things. One was to retain those apprentices that were in the system on furlough but in danger of not returning to work. The extension of the furlough scheme has somewhat clouded that ambition on that particular issue, because many of those young apprentices remain on furlough. And as I said earlier in this debate, around 68,000 people in Northern Ireland remain within the job retention scheme run by our national government. The Challenge Fund is currently working its way through those proposals and will have an outcome reasonably soon. And we hope to continue to work with employers in a most difficult environment to look at how we can create new opportunities for apprentices, because I do believe that they are hugely, hugely important. Can I say as well, for those young people who are worried about, and many of these young apprentices will of course take vocational exams, I did take the step last week of making sure that vocational exams were cancelled. I have asked our own exam regulator to bring forward proposals for those Northern Ireland-based exams by the end of February and the start of March for the national ones.
Dolores Kelly, supplementary.
Thank you, Mr Speaker. Minister, I think we are agreed on the importance of value in apprenticeships and vocational training. Nonetheless, whilst I accept there may well be some young people and businesses using the furlough scheme, nonetheless there are several applicants, over 197, and only 32 have received any help. So what are you doing within your department to fix that? Because if they wouldn't apply to the scheme if they were on furlough, so there's something obviously wrong within the department.
I, of course, will come back to the member with the precise details on this particular issue and will write to you about them. But can I say in general, this is a priority for me within the department and we intend to work through it.
I call Cara Hunter.
Thank you, Mr Speaker, and I'd like to thank the Minister for being here today, as I have a question of real concern. As mentioned by my colleagues earlier, the SDLP surveyed hundreds of students this week about their experience throughout the pandemic, and results have been really quite harrowing, with 79% of students saying they have been excluded from financial support. Given a one-off payment of £500 to every Northern Ireland student would cost approximately £32 million, just a fraction of the £105 million your department has handed back, will the Minister commit to introducing a support fund for students?
Well, as I've reiterated on a number of occasions today and in answer to a number of questions today, I have been in touch with the student loan company to see if they can facilitate any of these particular issues. I must say that I was disappointed in their response, but I will continue to pursue that conversation with the student loan company on that particular issue. In the meantime, I have also been speaking to the Vice-Chancellors of Queen's and Ulster to see what more universities can do in order to help students at a difficult and really harrowing time in their education.
Supplementary, Cara Hunter.
Thank you, Minister. Minister, your respect, when we talk about students, we're talking about real people, real problems, real worries, real bills and real stress. With 94% of our students surveyed, they said the pandemic has negatively impacted their well-being. And while I respect you've had at-length discussions with student loan companies and Vice-Chancellors, talking is not enough. As a former student myself and as an MLA, I'd like to ask the Minister, does she intend to abdicate responsibility and blame everyone else, or commit today to helping our students financially?
I fear the member hasn't quite been listening to the whole conversation here in the chamber today, in that I've already committed to bringing forward a package in relation to the issue.
Robbie Butler.
Thank you, Mr Speaker. Didn't think I would get him at the time. Minister, you will be aware of significant delays for business and desperate need for the second payment of the CRBSS grant. This is being compounded by a void of communication. What plan do you have to improve communication to businesses?
Invest Northern Ireland do have a dedicated helpline, which I know that they are working through with members who have applied for the particular grant. I hope that payments will go out very, very soon in relation to that. But in the meantime, I would remind the House that this particular grant, it's not as large a fund as the local restrictions grant run by the Finance Department, has already paid out £17.5 million to individual businesses in Northern Ireland to help them through the pandemic. And just this morning I was signing off a bid for further funding for this so that we can continue to make the payments right up to the end of the 5th of March.
And members' time is up, and could I ask members to take a raise for a moment or two, please? Thank you. Okay, members. I've received notification from members of the Business Committee of a motion to extend the sitting past 7 p.m. under Standing Order 10.3a. Clerk, please read the motion.
That, in accordance with Standing Order 10.3a, the sitting on Monday, 25th of January 2021, be extended to no later than 8 p.m.
I call John O'Dowd to move the motion.
So moved.
The question is that the motion standing in the name of John O'Dowd be agreed. All those in favour say aye. Contrary, no. The ayes have it. The motion is carried and the Assembly may sit until 8 p.m. this evening if necessary. Thank you. And moving to our next item is on the urgent oral. Mr Pat Sheehan has given notice of an urgent oral question to the Minister of Health. I would remind members that if they wish to ask a supplementary question, they should rise continually in their places. The member who tabled the question will be called automatically to ask a supplementary. Clerk, please read the motion.
To ask the Minister of Health, given the increase in activity in private healthcare providers reported recently, what efforts he is making or has made to utilise the resources and capacity of private healthcare providers for the provision of public health services during the pandemic.
And I call the Minister of Health.
Thank you, Speaker. Speaker, the spread of coronavirus is continuing to cause serious disruption to our health and social care system, and elective care activity has had to be reduced, unfortunately, in an attempt to free up capacity, including staff, beds and critical care services. The first and second waves of the pandemic place unprecedented demands on acute services, with elective work reduced or postponed, and the position has further deteriorated during Surge 3. Given the impact of COVID-19 on health service operating capacity, I made it clear that all possible sources of additional capacity should be utilised. This has included securing theatre capacity from local independent sector health providers, and as has already been made aware, that this has allowed many hundreds of the most urgent and time-critical patients to be treated. From April to December 2020, approximately 3,900 patients have been treated by local HSC consultants in the 3 local independent sector providers. Provision for continued access to the 3 independent hospitals had been made up until the 31st of March 2021. However, given the impact of the 3rd surge, I can confirm that we have recently secured a further 112 theatre sessions for health and social care cancer and time-critical patients. In addition to this, some capacity has been secured from Republic of Ireland private clinics, and discussions are ongoing with NHS England for in-house and IS capacity for Northern Ireland patients. I have recently approved the establishment of a new regional approach to ensure that any available theatre capacity across Northern Ireland is allocated for those patients most in need of surgery, both during surge and as we come out of this surge. This will include seeking to continue to fully maximise all available in-house HSC and independent sector capacity both within and outside Northern Ireland.
I call Pat Sheehan for supplementary.
Thanks to the Minister. And it must be absolutely devastating for anyone to get a cancer diagnosis and then to be told that your treatment is going to be cancelled. Must be even more devastating. And we had 3 chief executives from health trusts in last week, and we were told that in some cases the cancer will have spread before these people receive treatment. Can the Minister tell us why he didn't scope out capacity in the private sector before the health trust made an announcement about the cancellations of treatment? Because this has made the situation all the more worse for those patients who do have that diagnosis of cancer. And can I also ask the Minister, while I'm here, Joe Biden has brought forward a 200-page strategy for combating virus within 2 days of being in office. When is the Health Minister going to bring forward a strategy to deal with this problem?
I thank the member. Look, he has raised this strategy time and time again, and what I've said to the member time and time again, it's an executive strategy. The First and Deputy First Minister announced a COVID executive task force so we could bring forward all the parts together. The member can shake his head all he wants, in this regard. But he has to realise that every minister in the executive has a responsibility. I know members on the other side of this House at times would want to put the full responsibility on me and my department, and I'll bring forward that as a health response. I always have and I always will, but I bring forward recommendations to the executive, who bring forward an executive strategy as a whole, as they did back in May. In regards to the utilisation and uptake of the independent sector, I've already said in the answer as well, between April and December of last year we engaged 3,900 and supported 3,900 patients through that surge. What we've done in regards to this third surge and into this is actually gain further additional 112 theatre sessions from those independent providers. So we already have engaged and continue to engage to see what additional capacity they can supply.
Jonathan Buckley.
Mr. Speaker, the Minister will know full well acutely the catastrophic news for cancer patients during COVID-19, particularly with the cancellation of services. Given that some individuals and others waiting on planned elective surgery have been able to commission their own surgery through private and independent providers, is this not a worrying sign within the Department of Health, especially on a day like today where we have heard that the Department has had to give back £90 million of unspent money? What actions will the Department of Health take to utilise all available capacity in its own facilities and indeed the private sectors in Northern Ireland and further afield, including paying for the private treatment, as many cancer patients, through no fault of their own, have had to borrow money to get the urgent treatment that they require at this time?
And I thank the member for his point. I think one of the things that has to be made clear is during this surge, which actually was unlike the first and second surge, was those independent providers continue to support their own patients as well. And what we actually saw, or what we are actually seeing during this surge, which we hadn't seen, was actually the demand for private patients had not dropped off, but it actually increased. So where we were able to get that additional capacities in Surge 1 and 2, we weren't able to get it here because there is a large uptake of the private sector actually during this surge as well. But what we are welcome of is the additional supports that we are seeing from the private sector. And the member mentions the financing of us actually utilising private sector capacity. And it is one of our critical tools in reducing waiting lists in general, not just due to COVID, but one of the largest challenges that we face as a department and actually utilising that independent sector is non-recurrent funding, because we can only go to those private sectors with a one-year allocation, a one-year pot, and what they need to increase their capacity to help reduce our waiting lists is actually that surety of 3 to 5 years funding, so they can increase their facilities, increase their staff, to actually start to eat into our waiting lists. And that's what we've been looking at, back in New Decade, New Approach. And that was the approach I was actually committed to at that point in time. But while we work on one-year financial cycles, it makes us hard to engage long-term those independent providers.
Cara Hunter.
Thank you, Mr. Speaker, and I'd like to thank the Minister coming forward to the House today. Minister, while I appreciate the immense pressures which the health service is under, I think COVID has been truly revealing of the decades of underinvestment into our healthcare system here in Northern Ireland. Does the Minister foresee that in addition to these red flag surgeries, this could lead to more routine surgeries taking place in private medical facilities?
I think following on from the member's point in regards to that underinvestment of our health service, I believe unfortunately now we are paying the price of that underinvestment, not just in staff but also facilities as well. And that's why, when we look at our waiting list in regards to even elective inpatient day case procedures, the only way that we'd be able to make a serious attack on those ever-increasing numbers is actually utilising the independent sector as much as we possible. But as a response that I gave to Mr Buckley in my previous answer, until we get that long-term surety of recurrent funding of actually how we can address and eat into those waiting lists, it makes that a difficult relationship. Because one of the things when I met them just over a week ago, they said the one thing they reminded me of was that they were already partway through a financial year where we were using independent sector, when the then minister who was in place at that time actually cut all funding for the utilisation of the private sector, and that's when our waiting lists actually started to escalate again and actually increase.
I call Alan Chambers.
Thank you, Mr Speaker. Last Thursday I was present when the member bringing this urgent oral question made derogatory remarks questioning the professionalism of 110 medics from the British military who are going to offer support to the hard-pressed staff in our NHS. How would the Minister respond to those remarks, given the call of the member on the other side of the chamber to seek additional help from the private sector?
And I thank the member for raising the point. And I will say, and I said it in an earlier answer, and I've said it since taking up this post, I'll take help for whenever we need it, wherever our staff need it, and wherever our health service needs it. A lot of detailed planning has taken place to make sure that the military technicians who are being supplied have all the support they need to hit the ground running. This will include welcome and induction to our hospital systems, including the testing requirements and vaccination, clinical and local induction, including infection prevention control and donning and doffing, fit testing, everything that's needed. These will be a welcome addition to our workforce at a time when they need that critical support as we work through this third surge, where we're seeing over 800 patients currently inpatients and over 70 people in ICU at this minute in time. So all help is welcome.
I call Paula Bradshaw.
And as the chair of the All-Party Group on Cancer, I appreciate other members raising the issue of the cancelled and postponed surgery. So I will move on from that. So you've addressed that issue. But private healthcare providers also extends to allied health professionals like physiotherapists, etc. And I'm just wondering, what way are you engaging with them in terms of taking forward support services for long COVID? Thank you.
And I think the member, and the issue is long COVID and our supports is something the member has championed exclusively, I think, since we entered even our first wave. She will be aware that I've asked the Health and Social Care Board to bring forward a response as to what that provision will look like, and I'm quite open in saying that if we do have to look to those private suppliers and private providers to actually bring that additional supports in to support long COVID patients as well, so that we can actually start to work on our extended and increasing waiting lists, we will do that.
I call Jerry Carroll.
Thank you, Mr. Speaker. Thanks to the member, Mr. Sheehan, for bringing us. I suppose the point is it's not about just going to the private sector, but bringing those beds, those capacity, those staff under control and direction of the NHS. Given we're almost a year into this pandemic, Mr. Speaker, and we have been plagued by shortages, can the Minister inform us if this issue has been raised at the Executive before, and if so, what's the political rationale for opposing the moves proposed in this question? Thank you.
I'm not sure there is any political objection anywhere across any of the 5 parties within the Executive as to the utilisation of the private sector to actually support our current health service or actually work to reduce the waiting lists. So I'm not sure if the precipice of the member's question and what is actually infringed, because I have full party support in the Executive for the utilisation of the private sector to help reduce waiting lists, and that's also seen as a commitment in next year's budget as well. It's also a commitment, a new decade, new approach that we would use all available avenues to reduce our waiting lists.
Alex Easton.
And welcome the Minister's statement there. Minister, I welcome the use of the 110 Army medics, which Mr. Sheehan seems to have an issue with. And it's even more astounding, Mr. Speaker, when Mr. Sheehan's already broken the COVID rules and is pretending to be more caring about how we deal with COVID and the staff when he's broken the rules of the regulations on COVID himself. But my question to you, Minister, is in terms of using the independent private sector, which we're doing, we also, at the beginning of the COVID pandemic, were calling for extra retired doctors and nurses to come out of retirement to help, and that doesn't seem to have been utilised fully. And I was wondering where we are in trying to get more of those people to come out of retirement to help.
And again, I think the member, one of the things that we did do was, especially entering this wave again, was re-establish and reopen our workforce appeal. To date, as of the 13th of January, a total of 1,049 part-time or recurrent workforce appeal positions have been filled. This covers 646 appointments within the health and social care sector and 403 appointments within clerical and admin. So we are making utilisation of that workforce appeal during this third wave as well, because they were brought in different waves to fill certain slots at certain times, so it wasn't a full-time position that many of those people sought in the first wave, but we are utilising that tool yet again.
Call Justin McNulty.
Minister, I agree with your stance. All hands on deck for the health service. And if a loved one is in critical care and they're in need of medical personnel, they will not care where they come from, as long as they get the care that they need. Can the Minister advise what areas in the independent sector are being asked to consider helping out in the NHS? Is it in cancer care, or is it in orthopaedics, or what particular areas might help out?
I think one of the things, when we look to our three service providers that we actually have here in Northern Ireland, they do actually bring different skill sets with them. One is mainly orthopaedics, and that's in the northwest. So we are utilising their facilities and their staff as to the best fit of what they can supply, but it's mostly about the provision of theatre staff, theatres and those intensive care, so that we can move forward actually with the provision of cancer and time-critical patients, and that's been brought forward, and those patients will be brought forward using that regional approach, so those that most are in need of accessing that capacity actually can.
Recall Gary Middleton.
And can I thank the Minister for his responses so far. I do welcome the steps that the Minister has taken to try and address the pressures. We heard from the Finance Minister earlier in relation to the £90 million underspend from the Department for Health. Minister, can you give some detail as to the reason for that? I appreciate that much of that finance will be ring-fenced, but some of the public will find it difficult to understand how there could be an underspend given the pressures, but I would just welcome maybe some clarity, Minister, in terms of how that has come about.
No, and I thank the member for his point, and I think one of the challenges that we faced when we did receive such significant allocations during this financial year, and especially to the tail end of this year, that had to be spent by the 31st of March. That's where the challenges come. If I had year-end flexibility that I could roll into next year, into the further year, or actually have a multi-year budget, I could utilise that money 5 times over. But the difficulties in our accounting system, the fact that we're in a one-year budget that is non-recurrent, puts that additional challenges of being able to spend. And I think the Minister of Finance highlighted that. Now we have been looking at different avenues, creative avenues, as to how we can retain money and spend money as well. And one of the things we actually did look was utilising the independent sector. But one of the challenges from an accounting point of view, and that's what has often beat us in many of these steps, is the fact that the money had to be spent in year. So it's not as if we could carry any of that 90 million over into next year to actually further utilise independent sector provision, something I would like to do, and something when the Finance Minister himself said, I think in a statement earlier on, that he was actually approaching Treasury to look about further being able to roll that money over into next year. I wish him every success, because I can assure the member, if he does receive that sort of flexibility and that sort of ability, my department will be able to utilise it and will be bidding for it.
Call Paul Given.
I'm struggling to understand the argument that the NHS does not have capacity whenever I know consultants that work for the NHS are carrying out these same surgeries that they had planned to do in the private independent sector. So can the Minister explain what is the problem in the NHS in terms of that lack of capacity when it doesn't seem to exist in the independent sector? And whenever the surge plans were being made, why is it that citizens today, and I know of some who are able to commission their own surgery and they can't afford it, they're borrowing money to do it, they have been able to do it, and yet the NHS, with its huge resources, haven't been able to use up all of the capacity in the private independent sector to supplement the NHS's reduction in terms of what they're providing?
And I thank the member for his point. It's something that we've often said in here as well. While consultants may have capacity, our capacity and challenge actually lies within our ICU staff and the anaesthetists and the rest of the theatre staff that we actually need to support not just the surgeon but also the patient during their operation and during their aftercare. And that's where those years of underfunding has left us, where the independent sector is able to pick it up because they have the workforce in place. In regards to picking up that spare capacity, as I said in previous answers, what we actually did see during the first wave was a lot of those patients who were actually utilising the private sector for their own use actually started to cancel operations, whereas this time they haven't. So there's a larger increase of the private sector still utilising private capacity for what is a fee-paying business for them. Now they have, through working with ourselves, actually increased their theatre capacity, as I said, an extra 112 theatre allocations between now and the end of March, which allows us to put more patients actually through. But I think one of the things that we do need to be clear of, Mr. Speaker, as well, that even from where we stand, between the 12th of January and the 18th of January, 4,262 elective procedures were carried out within the NHS. So it's not as if we've come to a complete standstill in regards to those inpatients and day case admissions as well. So that work still does go on. And for the number of cancellations, I sincerely apologise to those, but I can assure anybody that is having an operation or a procedure cancelled that we are doing our utmost to get them back in and get them seen.
Call Robbie Butler.
Speaker, thank the Minister for his words today, and the Minister has been absolutely resolute and honest in his admission many months ago as he would take help from wherever it needed to come, and he would seek help from wherever he could get it. There are many people struggling at the moment, Minister, whether that's COVID or through these red flags. But this executive has a role to play in that, in protecting people. So it's not just the intervention, it is the prevention. This is now our second wave and it's very serious. Would you agree with me, Minister, and what advice would you give to your executive colleagues that the executive needs to be in its COVID response strategy, speaking from a singular voice when it comes to the adherence to restrictions and of setting an example in the same to prevent a third incident like this?
I think the member makes a valid point, and it's something that I've always said, that the executive in this assembly works strongest when it stands together with that single voice supporting our health service, because that's what our health service workers need to hear. They need that reassurance that this place has their back at all times, and that when it comes to regulations and when it comes to the enforcement and compliance of those regulations, that not only the executive steps up and sets an example, but every member of this House steps up and sets an example as well, because I believe that's what the people of Northern Ireland expect from us, but I also believe that that's what our health service workers actually deserve from us as well.
And members, that concludes this item of business, and I'll ask people to take a raise for a moment or two. Thank you.
Okay, members, the next item of business are the motions to approve 7 statutory rules, all of which relate to the health protection regulations. There will be a single debate on all 7 motions. You know the form. I will ask the clerk to read the first motion, then call on the Minister to move it. The Minister will then commence the debate on all of the motions as listed on the order paper. When all who wish to speak have done so, I shall put the question. The first motion, the second motion will then be read into the record and I will call the Minister to move it. The question will then be put on that motion. This process will be repeated for each of the remaining statutory rules. If that's clear, I shall proceed. Clerk, could I ask you to read the first motion, please?
That the Health Protection Coronavirus Restrictions No. 2, Amendment No. 19, Regulations Northern Ireland 2020 be approved.
Thank you. Agus na siram sa an Ira Kearney, leis an wolo chorhontasi. I now call Minister Kearney to move the motion.
Iram Sakajian and Runakor Conkin, I beg to move.
Thank you very much. The Business Committee has agreed that there should be no time limit on this debate. I call on the Minister to open the debate on the motions, please. Ira Lidahall.
As you are aware, the most recent amendments to the regulations were announced in the Chamber on the 6th of January. Members heard directly from the Executive on these amendments. This included statements from the First Minister and Deputy First Minister, the Health, Education and Justice Ministers, and allowed members an element of scrutiny before they were made. Today, Junior Minister Lyons and I are bringing forward Amendments 19, 20, 21, 22, 23, 24 and 25 to the Health Protection Coronavirus Restrictions No. 2 Regulations 2020. Members will be aware that these amendments enacted measures that span the period up to and during the Christmas holidays and the subsequent weeks. With your permission, Mr Deputy Speaker, and given the number of amendments we are dealing with today, I will briefly set out the context of where we were when the first of the 7 sets of amendment regulations were made. Johnny McCorrellahar na Lassie Hashaw at Talarnach the Eastbrook and Leonu. And me, Yeru and Or, Glach and Imanas Kinyu, Srai Srienta Ura a Horch Avain. Mr Deputy Speaker, I will then focus my remarks on the amendments at the centre of today's debate. In mid-October, the Executive agreed to a period of tighter restrictions. Following a week in November, where certain relaxations to the restrictions were permitted, a further 2 weeks of enhanced restrictions were put in place from the 27th of November until the 11th of December. These restrictions were reflected in a series of amendments to the regulations up to and including the No. 18 amendment. The Executive then agreed at its meeting on the 3rd of December to allow a certain degree of reopening on the 11th of December. In some areas, they regulated for tighter measures than those that had existed before mid-October. These decisions were informed by medical and scientific advice, the assessment of coronavirus impacts on health at that time, and the most up-to-date modelling. This formed the basis of Amendment 19 of the regulations. I will now briefly summarise all 7 statutory rules. I'll begin with Amendment No. 19, which, as mentioned, came into effect on the 11th of December. It introduced a number of significant changes, including reopening of the hospitality sector with additional requirements for unlicensed premises to bring them in line with licensed premises with regard to seating and gathering of customer information. An upper limit of 500 persons for outdoor gatherings or sports events or gatherings and requirements on a responsible person and risk assessment to be carried out. A right of appeal to a court against a premises improvement notice or a prohibition notice. Reopening of close contact services with additional requirements to see clients by an appointment-only system and gathering of customer information. Removal of restrictions on the opening of non-essential retail businesses. Amendments to operating hours of hospitality services, including takeaway services and the sale of alcohol. And The regulations reverted to the mid-October restrictions relating to places of worship, marriages and civil partnerships, funerals and committals. Amendment 20, which came into effect on the 16th of December, amended the requirement for review of these regulations to allow extra time for data to become available after the Christmas holidays. It also amended the period a person must wait before forming a new linked household from 14 days down to 10 days to reflect the decrease in self-isolation period, and permitted a supermarket to use any till or checkout aisle for intoxicating liquor off sales. This allowed customers to use all aisles to reduce congestion and overcrowding and ensure social distancing could be maintained. Some minor corrections and technical amendments to the regulations to permit the continued operation of business financial support schemes were also made under Amendment 20. Amendment 21 came into operation on the 17th of December and clarified some issues around entertainment and gatherings, including what constituted a single gathering if entertainment is provided in a venue, the definition of entertainment for the purposes of the regulations, and to clarify that in an outdoor venue each group at a table is considered to be a separate gathering if no entertainment is provided, and that all the persons in a room are considered to be a single gathering if entertainment is provided. Amendment 22 came into operation on the 18th of December. These provided for extended linked households at Christmas to reflect the guidance on households meeting over Christmas and forming Christmas bubbles, allowed the use of conference facilities by courts and tribunals, and covered some technical corrections in the regulations. Amendment 23 came into operation on the 23rd of December and limited a Christmas bubble to 1 day and prohibited overnight stays connected to a Christmas bubble. Moving to the final two amendments, which reintroduced restrictions immediately after Christmas in response to an escalating disease situation and significant hospital pressures. Amendment 24 came into operation on midnight of the 25th of December, and it remains in place today. This amendment introduced the following measures: closure of non-essential retail businesses, including click and collect services, closure of close contact services, including driving instruction, with some exemptions, closure of indoor and outdoor visitor attractions and sports and leisure facilities, indoor and outdoor gatherings in private dwellings limited to members of one household and their linked household to a maximum of 10 people, including children aged 12 or under, from the two linked households to gather indoors or outdoors at a private dwelling at any one time. Indoor and outdoor gatherings, excluding private dwellings, only permitted up to a maximum of 15 people, including children aged 12 or under, with exemptions in place for work, blood donations, vaccinations and education. Indoor sport only permitted for elite athletes or for PE in or for schools. Outdoor gatherings for the purposes of exercise or sport only permitted for elite athletes, physical education in or for schools, if participants are members of the same household or linked household, or if exercise is taken by an individual and their carer or carers. Spectators not permitted for sporting events, and closure of all hospitality, with some exceptions, including takeaway and delivery services permitted from 5 a.m. to 11 p.m. Additional restrictions were in place between the hours of 8 p.m. and 6 a.m. from the 26th of December to the 2nd of January. These stricter measures were no household mixing in private gardens or indoors in any private dwelling except for emergencies or the provision of health or care services. These restrictions also applied to gatherings with a linked bubbled household. Indoor and outdoor gatherings with members of more than one household were not allowed. Indoor and outdoor sporting events were not allowed, with the exception of training by elite athletes and exercise taken with members of your own household or linked household, or exercise by an individual and their carer or carers. Essential retail could not operate except for deliveries of groceries only, or click and collect of groceries on an appointment-only basis. Hospitality could not operate between these times, including deliveries. Mr Deputy Speaker, the final Amendment 25 came into operation on the 29th of December and made the following changes: permitting taxi or vehicle hire businesses to operate during the period of tighter restrictions between 8 p.m. and 6 a.m. from the 26th of December until the 2nd of January. More clearly defined the operating hours of businesses selling food and drink to prevent businesses from flouting the regulations by taking orders prior to 11 p.m, but continuing to operate via delivery into the early hours of the morning, providing that the power to require people to return home would operate only up to the 2nd of January 2021. Alias Ceann Comhairle, Tasólagam Goléirian an méide taráite agam an cóhaics inar común na réalaithe seo agus na cospaí a bhanas leá. I hope that provides you and members with a summary of the context in which these regulations were made and an outline of their content. Mullaman Rún agus na réalaithe don Chonal. I commend the regulations to the Assembly.
Agus na séram sé chaiceala Christian Imanish, Colin McGrath. I now call the Chair of the Executive Committee, the Executive Office.
Thank you very much, Mr Deputy Speaker, and I rise to speak on behalf of the Committee for the Executive Office. The statutory responsibility for scrutinising these regulations lies with the Health Committee, and I look forward to hearing from committee members later in this debate. And as I have stated in previous speeches to the House in this matter, the Committee for the Executive Office has been consistent in its message throughout this pandemic. Everyone needs to comply with the restrictions in place to protect themselves, their families and others in the community. The Committee remains committed to the need for strong public messaging, a united front in tackling the pandemic, and for us all to do what we must do to keep people safe. The extension of the restrictions last week and last month is indicative of the serious nature of the situation that we are all facing, and consequently the Committee welcomes legislation that is intended to protect the community. I would now like to make a number of points in my capacity as an SDLP MLA, and I welcome the opportunity to be able to take part in this debate today. As has been noted, the health protection regulation amendments we are debating and being asked to ratify today are numbers 19 through to 25. Now, I have said many times in this chamber that the way that we ratify these restrictions frankly seems more convoluted than it needs to be, and today's debate could not be more illustrative of that. Today we are debating Amendment 19, which concerned the easing of restrictions and came into effect on the 11th of December. Amendment 20, which amended Christmas bubbling and the length of time people had to stay in self-isolation, came into effect on the 16th of December. Amendment 21, which concerns entertainment venues, came into effect on the 17th of December. Amendment 22, which concerned Christmas bubbling, again, and it came into effect on the 18th of December. Amendment 23, which made Christmas celebrations a one-day event, came into effect on the 23rd of December. And Amendment 24, which is the reintroduction of restrictions, coming into effect on the 24th of December. And finally, Amendment 25, which concerns taxis and the limiting of operating hours, came into effect on the 29th of December. So, Mr Deputy Speaker, this really is quite the timeline. But what is it a timeline of? Is it a reflection of our healthcare system or staff? Is it a timeline of the public adherence to the regulations? Or perhaps it is a timeline of how businesses have responded to the virus? Well, no, The timeline that I have detailed is a reflection of the joint heads of government who allowed petty politicking to get in the way of public health, public messaging and local businesses. Now, Mr Deputy Speaker, however they tried to spin it, the long and the short of it is that their dysfunctional relationship has resulted in where we have ended up today, which is instead of any sort of forward planning, they have instead reacted to every iteration of this virus and how it has impacted our daily lives. We are almost a year into this pandemic. At this stage, inability or unwillingness is no excuse. Frankly, they never were, but you would like to think at this stage that the two parties would have learned something. Now, Mr Deputy Speaker, I'm sure my MLA colleagues in Sinn Féin and the DUP will sit there and shake their heads and denounce my words today because they know that it's a five-party executive. So why is it someone from the SDLP that is standing up and saying this? And while I am certainly not privy to the workings of an executive and the meetings, I do hear about those meetings from local broadcast reporters on Twitter, and it does give the impression that the papers surrounding the restrictions that we are debating are not being distributed in good time. Meanwhile, the cross-community vote has been employed in the past, and we all know where that has left us. And all at the same time, our public are contracting the virus, they're dying from the virus, businesses are falling apart, and our high street is disappearing. And our healthcare staff continue to cry out that they are at their breaking point. In the run-up to Christmas, we were able to offer our public a bit of hope for their Christmas and a hope for the new year as the vaccine became more readily available and then the timeline I have detailed rolled out. Our response from our government unravelled and we witnessed those awful and horrifying spiking numbers. Now, some may be asking what is going to be my final analysis of that. Well, back in March, I said in this very chamber when we discussed the coronavirus bill, I said that this moment, this day, can be the defining moment of this Assembly. There is no other single issue, not one in a generation, which has brought people together and washed clean old grievances as this one. And while our public have had to socially distance themselves and separate themselves from loved ones, they have actually been brought closer together. But they have not reneged on what they have had to do. When businesses were faced with a terrifying virus, they put in the manpower and responded in such a way to support the public, and they have not reneged on this. And when our healthcare system faced a pandemic no one had seen the likes of before, the staff stepped up to the mark, went over and beyond the call of duty, and issued a fearless response with such courage and relentless energy that a gladiator would have been envious of, and they have not once backed down from this challenge. Mr Deputy Speaker, what did we see from our joint heads of government? We saw petty politicking, pride and reaction. And at this stage, I think the public have frankly had enough of that. So I would say get your heads in the game, get over yourselves and show leadership. We've had enough of reactions. We've had enough of bickering. We've had enough of division. It's time to start forward planning and looking for an exit strategy from this virus. Thank you.
I call Paula Bradshaw, Deputy Chair of the Health Committee.
Thank you, Mr Deputy Speaker. I stand in today for the Chair and Vice Chair. I rise initially to respond on behalf of the committee and will then make some remarks in a personal capacity. The suite of rules before us today gave effect to quite different approaches to restrictions within a few short weeks. The committee's briefing on the regulations spanned its meetings of 14th and 21st of January, the former of which I chaired. Members acknowledged the grave circumstances in which we find ourselves and the need to do all we can to reduce the strain on the health service and its staff, who are facing into the 11th month of relentless pressure on our behalf. Having discussed on many occasions the urgency with which these regulations are being made and the resulting lack of prior engagement and impact assessment, the committee inquired about efforts to analyse the impact retrospectively to ensure future regulations are informed by such learning. The Director of Population Health advised the committee that significant progress had been made in consulting the sectors affected by the regulations and that the number of amendments reflected the learning and responsiveness. She further alluded to an ongoing review of the impact of the regulations. When asked by the committee to share the outcomes of the review, however, the official indicated that she would have to take this request away for consideration since it is more of a continuous process. The committee would appreciate early sight of any analysis produced by the review. Asked about the learning in relation to the arrangements put in place over Christmas, the Director acknowledged that what we are seeing now is clearly the impact of the relaxations that we are talking about today, but pointed out that Amendment 25, reversing some relaxations, reflected a response to the emerging data. She further advised that the modelling group is engaged in a constant process of review, overseen by the Chief Scientific Advisor and provided with updated information on a weekly basis. In terms of compliance raised by members, the Director acknowledged that it remains an area of ongoing concern, advising that there is active discussion on the subject across various groups, levels and sectors. She explained that the approach remains one of education first, in an effort not to be heavy-handed, and that the interplay between rules and public attitudes and behaviours is not always predictable. Reflecting on the extension of the requirements to gather customer information, the official was asked whether any consideration had been given to including postal addresses in order to discourage breach of the two-household rule in hospitality settings. The committee was advised that names and phone numbers are collected primarily to enable customers to be contacted if necessary, but the official undertook to consider the potential compliance benefits of requesting postal addresses. I would be grateful if the Junior Minister, who will be responding, could give any available update on this matter. Effective scrutiny and accessible information remain significant issues for the committee. Members have not always found the online information entirely clear, up-to-date and accessible. Given that we are now at Amendment 25 to the No. 2 regulations, the committee has previously asked to be provided with what effectively would be a tracked change version, showing the net effect of the amendments at any given point. This has not been forthcoming, and again the official simply directed the committee to look at the NI Direct website. I have to say, as a committee member who has long sought improved communication, that I don't think that this is good enough, and I suspect members all agree with me on that point. I do not see why the committee cannot be added to the list of recipients being provided with accessible versions of the regulations to facilitate it when it undertakes the scrutiny. On a more positive point, we were advised that the most recent version of online information has been translated into a number of languages. This is very welcome and something the committee has long been calling for. Economic questions have also been raised by the committee, given the wide-ranging impact of these health protection regulations. Officials were asked for their response to frustrations expressed by local retailers seeing multinationals continue to sell items they cannot as small operators. The issue of closing times for takeaway services was also raised. The committee was advised that the issues would be considered further. As previously discussed, members have concerns about the limitations of post hoc scrutiny and the continuing approach to legislating without formal consultation and impact assessment. It is acknowledged, however, that this opportunity for debate allows members to place on record their views, and we trust it will inform subsequent regulations. Now, Mr Deputy Speaker, I wish to make some remarks in a personal capacity. The regulations are already passed. However, what can we learn from them? Amendment 19, members will recall, followed a series of attempts by one party in the Executive to reopen higher-risk services, contrary to the scientific advice in November. And I think the Health Minister has implicitly, at least, already noted that even this date was clearly too soon. We could already see at the time, not least in the scale of the queue outside Primark in the Epicentre immediately at midnight, and the inability in practice of many venues to keep up with the new requirements posed by the regulations, not least around maintaining contact details and ensuring spacing, while remaining profitable. That such a reopening with fully 2 weeks to go until Christmas was going to create problem down the line. Members all need to be clear that the health emergency is the economic emergency. Mr Deputy Speaker, one problem that does seem to happen is the scale of the risk. I think that it was poorly understood. For all the emphasis on distancing, it has been clear since September or earlier that indoor venues are high risk because of transmission of the virus through aerosols. Even at more than 2 metres, the risk is high, particularly if staying in the venue for a period of time, and even more so if face coverings are not worn, as they cannot be done while eating and drinking. Even currently, this raises questions about the risk of workplaces or places like motorway service stations where people can still be seen eating and drinking and therefore not wearing face coverings indoors. Let us just look at the case numbers, which we know follow actual infections by some days, as they typically follow symptoms, test arrangements and result reporting. On the 16th of December, there were 510 confirmed cases. On the 23rd of December, there were 787, and on the 30th of December, there were 2,143. Peak in hospitalisations then followed a fortnight later. We may hope that the peak in terms of death has now passed too, but the numbers are still horrendous. We need to be aware that there is a penalty we have to pay for pushing to open indoor venues before time. It is clear in the emerging research, and it is utterly obvious in the case of hospitalisation and the numbers daily. Let there be no more denial about what that impact is. As noted, Amendment 20 and 21 are tidy-up amendments, but Amendment 22 then implemented the Christmas bubble. Amendment 23 then reduced this to a single day. This, and here the Health Minister has been more overt that things went wrong, was a mess right across the UK. There is a legitimate question to be raised about how enforceable Christmas restrictions, particularly regarding private homes, would have been anyway. The Office of National Statistics suggests from the trends of infection that UK-wide there is evidence that people are beginning to gather in homes for Christmas even before the 23rd. The date from which they were allowed to in law in most areas, although this depends a little on how much difference the new variant made to transmission. The evidence from Great Britain, in fact, shows that during the actual Christmas bubble period, people largely avoided risky contacts, even though they were permitted, perhaps taking the opportunity to meet others, but intentionally staying away from older people and those with underlying conditions. Therefore, this is as yet limited evidence that the spike in cases and hospitalisations arose from permitting meetups in private homes for one day over the immediate Christmas period. The evidence for increased contact and thus increased transmission points more to the period before it. It would be useful to have more direct research from Northern Ireland to confirm that the trends were similar to those found in Great Britain. It is worth noting, Mr Deputy Speaker, that we have seen from the dramatic rise in infections in the new year in the Republic of Ireland that a travel ban cannot stop a dramatic rise in case rates if an upward trend in contact and thus infections is already ongoing. We can see that the virus, both in old and new variants, are already circulating far too rapidly before Christmas. And the fact that infections were evidently set on an upward trend from the 11th of December was the reason for Amendment 24, closing so-called non-essential shops and hospitality immediately on Christmas Eve to avoid the Boxing Day sales rush. And all the evidence suggests that was wise, as I've just outlined. Amendment 25 then provided clarification around taxi services. Mr Deputy Speaker, we have gone some way this year towards reducing the infection rate, but still not far enough. Infections are still too high, pressure on hospitals is too big, and the impacts on our population's well-being is too fast. However, there is evidence that from the immediate Christmas period that when people are given clear guidance, they will behave responsibly. We need to redouble our efforts around the messaging, most notably around avoiding the 3 Cs: crowds, contact and closed spaces. If we give the public the right tools, I have faith that we will see the next few months through until the impact of the vaccination programme is fully felt. There is clear light at the end of the tunnel, but we must maintain our courage and discipline until then. Thank you.
I call Jonathan Buckley.
Thank you, Deputy Speaker. And again, I rise in the House to talk on the restrictions before us today. Before I do so, I suppose I would like to recognise where we are in relation to the latest COVID statistics. As of today, our 7-day rate of positive cases was 261.5 per 100,000, with 422 new cases and, sadly, 17 deaths. While still alarmingly high, it is indeed our hope that we continue to see a downward trajectory. I would also like, as is always done in these debates, to pay tribute to the staff, in particular our healthcare staff involved in the respiratory teams across Northern Ireland, who have been under significant pressure, particularly over this period, whether it's through winter pressures, already seeing large numbers into our hospitals, but indeed the influx of COVID patients. Their job is it's deserving of plaudits from us all as to the hard work that they're doing. I was particularly struck at the weekend, Mr Deputy Speaker, when I seen a posting from a local priest in the Craigavon area, where he talked about receiving that call to go to the hospital to tend to one of his parishioners as they come towards the end of their life, COVID positive. He talked about entering into that hospital and seeing 4 or 5 people around the bed in full PPE, gowns, visors, masks, everything. And he could hear tears. He seen one holding the hand of his parishioner and another one, aloud but softly, praying for the gentleman that he was caring for. Initially thinking that this must have been family, he was even more touched when he realised it wasn't family at all. It was our nurses and doctors that tended to the bedside of that patient, and how common that must be in these difficult days. Mr Deputy Speaker, there is no doubt that we have seen quick developments throughout the past couple of months, and I suppose probably I do welcome the call to aid for those medical professionals, and indeed the deployment of military medical personnel is a welcome move. But I have to say, I regret that we have reached a situation that it has become necessary. And I also regret the tone in which some members, both in this House and some individuals outside it, took to those professionals coming in to help support our frontline services, who have not only the logistical but medical expertise and professionalism that could play their part in repelling the COVID-19 virus as it stands. The restrictions before the House today, as has been mentioned, are quite wide-ranging, some in the extent that they're no longer relevant in relation to the Christmas period, but others which are very, very wide-ranging and will have wide-ranging consequences springing therefore. And I think it's only but right that the House consider that, because it's not only the restriction, in particular Amendment 24 and 25, that we must consider, but it is the knock-on effect and something that we must take into account. I want to talk about the impact of the restrictions before us today and the wider lockdown in managing COVID-19. Inevitably, restrictions are put in place to help, as it has done, reduce positive cases, reduce pressure on hospitals, particularly when we have a COVID patient influx and already existing winter pressures. We, by means of restrictions, are trying to manage the situation until a sustainable solution and way forward is found. And I understand this and I appreciate this, that our primary aim has to be to protect the health service. Though equally, Mr Deputy Speaker, and it is important to note that restrictions and lockdown measures are not a cure to COVID-19. As has been seen around the world and indeed in Northern Ireland, once restrictions are lifted, cases go up and we face a repeat cycle. I think members can agree that as a society we need to learn to move beyond the blunt instrument of restrictions and lockdown. I'm sure this is something that we can all agree with, because we have agreed on that point before, albeit the pressures that come with COVID-19 have been relentless. But I want to examine, and we must examine some of those in light of the restrictions before us today as to the lockdown and how it can have a long, shadowy impact on many sections of our society. How does restrictive measures before us today and lockdowns in general impact upon society? Well, let's look, for example, Mr Deputy Speaker, at the working poor. Job losses, bills, financial pressures, family life. While it may be okay, Mr Deputy Speaker, for people who have the luxury of green open spaces in their gardens, or indeed a wide family bubble to support them. But for many of the working poor throughout Northern Ireland, and indeed the world, the COVID restrictions and the COVID measures in place to bring the virus under control has had a devastating, long-lasting impact. We have to recognise that, because it is true. And I'm not here to lay the blame at anybody's door, Mr Deputy Speaker, either. I'm simply outlining the effects of COVID restrictions, and indeed that includes the ones that we have before us today. I also want to say another section of our society, and it's been well documented, our children and young people. The closure of schools, lack of face-to-face teaching, impact on progression in basic skills. It was noted in a recent Stranmillis University report that motivation has been one of the key elements noticed by those that conducted the study in relation to our young people. They no longer have the motivation to learn the essential life skills that they would do in a classroom. We only have to engage with the many parents who are struggling with home education, homeschooling, to realise the devastating impact that lockdown is going to have on our children. Now, I understand, and quite rightly in the House, there is a divided opinion as to how safe the school environment can be. But it is upon us to ensure that as quickly as possible we provide the space in which our children can return to education and provide them with those basic needs. Mr Speaker, when I look at our young people and I try to highlight, and I ask parents this, what has been the major defects and defaults from lockdown and indeed restrictions? They talk about them being failed academically, emotionally, physically, and indeed socially. We have to realise that the restrictions that we put in place, albeit to stem the COVID influx, have long-lasting impacts. And I think that's a point that's lost on a lot of members, because while restrictions have been seen to become the norm for dealing with COVID-19, it's what the long-term outcome of those restrictions cause upon other sections of our society that we need to take into account. It was mentioned earlier by John O'Dowd in relation to the lack of opportunities and difficulties for university students. That's another one. It's not just facing our young primary school children, but right through. That experience has been lost, and we have to take cognizance of that fact. Mr Deputy Speaker, I want to talk about our vulnerable, cancer patients and those suffering from mental health. The restrictions, and in particular the ones that we study today, coincide with some devastating news: the cancellation of cancer services across Northern Ireland. Now, some will say, what do they have to do with the current restrictions that we have before us today? There is no doubt that the restrictions that we have before us today coincide by trying to drive down infection rate, which has also led to the closure of cancer services. Mr Deputy Speaker, cancer cancellations is the greatest COVID sin of all. And it should never rest easy with any member that we have been forced down a path whereby those that require urgent and immediate surgery have either a fear to go to their A&E and present, they're not seeing their GPs through lack of face-to-face consultations. There's a real palpable anger, and you only have to listen to the radio programmes and TV shows across this country to realise that those with cancer are suffering. There's not a family represented in this House that I would imagine that has not been impacted by cancer. All the more alarming when we're dealing with it in the middle of a COVID-19 pandemic. I raised at the Health Committee last week, Deputy Speaker, the plight of two individuals that, because of no face-to-face consultations and GPs that rang through, they were told that their symptoms would be prescribed via, I think it was painkillers. 2 or 3 times this happened. When the pain continued, they presented at A&E. Cancer was diagnosed, advanced stages. They were dead within 4 days. That was a tragic story. I asked this question of the Health Trust personnel that we had before us, and they talked about late diagnosis. The evidence from the Health Trust were damning when it came to cancer. Number of cancers detected down. Number of red flags coming forward down. Late presentations at A&E on the up. A pause in paediatric services. These are the results of restrictions. It's easy for any member to get up and say we should restrict and we should place society in elements of restrictive measures to deal with COVID, but we also must reflect that it does indeed have impacts upon other services. I will on that point.
I thank the member for giving way. I was there at the health meeting last week when the chief executives from 3 different trusts were in. And would the member agree with me? I mean, we're being told, depending on what stats we listen to, whether it's from the department or NISRA, there are either slightly less or slightly more than 2,000 people who have died as a direct result of COVID-19. But there are many, many more people who have lost their lives in this emergency as a result of cancer. And it was very poignant, the 2 cases that the member mentioned in the committee last week. But there are multiple cases like this. And someday we have to get the true figures of the number of people who have died in this emergency.
I thank the member for his point. And Mr. Deputy Speaker, this is what the restrictive measures can do. And it's important that we note and we just don't nod through restrictions without considering their very real impact on normal people. And Mr. Sheehan's point is quite correct. Because while we have been dealing with COVID pandemic, and I fully understand that, I see the pain that families are suffering as a result of deaths through COVID-19. I see the pressure on health professionals. I see the pressure on our government departments. I see it all. But equally, it would be remiss of me as an elected member of this House if I sat and did not make comment upon the wishful thinking that some can say that we pass regulations and we don't look to their wider implications upon society. That is something that is incumbent upon members in this House. Members, these statistics that are before us and that Mr. Sheehan should mention should send shivers up every one of our spines. It scares me, and I would say without doubt it scares many members in this House. It is deeply worrying that despite the current restrictions starting to bring limited rewards, sufficient capacity has still not been has been achieved to allow the cancellation of surgery to resume at even close to normal levels. The number of non-COVID patients in ICU or general beds also continues on a disconcerting downward trend. We have already heard the harrowing reports of cancer diagnosis coming too late because of whether it's presenting at A&E too late or whether it's not fear of coming forward. For this is to be compounded by cancellation of their scheduled surgery. It is a bitter blow which sadly will inevitably lead to lives being lost that would otherwise have been saved. There is also a fear that surgeons who have been out of the theatre for so long, this was mentioned at the committee, will have missed out on training and development which could jeopardise the full resumption of services once this pandemic has ended. I was also shocked to learn at the Health Committee that there is evidence last week, as I've said, that paediatric surgery has been subject to suspension. And there are serious concerns as to how this will affect children and young people's health and well-being now and into the future. Now, the restrictions that are in place, as I have outlined, can have a devastating impact on other services. But I just don't want to talk about problems. And again, I preface this with the point, I'm not here to attack. I'm here to speak on behalf of those who've been impacted on COVID restrictions in many ways. I want to look at possible solutions. There is a worry that due to COVID-19 and the restrictions in place, that potentially curable cancers have been detected at an advanced stage. For example, there's many sad cases of advanced throat cancer, which could have been detected earlier Other cancers, such as bowel, which diagnosis is based on symptoms of change of bowel habit, would ordinarily be referred by GP to red flag clinic. I do not see how this cannot continue and carry on. These symptoms can be picked up in history making, but sadly, because of COVID-19 restrictions in place, they are not being picked up. They're presenting late and automatically placed on late life-ending treatment. Perhaps people are not aware that GP doors are still open. Perhaps there is flaws in the system. For example, who is triaging the calls? Are they receptionists? Or are they qualified professionals? After all, this is new to everyone, and I would implore the junior ministers to take this point up with the Health Minister, because this is something that has been lost as we've been debating regulations. We need to realise that COVID is here and does not seem to be going anywhere quick. Do we therefore need to think about opening satellite centres for cancer patients to be seen by the professionals they need, be that a surgeon, oncologist, palliative care specialist? Could we be making better use of peripheral facilities? We all know within our own trusts, perhaps buildings that haven't been used because staff are working from home. There's space maybe to allow for some sort of cancer centres to open. Could we be introducing a system whereby a patient has a COVID test done 48 hours before an appointment? I will on that point.
I appreciate the member's enthusiasm for this subject, but maybe on that long list, will the member even suggest that whilst Her Majesty Government was actually extremely generous to this place and to the tune of $3 billion, that maybe some encouragement could go to the Finance Minister to get the $300 million to some of the company directors who are only offered £1,000?
Just on that, I'm conscious now, and I do respect the member's genuine points that he's making. I really do respect that, and I've given a fair amount of latitude to that because it is so crucially important and serious for many people in the community. But if we could just move back onto the regulations, please.
Deputy Speaker, I thank you for your indulgence on this point because, as I've said, the restrictions and the amendments are so wide-ranging. It is only but right that as elected members we consider their full impact upon society. And, you know, as I've said, cancer affects everyone, every family. There's not a family that hasn't been touched. And when I look and I hear the stories through email, through phone call, on our radios, I have to say that I have to speak out because I understand the need for restrictions. I do. I'm not here to say to members that I'm a COVID denier. I'm not. All I'm saying is that we need to think about the long-term impacts that they can have on society. Mental health. We've spoken regularly in this place about the impact the pandemic has had. Belfast Trust experienced a 30% increase in inpatient mental health admissions at the height of the previous lockdown. And it is clear that the extension of these regulations, including the continual closure of schools, requires us to look more at how we can target early prevention of those with mental health, and particularly among our children. Mr. Deputy Speaker, I'll move now to Amendment 24, and in particular the issues surrounding small business, another sector that has been profoundly impacted by restrictions that are in place, particularly the closure of non-essential retail businesses and indeed the closure of click and collect. Mr. Deputy Speaker, the small independent retailer is the backbone of the Northern Ireland economy. And they have looked on at the restrictions that have been put in place with disdain. Their reason that they understand the need for the restrictions that are in place to prevent community transmission. And many of them have put their lifetime work into establishing these businesses. They've been on the high street through thick and thin, through wars, through troubles. They have sustained the Northern Ireland high street. But now, they are facing their biggest threat yet. They've been closed, but yet in the very same towns, sometimes on the edges of our town centres, large multinational retailers continue unhindered, selling the very same product that the independent retailer has been closed from selling. That, Mr. Deputy Speaker, is ludicrously in the extreme. We need to look how we can deal with this issue, because the independent retailer stands the very risk of never returning to the high street. And I understand and I accept fully that the Executive Office, maybe by means of the junior ministers who will give us an update, have been engaging with that sector. I would like to hope that they have heard loud and clear the frustrations of independent retailers across this country and how we should right the wrongs contained within the current regulation. That I will on that point.
The member makes a very valid point, but isn't it a point that has been made for months in this House, from the very first manifestations of these regulations? And yet, again and again, on successive lockdowns, we have the same flagrant flaw, whereby supermarkets can do what they like and independent retailers are driven off the streets. Why has this executive not closed those loopholes? That's the question that needs to be answered in this House.
Thank the member for his intervention, and I'm sure it's something that the junior ministers will take up upon in their final contributions, because independent retailers are not being unfair in what they're asking for. Their plea is either you level up in terms of click and collect, or you level down and everybody's on the same footing. That is all they're asking for. I think it is only but right that we in this House fight for that level playing field. Mr. Deputy Speaker, I want to thank them for their, I want to thank them for their endurance throughout this time, because they realise that their sacrifice in terms of their businesses, the jobs, maybe even their livelihood, is indeed for a greater cause to try and suppress the virus transmission within the community. Albeit, as I have mentioned, some of those close contact services, I have been sceptical, Mr. Deputy Speaker, to say the least, as to the evidence of the community transmission in those places. I think it's been mentioned on many times in this House that actually illegal gatherings, house parties, whatever it may be, is actually a far greater threat than those independent businesses who have probably put more stringent measures in place than the very multinationals that are open freely. We in this House have a duty to repay their faith in the executive's response by ensuring that we chart a course outside this pandemic. Those businesses devastated by the current rules have access to the vital financial and practical support to get back on their feet. There is a particular responsibility upon ministers to support the needs of our independent retailers who are rightly seeing these large supermarket retailers acting outside the spirit of the regulations in terms of non-essential sales. There are some areas where I believe there should be a scope to give more flexibility, and it was mentioned at the committee, within the structure of the current regulations. For instance, in respect to Amendment 24, some takeaway food businesses have highlighted that the 11 p.m. cut-off point of delivery disadvantages shift workers within our hospital, many of whom are working on the front line. We should be open to listening to these concerns substantively in the coming days. In closing, Mr. Deputy Speaker, as I've outlined throughout my contribution, we must collectively focus our energies on the clear path which gives us the most hope of righting the horrible wrongs of COVID-19, that being vaccination. Now, it has been on note on numerous occasions A lot of the sectors that I have mentioned that have been affected by the COVID pandemic. We need now to look at ways and means in which we can protect those sections of society to get them back operational. And I look, and I'm sure many members have this thought as well, in relation to our teachers. We've seen the negative impact that COVID regulations have had on our young people. It's now incumbent upon us to look towards making representations to the GCVI to see, can we vaccinate our teaching population to ensure that we can get our young people back to education as quickly and as safely as possible. Also for those teaching with special educational needs children, they have not for one moment stepped back in this pandemic. They've stepped forward. They've stepped into the breach. We need to now support them with a vaccination programme that is fit for purpose. And on that point, I will commend the current vaccination programme and those administering it, because it is a leader. It's a leader within the United Kingdom. In fact, it's compared globally with some vaccination programmes. That's a true tribute to those that are administering the scheme. And I do take that point on board, that I would like to see the flexibility within the scheme to allow for a process by which we can start to normalise society again. The restrictions alone can never hope to see us through the pandemic, nor can they deflect attention from the need to ramp up that vaccination programme on a mass scale. I've mentioned it at committee, 24/7 if we can have it. I've looked across the Trust, and we would have heard this morning, Mr Deputy Speaker, about how trusts have got through the cases within their staff in relation to vaccination, and now we're starting actually to see the slowing down of vaccination centres because there isn't the same footfall coming through them. Maybe I'm missing something, but this should be the very time that we should be ramping it up. At the end of the day, if there's spur vaccination, let's see a process by which we can vaccinate teachers. We can vaccinate those that are vulnerable. We all know them. We need to get society moving again, and moving quickly. We are now looking to commence vaccination of the over 75s group, and this is a testimony to our dedicated teams and vaccinators. With over 1,000 extra volunteers to take up this role, the Health Minister needs to be looking at expanding the skill set further. As our society does eventually reopen, we have to be mindful that pressures on our public servants, including teachers and police officers, will only increase. We do believe there is merit in providing those workers at high risk with a vaccination programme. And I will close now, Mr Deputy Speaker, and I thank you for your indulgence on those points which I believe are pivotal in this debate. The road ahead will be long. There will be many twists and turns in relation to COVID and the regulations. And I, for one, don't want to fall out with any member in this House for being passionate about something that I feel is having an adverse impact on people who don't deserve it. And I hope, in the spirit of that debate, that we can continue to confront these issues and deal with this pandemic, and sadly deal with the long-term consequences therein. Thank you, Mr Deputy Speaker.
Thank you. Agus na siadam Sir Martina Anderson hon cancha. Call Martina Anderson.
I rise to speak to amendments 19 through to 25, and I remind this House that on the 5th of October, Derry and Strabane were placed under restrictions, and then in the middle of October, the entire north. And we realised as time was moving on that the things were going in the wrong direction, and we knew that there were new variants appearing, and that the rate of transmission needed us to delay the relaxation measures. But it took longer for these amendments that are before us today to come into effect, because unfortunately the DUP used a veto to block a 2-week extension of the restrictions, and that was shameful. Now, we know that there has been talk, and in fact we've just heard some commentary and focus put on these restrictions and the implications that these restrictions have on people's lives, resulting in people falling into poverty. And I take it that when restrictions like this, when we move on, when things hopefully return to some kind of new normal, and that we build back better. And throughout this journey, if there's an anti-poverty strategy, when that comes on the table of the Executive, that we will have full ministerial support for the implementation of that strategy and it being allocated based on objective need. I also want to say, I'll ask Can Collier, that as a member of the Executive Office Committee, that the public is fed up. The public's fed up with the SDLP playing some kind of hokey-pokey dance during this pandemic, being in the Executive and out of the Executive. So I can tell you that the public is really fed up with all of that. Amendment 19 deals with the reopening of close contact services. Can I say that there's been a lot of confusion about what a close contact service actually is, and I would like the ministers to take account of this. I've been dealing with a number of photographers, I'm sure I'm not the only one, whose businesses evaporated as their operation was severely limited because their customer customers were required to wear a mask. Now, in hairdressers and nail bars and other close contacts, when they were reopened, people were rightly required to wear a mask. So, and I ask the ministers to think about this and to reflect this back to their ministerial colleagues, because photographers, you know, they don't meet, I've been told this by officials, they don't meet the legislative definition of a close contact as defined in the health regulations and are designated as a retail service. Now, retail are only eligible for Phase 3 of the COVID support payment. So people were told to wear a mask in retail stores, making it impossible for photographers to carry out their service. You're not going in to get your photo taken when you're wearing a mask. So the businesses were not exempt. Photographers were not exempt in the regulations from wearing a mask. So if they're retail and you have to wear a mask and into a retail, then these photographers who are wanting this Assembly to realise that their businesses have been severely limited as a consequence of these restrictions. So I would ask, when we're talking about Amendment 19, that perhaps the ministers would please feed that back. Amendment 20 deals with some minor corrections and technical amendments to regulations to permit the continued operation of businesses of the Business Financial Support Scheme, the local restrictions. Now, some of these schemes have been a lifesaver for many businesses, and I acknowledge the work of the Executive and the work of the Finance Minister, Conor Murphy. Indeed, in comparison to England, where the most the businesses receive is under £800, here the Executive and the Finance Minister secured agreement that the least a business would receive here would be £800 for the local assistance support scheme. Now, if we can do that without the economic levers of power, just think what we would do if we had them. But I know, and last Can Collier, the last thing you want me to do is to enter into a debate about the benefits of Irish unity. So I will leave it at that. Amendment 20 addresses the decreased period of self-isolation. Now, I, along with other members across this chamber, have spoken about those on low wages finding it difficult to self-isolate and at the same time trying to put food on the table. Now, welcoming as it is a discretionary support payment, we all know that for households without an income of below 21,000, that you're not eligible in them circumstances. And I'm not the only member. Other members here have raised the issue of carers not receiving statutory sick pay. And whilst the Health Minister, and he has informed us here and written questions and answers on the floor, he has put financial support in place for the independent sector, for care sectors, for carers who need to self-isolate. Employers have told me that some of them are not entitled to receive a payment. Now, employers say that those carers who don't have day one rights, that they must work 6 months, 26 weeks, before they can receive financial support for self-isolating. And some of these workers are looking at a health and social care service under pressure, and even as we speak here today, our countenance returning to work to help out, to alleviate the pressure, but yet employers are telling me that they are not entitled to day one rights. They're not entitled to financial support. So the lack of such financial support for those who have to self-isolate needs to be looked at, because if we don't do this, then we run the risk of the further transmission of this disease, because people who are contacted and told they should self-isolate, at times some of them are choosing maybe to continue on to work because they can't afford to do so. So some families had hoped that Amendments 21 and 22 would have resulted in their loved ones getting the vaccine so that they could become part of the Christmas bubble. And I say this in the context, and I would ask the ministers to take account of hospitals like the Waterside Hospital in Derry. And that hospital, like other hospitals, I have to say, that have such units in the hospital where you have dementia patients in the hospital. And we're hearing about care homes and the vaccine being rolled out there. But the Waterside Hospital, those wards that have dementia patients and patients who have mobility issues, they're not being vaccinated. Now, I actually, Alas Cancola, was given information by the Trust to inform a family that their loved one would get the vaccinated because they wanted them home to form part of the Christmas bubble. They wanted them home to take care of them. The hospital needs the space. And I told the family that they would be getting vaccinated. Only 2 weeks later, for the Trust to tell him, no, he's still not vaccinated because they haven't got, they said, the authorisation from the Health Minister. So I would ask that that issue is taken account of, and the ministers please feed that back. Amendment 25 permitted taxi hire to operate during the tighter restrictions. But taxi drivers who temporarily suspended their insurance but who were able to operate at that time because they had renewed it are being penalised and will not receive the full grant. They're going to receive a reduced COVID grant support because they were either shielding or the stay-at-home message impacted on their customer base and they simply had no money. It is wrong that the second grant that's going out for the taxi support scheme is going to penalise taxi drivers who temporarily suspended their insurance because they had no money to pay for it. And I would ask that that stops and that they get the full grant like everyone else because they had to pay the full cost of the PPE once they renewed their insurance. So, ministers, I know, like everyone else, every one of us in this chamber, we know that the last 12 months has been horrendous, Alas Cancola. And unfortunately, like many in this chamber, I stand here heartbroken, knowing many of those who've lost their lives, particularly during this wave of COVID. I'm told that in Altnagavin Hospital, during the first wave, not one death occurred of someone from Derry and Strabane. And yet, we're looking now at figures, and I'm seeing my colleague Gary over there on Derry, of over 110 people dead in our council area in Derry and Strabane. So I want to send my heartfelt sympathy to all those who have lost their lives due to COVID. And I want especially to send my deepest sympathy to Magella McCourt, who lost her soulmate, her husband, and her children lost their father at the weekend. Derry lost a solid Republican who will be sadly missed by all. RSG, Guru Ayan. Guru Mina Melgov. Thank you.
Okay, I now call Gary Middleton.
Thank you, Mr Deputy Speaker. Like others, I firstly want to recognise the extreme hurt and pain that many of our constituents are currently suffering, whether that's COVID-related or non-COVID related, equally important. And it's important that as we look upon these restrictions and regulations which have been put in place, that we are mindful that the impacts of those go well beyond the COVID virus themselves. It affects every area of our lives, and we're seeing that on a day and daily basis, so we just need to be mindful of that. In terms of the amendments, and Amendment 19 specifically, it deals with restrictions in relation to places of worship and bringing that back. I suppose at that time it was a relaxation, but I do welcome the fact that many of our churches have shown great leadership and coming to a voluntary arrangement to provide, I suppose, safety for their congregations and parishioners, but also been mindful that they do have a very much a leadership role, and I want to thank them and congratulate them for that. Obviously, and it's very, very relevant today, given the day that's in it, the restrictions on funerals. The restrictions on funerals are limited to 25 people. Now, everyone has the right to remember their dead, and we have to be mindful of that fact that when someone loses a loved one, they are difficult times, and we have to be honest about that. The difficulty, Mr Deputy Speaker, that I have is in relation to, once again, today within my constituency in Foyle, in the Craigan area, a funeral took place. And that funeral, once again, broke the restrictions by many, many numbers. And I think that once again, is a slap in the face, not only to our constituents, but a kick in the teeth to our health workers, who no doubt will have to deal with the consequences of what happened today. So I just urge all members in this chamber to please speak out, be respectful, absolutely, of a family who lost a loved one, regardless of their background. But they need to be honest with the public. As we are putting these restrictions through today, and we look at further restrictions in the future, we need to be shown leadership. It needs to be a case of do as I say, and it cannot be a situation where it's do as I say, not as I do. We'll give way to Mr Alistair.
Member said, does the member think it would have helped in terms of underscoring the public message that he's just been articulating if the last speaker, Ms Anderson, who referred to the same death, had gone on to condemn the breaching of the regulation at the funeral of that individual? Would that not be of more assistance than simply lauding the individual who has a past which involved him in terrorism?
Thank you, Mr Deputy Speaker, and I completely agree with Mr Alistair's point. And this is very, very relevant, because we cannot stand with straight faces and tell members of the public to follow guidelines if we in this chamber are not willing to follow those same guidelines. So I will leave the floor open. I will be speaking for the next number of minutes. If anyone wants to intervene and give clarity, particularly from Sinn Féin's benches, in terms of how they are giving guidance to their communities, because it is unacceptable and it needs to be addressed. And as I say, to be honest, it causes so much upset to my community, to all of our communities, when they see such shameful disregard for the rule of law. So I just urge members to reflect on that. I'm going to move on, Mr Deputy Speaker, because I am keeping to the amendments in relation to Amendment 20, and it deals with linking households and addressing the period of time in which a person has to leave before they move to a different household. I think that's fairly self-explanatory. Amendment 21 goes on in relation to entertainment venues. Amendment 22 and 23 deals with the household restrictions around Christmas time. And when we speak to our constituents and you ask them, about Christmas, the one common word that you hear is it was a quiet one. that can be good in some ways, but in other ways it has been detrimental, because I know that whilst the Amendment 23 dealt with the issue around the Christmas bubble and it limited to 1 day, there were many elderly people, particularly vulnerable people, who were isolated and who weren't part of people's bubbles. And we do have to be mindful that the impact of those restrictions on those people will be something that we will be dealing with for some time. But I think that there was a recognition that something had to be done at that time to ensure that obviously the virus just didn't completely get out of control. But as I say, it was one of the more difficult, I think, decisions that had to be taken by the executive, a decision that nobody would want to have to take, but it had to be taken at that particular time. Amendment 24 goes on, and it's one of the, I suppose, the bigger amendments, which deals with the tightening of the restrictions, and my colleagues has already touched on the impact in terms of our businesses and our economy, and the fact that so many of our businesses continue to struggle. And that's why it has always been vital and essential that we get the appropriate financial schemes on the ground as quickly as possible, ensuring that it gets to those who need it most. I do want to say, just in relation to the delivery and the takeaway services, it has been raised with me by a number of local businesses that there is they feel that does need to be looked at from the perspective that it has an impact on shift workers and key workers who may want to order from those facilities. And it was just something that maybe if the junior ministers could take that away and see if there's something that could be done, maybe just to listen to those concerns. As I say, if there's real, genuine health reasons why the takeaways can't operate past 11 p.m. for delivery services, then it would be useful just to, as I say, just to address that and maybe bring some clarity to that situation as well. I do want to join, again, I've raised this point in this chamber before. I think that the click and collect services, again, is something that could be looked at in relation to that particular amendment. Yeah, absolutely.
I thank the member for giving way, and I know he has been on record on this point at the committee. But would he agree with me that if it appears to be transparent that click and collect can't happen for reasons presented by medical officials or whatnot, that we look towards a form of click and collect which potentially looks at stricter enforcement rules around it, stricter guidance, to enable those small independent retailers to use up some vital stock that essentially will be worthless by the time in which their businesses can operate again?
Member for that, I completely agree with that point. One example that was given to me was around a garden centre who stocked flowers. They had to order the stock a year in advance, so they're sitting now with £25,000 worth of flowers that can't go nowhere. And given the fact that Valentine's Day is coming up, for example, and the First Minister did remind me that there's ways and means, but I can assure you, in terms of the flower shops, there's great disappointment. And it comes to those perishable items, I think that there could be a look at how you could address click and collect. But nobody's advocating. We, on these side of the benches, completely take the COVID virus seriously. But we also have to look at the practicalities and how do we, I suppose, be innovative and allow businesses to operate as safely as possible, whilst also trying to keep a lid on the level of the virus. I will indeed, to the Junior Minister.
At this stage, only because Mr Buckley has already raised it, Mr Middleton has raised it, and I believe other members will want to raise the issue of click and collect. Perhaps I could provide some reassurance to the House at this point in time that on the 21st of January, at the meeting of the Executive, we agreed that the Department of Health and the Department of the Economy would go away and look at ways in which click and collect could be done in a safe manner. I understand the arguments that are being made. We have to understand the health implications as well. But that is an issue that is being looked at between those two departments. I hope we'll have a resolution to that, and I hope it brings some comfort to members of the House today.
Well, thank the Junior Minister for that, and it does bring some comfort. Obviously, we would like to see that come to fruition, and I know that many businesses would be very much welcoming of some sort of movement in regards to that issue. And on the Amendment 24, again, that does have, I suppose, the widest impact on the majority of our society in terms of the economy. There are welcome signs that the restrictions are working to to a certain degree, and that, of course, they're bringing the number of the rate of infection is coming down, and hospital admissions are gradually, hopefully, going in the right direction. But there's still significant pressure, and I do take my colleague Mr. Buckley's point in relation to restrictions alone will not solve this crisis. That we have to ramp up the vaccination process. We need to look at how we do that. Maybe mass vaccination 24/7. The capacity is there, or we need the capacity there. And to that end, I said this to the Health Minister earlier on today. I welcome any steps that can be taken to address capacity issues, to provide support. This isn't about politics. Leave the politics out of health. We've said that for quite some time, and just let the health people get on with it. And where support's required, absolutely bring it in. We cannot underestimate the significant sacrifice being made by members of the public at this minute in time. They have, by the main, abided by the restrictions that's been asked of them. A lot of them have been tough, looking at things that we never thought really we would see in our lifetimes, again around issues of curfews and the closures of businesses, the closures of schools, the severe impact that's having on mental health. Just on Friday, I heard from the Western Trust that they've seen a 12% increase in inpatients into their mental health facilities. These are devastating impacts which will have long-lasting consequences into the future. I want to move on in relation to, again, I suppose it's in regards to those pressures. And I wanted to come because it is, and all of this stuff, it is about personal stories and about some of the difficulties that people are facing. And I mentioned at the start that these amendments and these restrictions and regulations do go beyond COVID. And I know I don't need to tell many people in this chamber that that's the case. But I did want to address one point that was raised to me by a constituent, and I believe that he did send this to all MLAs, albeit he's from my constituency, and I know the gentleman very, very well. He said to me, and this came last week, by the way, he said, "Good morning, and I hope you're all well. I do not know anyone who has died with COVID in the past 10 months. But I do know 2 friends who have passed away because of cancer in the past 3 months. Both of their cases were identical. Each of them had significant pain. They had called their GP, and the GP prescribed them with painkillers. As the months went on, they contacted their GP several times, and they had telephone diagnosis, if you like, and conversations, but they never had that face-to-face appointment for examinations. Eventually, after 9 months, the 2 individuals that my constituent was referring to, the pain got so bad that they went to A&E. They were both admitted, and the next day they had a scan where the cancer was found. And then just 4 days later, those people died. Unfortunately, that is a story very much familiar to many people across our society. The 2 that died in those 3 months, the last one is having her funeral today, and she was 56. So that's the reality that we are dealing with when we're putting through amendments and restrictions like this. So I would appeal to those who do deny that COVID exists, and I don't see how they can, but they do exist, to think about the impact that it's having on the likes of that constituent and the families of those who sadly are bereaved. Think of those people when you feel that you don't want to abide by those restrictions. And again, and I bring it back to the point, when you see incidents and just blatant breaches of the rules like we've seen today, it's just a real kick in the teeth for all of us who are trying to do our best to get this virus down. In closing, Mr. Deputy Speaker, Amendment 25, I suppose, is very much speaks for itself in relation to the taxi industry. In closing, Mr. Deputy Speaker, I do want to say that, again, we need to look to the future. We need to ensure that we can ramp up our vaccination process. That's the hope that everybody is clinging to at this minute in time. I think there is a conversation to be had, and a very important one. I know the Education Minister has lobbied for this in relation to looking at our spatial schools and the staff within those schools, looking at our teachers and our classroom assistants and those who work within schools, because we do need to recognise that the point around education, it's just heartbreaking as a father myself of a young child who isn't in school yet but will be in September. And you just think about if it was your child, and I know there's people in here who do have children, your child that was sitting in school or sitting in the education sector at this minute in time, not in school, at home, and just varying amounts of work going on from various. And I am not critical of teachers in one respect, but you can't subsidise, a bit like the health service, you can't subsidise for face-to-face consultations, you can't subsidise for face-to-face education. So just in closing, again, I would urge everyone to please follow the regulations. We're not out of this yet. And I just, as I say, I thank the junior ministers for being here today. Thank you, Mr Deputy Speaker.
I call Alan Chambers.
Thank you, Mr Deputy Speaker. I rise to support these regulations in front of us today, but with the realisation that in normal times we would all reject them without any level of debate. Earlier in the debate, Mr McGrath made a call for an exit strategy, and I wish I had his optimistic foresight. He also made a forecast that speakers from the other four parties on the executive would remind him that all decisions are made by a five-party executive, which includes his party, the SDLP. So I'm not going to disappoint him. No amount of passion in making these remarks will cloud or change the reality that it is a five-party executive that make all the decisions around this pandemic. As regards an exit strategy, the member must realise that every time we get a little bit of hope, we get a setback, like the discovery of a new variant of the virus. How and when could anyone plan an exit strategy when the virus and its variants continue to call the tune? There will be a time that we will have to formulate an exit strategy. I just don't think we're there just yet. And for those people outside this House who are calling for an end to restrictions, I would ask, what is the alternative? They are not in place to punish us, but they are there rather to help protect us. The problem is that too many people are deliberately ignoring the regulations. 95%, maybe even higher, of the people are making huge sacrifices to comply with the regulations. But that 5% are diluting the effectiveness of the regulations. And to use a phrase that's been used in this chamber before, they really do need to wise up. Now, members who spell out the negative impact of these restrictions and the toll it is taking are correct. It is a reality. It is taking a huge toll on everyone. But what is the toll on those families receiving a phone call from a hospital that their loved one has died alone as a result of the virus? They then have to bury their loved one under what amounts to almost a cloak of secrecy. How long will these families take to recover from this? That is an even sadder reality. We talked about delay in cancer operations. That's another reality, another impact of this virus, a dreadful impact, and one that no one could fully appreciate unless it happens to you or a loved one. The Minister has identified a regional approach to urgent life-saving operations, not just confined to cancers. He has also secured, he has told us, 112 theatre spaces in the private sector over coming weeks. Robin Swan is not a callous individual taking pleasure from the suffering of others. He must have... Sorry? Yes?
I agree entirely that Robin is not a callous individual. I think he's a very decent man. I asked my question earlier on and he didn't answer it. Perhaps you could answer it, Alan. I asked why, instead of the Trust announcing that cancer surgery was going to be cancelled, did he not first of all scope out what capacity there was in the private sector and ensure that those individuals who have a cancer diagnosis weren't kicked in the teeth again? The Minister didn't answer that earlier. Thank you.
I would have every confidence that he did scope out those figures that you talk about. But I know that Robin Swan must have many sleepless nights wrestling with this situation. And our National Health Service was in a bad place before Robin Swan took up the health portfolio. Our waiting lists, including cancer operations, were the longest in the United Kingdom. Perhaps if those of us who sat in this House in previous mandates had properly funded the NHS, we would be in a better place today to cope with this pandemic. My colleague Jonathan Buckley, and I recognise and admire the passion that he brought to the debate today, has highlighted the flaws in the crafting of restrictions. And there are obvious flaws and contradictions, and you know, they're hard to defend at times when people challenge you about them. But I hope also that Jonathan recognises that his party has 4 voices within the executive, and that's the place to highlight the flaws, to correct the flaws, to change them. And we talk, I'm just finishing, Jonathan. In relation to vaccines, you know, we've talked, and there's a lot of talk about, let's ramp it up to 24/7, let's get more vaccinators. But we're getting told by the professionals, I don't understand, are people not listening? We're getting told that the vaccination programme is dictated by the availability of the vaccine. And we're not at that place yet where we can offer a 24/7 service. That is another reality that we all need to recognise. Thank you, Mr Deputy Speaker.
Agus na siarm Sir Pat Sheehan hon cancha called Pat Sheehan.
And it has been well laid out today about the true cost of this pandemic. Not just those who have died as a result of COVID-19. There are also many who have been left with long-term illness, long COVID, and that will test our health service very much in the time ahead. We've also heard about those in particular who have received cancer diagnoses and have been told that emergency surgery for them is going to be cancelled. And it was very worrying to hear one of the chief executives of one of the trusts last week in the Health Committee tell us that in some cases, in some individual patients, by the time they do get the treatment they need, the cancer will already have spread. You know, and imagine the devastation in the first place of getting a cancer diagnosis, and then to be followed up with that news. And I know patients are being offered chemotherapy as a sort of suboptimal treatment while they wait for the potential or the possibility of getting surgery. So then on top of that, we have the issue of mental ill health and the people who are struggling badly with their mental health as a result of this pandemic and of the lockdowns and so on and so forth. But I want to give a special mention to our frontline care workers, because I was speaking to an ICU nurse just yesterday who was telling me that of a group of 15 nurses, 8 of them have to take sleeping tablets because of the images in their minds that won't allow them to sleep at night. And imagine the impact that is going to have on the resilience of the health service in the time ahead. You know, and all the problems, and there are many, many more issues that could be spoken about here today. But perhaps that about those nurses is probably the most worrying, you know, that you can think of. Those nurses who are right at the very front line, the people who are on ventilators in ICU, and those nurses are struggling in dealing with those patients. And these restrictions, and we've been here many times now discussing these regulations, and the whole aim of the regulations is to reduce the rate of the virus transmitting in the community, or it may be at certain times when the transmission rate is low. It's about easing some of the restrictions that have been introduced. Now, the difficulty for me in all of this is that that's not a strategy. These regulations are not a strategy. And the Health Minister said last week in the committee that his objective in all of this is to keep the R rate below 1. Now, that in itself, to me, is not a very ambitious objective. But even by his own standards, if that is his objective, he has failed, and failed miserably. And that's why we're in the situation we're in today. That's why there are more patients than ever in hospital. That's why there are higher rates of transmission than there have ever been at any time since this pandemic started. And, you know, I believe you need a clear objective. And when you have a clear objective, you then build a strategy to try and reach that objective. And you use whatever measures or tools you have at your disposal to try and bring you through that strategy and through strategic objectives to bring you to your overall objective. Now, the health... Sure, yeah.
Would the member agree that that would include medics from the British Army?
Well, you'll recall, Alan, that I said in the Health Committee last week, I welcome help from wherever it comes. People wanted to focus on other elements of what I said, but I thought it would have been a significant story that a former member of the IRA, ex-political prisoner and hunger striker, said he had no issue about British soldiers coming to work in our hospitals. So, you know, maybe that would have been newsworthy, but maybe not. But in any event, we were talking about strategies. And the Health Minister said in a session there earlier on that it wasn't his responsibility to bring forward a strategy. It was the responsibility of the Executive. So just let me read this out from the first day brief to the Health Committee. It's under section 3.8, Emergency Planning. 3.8, under the NI Civil Contingencies Framework 2011, the Department has been identified as the lead government department for responding to the health and social care consequences of emergencies arising from chemical, biological, radiological and nuclear incidents, disruptions to the medical supply chain, human infectious diseases, e.g. pandemic influenza, and mass casualties. 3.9, this requires the Department to not only develop and maintain appropriate emergency plans and response arrangements to manage its own response to an emergency and that of its associated agencies and NDPBs, but also to coordinate the interagency aspects of civil protection for those emergencies for which it has been designated lead. In such circumstances, the Minister would be required to lead, direct and coordinate the response for NI, reporting as necessary to the Executive under the Northern Ireland Central Crisis Management Arrangements. Now, that tells me the responsibility for developing plans and developing a strategy to combat this virus rests with the Department of Health, and particularly with the Minister of Health. It's also the responsibility of the Department of Health to provide advice. And I still can't get my head around the advice that was given to the Executive just before Christmas in regard to travel from London. Matt Hancock had told us the virus was out of control in the south of England. The new variant had become dominant. In fact, we were being told there were probably 1 person in 40 in London infected with this virus, and in some parts of London the infection rates were as high as 1 person in 30. But it was okay to jump on a plane at Heathrow, hop off at Belfast City and go about your business, get into a taxi, train, bus, go into the city centre and do your shopping or whatever. A plane holds 160 passengers. If there's 1 in 40 in the south east of England infected with the virus, I mean, it doesn't take you to be Einstein to work out the maths and the probability of that. There's probably 4 people who are infected coming in on every flight from the south of England. Sure.
And he articulates his point quite well, and I know this is something that he has long since debated on. But following that same logic, would the member agree, when we look to the Republic of Ireland and we've seen what was described as some of the highest rates in Europe, would he equally call for an equitable approach south-north in relation to COVID-19 spread?
I'll come to that point in a minute if you let me finish the point that I was going to make. So, what's the point of us trying to reduce community transmission? And bear in mind, I see this as a contract with the citizens out there. We introduce these regulations and restrictions, which are often quite draconian, on the basis that if they do what we ask them to do, we will do our best to protect them and to save lives and to ensure our health service isn't overwhelmed and so forth and so on. But what's the point of us doing that, trying to reduce community transmission here, if we're going to open the door and welcome the virus in on plane loads of people coming in to Belfast City, to Aldergrove, to Derry, wherever? What is the point? And the advice that was given to the executive by the Minister, the Chief Scientific Advisor and the Chief Medical Officer was that that did not pose a significant risk. That is arrant nonsense. And I don't care who the scientist is. Let them get up and explain how it's not a significant risk, because it is. On the issue of the South, let me just say this. First of all, there's one advantage that many people or many countries have, and it's just by accident. It's a geographical accident that some countries are islands, and many of those islands are the ones that have performed best in the whole of this pandemic, because they can control entry into their country. Places like New Zealand, Australia, a continental island, albeit, Taiwan, Iceland, and so on. And they have all done better because they have a small number of points of entry where the virus can be controlled. Here, come from London, jump off, go about your business, no checks, no restrictions, nothing. And that's a problem. And it wouldn't matter how low we got community transmission. If we're still importing a virus, then we're still going to have problems. And I don't care whether it's London or Paris or Timbuktu. If we are going to import this virus, we are going to continually be in this situation where we impose lockdowns, we get the transmission rates down, we open up, and the thing goes through the roof again, just as it has done this time. So, there has been talk about zero COVID, and people say, but you can't get to zero. And people say, you can't eradicate the virus, and that's absolutely true. We cannot eradicate this virus. That's impossible, and it's going to be with us for many years to come. The Chief Scientific Officer has said, Chief Scientific Advisor has said, rather than being pandemic, it's going to become endemic. It's always going to be there, like the flu virus. And so we have to deal with that. And there are ways we can deal with it. And vaccination is, of course, one of the tools at our disposal. But what's more important, in my view, and I mean, people were thinking once the vaccinations arrived, we're going to be out of the woods by Easter, or maybe late spring or early summer. And I doubt if anyone sitting in this chamber today now expects that. And there are going to be problems with vaccinations. We've seen the issue of new variants arising. Funny enough, just go back to what I was saying there earlier, I just see some stuff today saying that the Kent variant, as they're calling it, the UK variant, is running at 68% of all cases here in the north now. I wonder, has that anything to do with people jumping on and off planes coming in here? And it's certainly concerning that other variants are arising. And if you listen to any of the scientists or public health people who have expertise in this field, the virologists, the epidemiologists, and so on, the greater the community transmission rates, the greater the chance of mutation. And the great fear in all of this is that we get a mutation which becomes resistant to the virus. And of course, many of the manufacturers say, well, we can deal with that, we can tweak the vaccine. But that's going to take time. They're going to not only have to tweak the vaccine, they're going to have to reboot their whole manufacturing process and so on and so forth. So anybody thinks this is going to be resolved in a few weeks or a few months, I would say they're living in cloud cuckoo land. So what do we need? We need a coherent, coordinated and integrated strategy to deal with this virus. We need to find the virus. We need to have proper contact tracing. We had an opportunity after the first lockdown, when numbers were very, very low during the summer, to build a proper contact tracing operation. That opportunity was wasted. The Chief Medical Officer told the committee that they had 400 to 600 offers for people to be trained to do contact tracing. He said there were people actually being trained in enhanced contact tracing. That's come back to April the 23rd, I think it was, or the 24th, I'm not sure which. The Chief Executive of the Public Health Agency told us at the end of April also, or the middle of April, that they were currently training, and those are her words, currently training 500 people to carry out contact tracing. She came back 3 weeks later, and when her words from Hansard were read back to her, she admitted that she had spoken out of turn. Those are the opportunities that were wasted. There was actually nobody being trained. There was no beefing up or ramping up of the contact tracing operation. And when the Chief Executive of the PHA came back in October and told us they had 151 contact tracers, when asked what did that amount to in full-time equivalents, she couldn't give us an answer. We later found out it was actually 88. When we asked her why the numbers were so low in comparison to what she had been talking about in the spring, she said the experts who did the modelling about the number of positive cases we should expect got the modelling wrong. They told us just to expect 300 cases maximum a day. And so they didn't beef up their contact tracing as a result of that modelling that was given them. Who was the modelling done by? according to the Chief Executive of the PHA. It was done by Professor Ian Young, the Chief Scientific Advisor. When the Chief Scientific Advisor was at the committee a couple of weeks ago, I asked him about this. How come they had made such a mess of the modelling? How come they got it so wrong? He said, well, we didn't get it wrong. We told the PHA they expect up to 1,300 cases a day. So I don't know who's right and who's wrong. Whoever's sitting here today can make up their own mind on that. But what it tells me is this whole operation in dealing with this pandemic has been absolutely shambolic. There's no other word to describe it. So we need a clear objective, and we need a strategy, a coordinated and integrated strategy, and somebody has to take responsibility. And at the minute, the Health Minister is abdicating his responsibility. And if the Chief Medical Officer and the Chief Scientific Officer are going to give advice, let it be based on science.
Okay. Agus initiatum Sir Cara Hunter on Canchai called Cara Hunter.
Thank you, Mr. Deputy Speaker, and I would like to begin my remarks today by taking the opportunity to thank the public for all that they have done and the sacrifices that they have made over the past 10 months as we continue to do all we can to beat this virus. As we discuss Amendment 19 to 25, I am sure that the recent news that the lockdown will now be extended until early March was met with many sighs and heavy hearts. And whilst we all across this chamber recognise the need for continued restrictions at this time, and we support the Executive in this difficult decision, we are very mindful of the impact that this pandemic has had and will continue to have for the foreseeable months on our constituents, not least in terms of the emotional impact and being socially isolated. Sadly, the sacrifices which have been made for the greater good have come at a very personal cost. For many of the most vulnerable people in our communities, during the pandemic, their life has consisted only between four walls. Many experienced a very, very lonely Christmas, making sacrifices this year so that the next will be very different. As I have said here before, as have many other passionate members, the after effects on mental health and well-being will be felt long after this pandemic has passed. Mr. Middleton, although he's not here at the minute, mentioned previous on a call that we had earlier this week with the Western Trust, the very worrying statistic that 12% more people are presenting themselves at mental health services, and that's deeply concerning and deeply worrying. But I believe, as other members do, it's on us as MLAs and the Executive to commit to ensuring that the support is and will continue to be there for those in need of help and support, particularly after this very traumatic time. These last 10 months have been very difficult for all aspects of society. And I think one thing that Mr. Middleton had touched on earlier as well is in previous health amendments we had discussed funerals, and it's a very difficult time to have a funeral at the moment. You know, I think here in the north, the aspect of having WECs, engaging with our community in grief, and that support system isn't there. So just to talk, speaking directly to the public, I urge those who are suffering from a bereavement to seek that really crucial support and to seek counselling. But I must also pay tribute to the NHS staff who, as we speak, are facing some of the most difficult times that they ever have or ever will in their work. We are greatly indebted to them and hope that with further restrictions in place, we will start to see a fall in infection rates and people needing hospital care, and in turn, less pressure on frontline staff and the health system. Similarly to all those involved in the vaccination programme. The success which it is having is remarkable, and it is heartening to see the figures every day for those getting the vaccine. I think currently 10.5% of the adult population is vaccinated, and this is most welcome with the first vaccine. As we look into more weeks of businesses having to stay closed, I would call on the Executive to act quickly to extend current schemes and to help those business owners who are reliant on this money to keep businesses afloat. Something else which I hear a lot of from my constituents is around Amendment 21 and the need, due to the closure of entertainment venues, the need for more support for entertainers, singers and musicians. Having no social events such as weddings has caused great difficulty. The pandemic has meant that this industry has had a very hard time. So I do look forward in the coming days and weeks to learning what further consideration is being given to provide support for this sector. While I appreciate that swift action needs to be taken by the Executive when it comes to decisions around regulations and lockdown, I do still think that the Assembly should have some more time for discussion on it. These motions before us today were all made between the 10th and the 29th of December. That's over 1 month ago. I would also note that it seems we are too often learning about decisions made through the Executive through the media, as opposed to being properly informed and briefed on any changes in policy or extensions to restrictions ourselves. Finally, Mr Speaker, I will conclude my remarks today by once again thanking frontline staff for all they are doing in this fight. We are all very grateful. And I would also like to continue to urge the public to adhere to the current guidelines and regulations, as difficult as that may be. The vaccine rollout is giving us all hope that the end is that little bit closer, but it is more important now than ever that we do not give up and undo all the good sacrifices that have been made over the last year. Lastly, today a lot of political angles have been discussed, and that could be something that I could indulge in, but I would like to shift to a very important topic as I finish. Mr Buckley had mentioned very passionately about his deep concern about cancer surgeries being cancelled. I absolutely agree. It is very concerning. Cancer is a very deeply emotional and raw topic to discuss. I share my deep concern. 2 years ago, my father had a radical robotic prostatectomy with the Western Trust. The cancer care he had received was absolutely fantastic, but we often talk about if it was in 2021 and he had this diagnosis and needed that crucial surgery, it would be a very different conversation. So I share deep concern, and I think this is something at the committee that we should really further discuss. But no, just to close in saying I'd like to thank the public for their continued efforts and the health staff for their hard work. Thank you.
Nishirim Sir Cahill Boylan, Hun Cancha. Called Cahill Boylan.
No, I'm not down to speak. Sorry, no comment.
I call Kelly Armstrong.
Thank you, Deputy Speaker. Do you know what? If the public is listening to this this evening, they would be more depressed than ever. It has been hard listening to some of you tonight. I don't know how you can make a pandemic a green and orange issue, but can we please just knock it in the head? A lot of the regulations that we're talking about here, as many others have said, take us up to the end of December. And can I just thank both of the junior ministers for bringing this forward, and the Health Minister and the whole Executive, because I had give out that a lot of these regulations were taking an extraordinary amount of time to get to this House. And do you know what? That's not bad going. You know, we're only back after the Christmas recess period, even though we were here quite a lot, and we're up to number 25, and I know we're already into the 2021 regulations, but we're not that far behind, so thank you very much for bringing these forward. I know it's hard for you to sit there and listen to quite a lot of stuff. I know I'm a member of a party that's part of the 5-party executive, to be honest. Somebody talked earlier, I think it was Mr Buckley, had mentioned about being motivated. I don't know how the executive are staying motivated, because this has been the toughest time in politics. And I think we need to just take a wee moment just to catch ourselves on here. We have an executive that is exhausted. I don't know about the rest of you. I'm exhausted. My family are exhausted, and the public are exhausted. We need to bring people with us. They don't need to hear negativity coming out of this chamber. Now, I don't know about the rest of you, but mental health has me massively concerned. And I know that the Regulation 25, the last one that's on the list here today, close contact services were closed. Do you know what? I need my hair cut. We have others here. Mr Middleton needs his 12 red roses for Valentine's Day. There's a lot of points of contact that have been talked about that we're missing. And that mental health is really struggling. Others have talked about schools. I have teenagers who are now saying to me they want to repeat a school year. Have you ever heard of young people talking about wanting to go to another year at school? That's how bad it is. So we need to give them something to look forward to. We know over Christmas, isolated older people, it really got to them. As others have said, it was a very quiet Christmas. Their mental health is a problem. Maternity services, we are creating a wee bomb that is ready to go off in about 6 months or a year's time, with all of those women who go through birth without their birthing partner being there for the whole period of time. And for those, unfortunately, like myself, who've been through miscarriage or stillbirth, we can't do this anymore. So we have a lot of people who are at breaking point, this mental health. A lot of people today have talked about those frontline carers. Thank you for that. And I want to thank each and every carer who's been out there knocking their pans in, helping people to their own detriment, to their own mental health. But I'd just like to make a point today. When we talk about those frontline carers, there are one group of carers that are completely left out. And they're not mentioned in the regulations, and they're never considered when it comes to giving out money. And that's those home carers, the people who are looking after the elderly and the disabled, who are at home, who haven't had a break in a year. These are people who are not getting any money thrown at them. They didn't have a carers allowance increase. They haven't had the £500 that's been thrown at people in Scotland. These are people who are at breaking point, who have no respite. And they need clarification when it comes to the vaccine. We know that the JCVI have said that in Group 6 that they are part of the people who will get a vaccine. But our GP surgeries don't know this. So when a carer phones up to make sure that they're registered on their medical records as being a carer, some GPs are saying, but carers aren't getting this vaccine. That's not true. The JCVI have already confirmed this. In fact, I'm delighted today to say that the update is that over 182,000 people have had their first vaccines. That's fantastic. But when it comes to the mental health, what I would say to the junior ministers, to take it back to the executive, is we have teenagers, we've isolated older people, we have pregnant women and their partners, we have carers that are breaking point, and the key thread that's going through this is their mental health. And when I say that we need a clear COVID recovery strategy, and we need to see this starting to be built through the regulations, it's not to go back to what it was before, but to actually go forward to help people to come out of this. Money is still not getting through to businesses. Large retailers, I know a lot of people talk about the independent retailers, but large retailers have closed, costing us 700 jobs. When Debenhams went, it wasn't just a few people. There were a lot of people lost jobs. And as Ms Hunter had mentioned, events companies, the arts, sports, all of them need help. All have had impacts through these regulations. We need to start to think out of this. It's not going to be today or tomorrow or Easter or the summer. I don't know when it's going to be, and I don't think anybody out there in the community would thank us for putting a date that is then broken. But we need to start planning ahead. Unlike Mr Chambers, I believe that preparation is key here. I think that we can help to bring people with us if we give them a plan, if we show them that there's something for the future. The vaccine does this, but only in part, because it's the mental health. What are we going to say to those mothers who haven't had any support? Did you know, for instance, in this House, that Crew's Bereavement Care does not receive funding for that mental health of mothers? I know that the Minister for Health the other day had mentioned that there will be perinatal mental health money, but it's not there now. It's something that's thought about for the future. We need to think about this, and a key one in this is our children. They are starting to struggle. They have lost their motivations, as others have said. So we need to give them something positive to look forward to. Telling them that they don't have exams coming up isn't something that's positive. They miss all of that. So we need to give them something a bit clear. And I think a clear COVID recovery strategy would help. The other thing I would like to see, and I'm going to say to the ministers, please, will you take this back? I'm fed up asking the executive for this. Can we have a point of contact for the departments so that we can get through to them? I'm sick to the back teeth of writing to a minister looking for a point of contact, only to be given the same point of contact as everybody else, and the phones are never answered. We need to be able to speak on behalf of businesses, for those people who have mental health problems, for people who are trying to find out about vaccines. Now, I know that they're not to phone their GPs, and I would never ask anyone to do that. But we do need those contact details, and maybe the public need clear information as well. The silent majority that are out there, that are complying with the regulations, that have complied with 19, 20, 21, 22, 23, 24, 25, they've complied with them the whole way through. They will still continue to comply. Perhaps it's time in those regulations that we start to think about bringing forward regulations that say to those who don't comply, the fines will get worse. The fake news providers, and I don't know about the rest of you in this House, but as an MLA, I am sick to the back teeth of getting emails from people saying you must read this book about COVID as a load of rubbish. COVID's not the cause of everything. COVID's just made up by government to control us all. I even had a church pastor write to me saying that I was a disgrace because people weren't going to that person's church. Now, most of churches do come back and have kept within the regulations. But all I will ask you is, can we please have a little bit more clarification in future regulations? Please go back and talk to the executive and say to them, while we have caught up, we've almost caught up with the regulations that have been issued to date, we need to stop the tit for tat, and we need to give people hope, and we need to start to bring people with us, and we need a COVID recovery strategy, not, as Mr Chambers has said, where it needs to be back to what we're used to. A year ago, who would have thought a year ago we would have knew what the R number meant? But it's for a new future, for what that new dawn is going to be like when people can finally go back out of their house again. Because you see those isolated older people, the people who were closed down over Christmas because of those regulations, some of them are very scared about going outside, and we need to help them access services, especially when it comes to improving their mental health. Thank you.
Agus Nish, Éireann Sir Justin McNulty on Cancha. I call Justin.
Can I thank the Junior Minister for bringing these regulations to the House today. As I sit and listen to the valuable contributions of all members this evening, the words of a friend of mine are resonating in my ears. Last March, when we were all getting to grips with the arrival of this new virus, this new pandemic, I reached out to a trusted friend, Dr. Jerry McEntee, a back-to-back winner of All-Irelands in the 1980s with me, but also a renowned surgeon in the Mater Hospital in Dublin for over 30 years. I wanted a medical steer on what he thought about this pandemic. Jerry said to me, Justin, when this is all over and done with, people you know and people I know will be dead. And sadly, how right Jerry was, even though it was hard to comprehend at that time how right Jerry was. And people we all know have passed on. It's very sad. And it's coincidentally Sean Boylan, his great manager, actually contracted COVID as well, but thankfully he has fought through. So, I acknowledge the stark necessity for these regulations. At the time of their introduction, they were necessary both to protect public health and to protect our health services. And we all have to acknowledge these restrictions are not what we want. They place extraordinary curtailments on our economy, our way of life, and on our basic liberties. But before I do go any further, I do want to again put my sincere thanks and appreciation on record for our health, social care and frontline workers across our society, especially in the health, education, frontline services and essential retail. Sadly, until this virus hit our world, much of the work these people did was taken for granted. May that never be the case again. We should not just thank these people, we should revere them. Like many in this House, I've sat in on many meetings in recent weeks and months with health officials. I've heard from them, and indeed those healthcare workers on the front line, of the very real pressures on them as they battle to save every life. I spoke with the Chief Executive, Shane Devlin, of the Southern Trust last week, a week when 40% of all people in hospital with COVID in the north were in the Southern Trust hospitals. The Director of Acute Services told me that the staff have been fabulous, resilient and gracious. They are really feeling the pressure and are completely shattered, but they are facing the challenge head on. They are extraordinary, those people. I've spoken to heartbroken families who are distraught. Others have lost loved ones. Others have loved ones in hospital that they cannot visit. I've spoken to families who have lost loved ones to this horrible disease, and they are beside themselves with the pain and the grief because they haven't been able to say their goodbyes and to share their grief in their special Irish way. And I know too many families who have lost both parents to this horrible virus. So, whilst these restrictions are not normal, nor is the virus. Táis Corla, while many of these restrictions are seen as reasonable and justified, there are many others which people out there are questioning. In questioning the restrictions, they are not challenging the advice, but they're just looking and seeking clarity and need to know why certain restrictions are in place. For example, why is outdoor sport for young people not permitted? Children have been taken out of school, and if we are to protect their physical and emotional well-being, surely organised and managed outdoor sports should be considered. I know I have had parents of young people plead for their children to be permitted to participate in sport, and yes, the restrictions and regulations must be adhered with, but allowing some limited sport and recreation can and will protect mental health and well-being of young people now and into the future. Why are car washes closed? Surely keeping cars clean, headlights clean is a good thing. We've kept mechanics open, MOT centres open and operating, yet some cannot get their car washed. So-called non-essential retail is closed, and yet essential retailers can sell items which are deemed non-essential. Surely that isn't fair. Items such as hot tubs or electrical goods, some electrical goods. This favours the big retail giants. It does nothing for small independent retailers in our town centres who before this pandemic were fighting for their very survival. Count Corla, we have seen the impact of COVID on our communities, not just as an outcome of these restrictions, but the death toll, the number of people impacted, schooling from home, large parts of our economy have been put in cold storage. So we need a plan for recovery. A plan for the recovery and reopening of our education and health services. I've mentioned many times, I do believe those in education need to be prioritised in terms of vaccination, especially those in special education settings. We need a plan that ensures children who are falling further behind can catch up. A plan that ramps up capacity in healthcare to tackle the ever-growing waiting lists and to tackle the hidden health consequences of the pandemic and the various lockdowns. A plan for mental health recovery, a plan for physical health recovery, a plan for emotional health recovery and renewal. We need to see a plan for economic recovery and renewal. We need to see a plan for rebooting our tourism and hospitality sectors. We need to see a plan to get sport back on the pitch. We need a plan for emotional health and well-being renewal. Count Corla, like many in this House and in our communities, I want to see restrictions eased and life return to normal as possible, whatever that normal might look like after this pandemic. But we do need to adhere by the public guidance and by what the experts say. And someone once said, when you're going through hell, keep going. Let's all keep going. Gura Mayogat, come Corla.
Thank you, and I call Rachel Woods.
Thank you, Mr. Speaker, and I thank the junior ministers for the outline of the regulations in front of us today. And I do welcome the opportunity to speak on this debate, and like others have done, pay tribute to our frontline and healthcare staff who work extremely hard under immense pressure and stress. And I also want to mention that Kelly Armstrong has those family and home carers too that are often hidden. And I also extend my thoughts to families and friends suffering with the passing of their loved ones and those who are unwell. But these regulations are to be expected. We were warned that infection rates would rise and our health service would become dangerously overwhelmed. Around the middle of December, there were on average around 500 positive tests per day, according to Department of Health figures. And by the 27th of December, this had doubled to just over 1,000 per day. And on the 29th of December, there were 2,300 positive COVID test results. In the week commencing the 28th, over 12,000 people tested positive for COVID-19. The previous week, there were just 5,000. How did this happen? And what were the executive doing about it? At the beginning of December, the executive agreed what they called the Christmas household bubbling arrangements from December 23rd to the 27th. And they also announced that non-essential shops and services would reopen from the 11th of December. And the First Minister said, "Through our collective efforts over recent weeks, we have gained enough space in the transmission of the virus to relax a significant number of restrictions, including the opening up of non-essential retail, close contact services, sport and leisure activities and our places of worship. These decisions will give families, businesses and employees some much-needed certainty and comfort in the run-up to Christmas and beyond." But there was little comfort in those words for those working in our health service. As scientists and medical professionals point out at that time, transmission of the virus remains steady, and the lifting of restrictions could only have one effect on its spread: to allow the virus to circulate even more widely. Professor Gabriel Skelly said back then, "I think with Christmas coming up, people will see this as permission to do lots of things they haven't been able to do. And a lot of those situations, whether it be restaurants, whether it be a lot of crowd shopping, all of that will just feed the virus and the numbers will go up." And similar concerns were raised by others, such as Dr Tom Black of the BNA. Time and time again, we were told the Executive's decision to reopen non-essential non-essential services before Christmas and their easing of restrictions to allow for social mixing over 5 days during the festive period set us on the course for the crisis point that we're experiencing at present. The result was entirely predictable, yet we ploughed on. After less than a week of relaxing restrictions came a completely different message. On the 17th of December, the Executive then agreed a full lockdown to come into effect from Boxing Day. The Deputy First Minister said the health service would be completely crushed in January if we didn't intervene now. So while this is draconian, it's about saving lives. We've never been in such a bad position as we are now, and will be in January if this doesn't happen. But let's think about that for a moment. On the 4th of December, the First Minister said that we'd gained enough space in the transmission of the virus to relax a number of restrictions, and it would provide much-needed certainty and comfort. But less than a fortnight later, the Deputy First Minister said that we've never been in such a bad position. When the new variant began to cause widespread panic on the 19th, Minister suggested that people should only consider mixing on one day over Christmas, now outlined in Amendments 22 onwards that we're dealing with today. But it wasn't formally agreed by the Executive until the 21st, communicated via a press release published just after 1:30 a.m. They advised against non-essential travel. But like many decisions and messaging from this, it was too little too late and sent many people into a panic who'd arrived home to Northern Ireland but were due to go back to university, or maybe where they had lived, or made that horrible decision, but necessary, to cancel their visits to their families at Christmas. We were all contacted throughout the holidays, with many people panicking that their children, say for example, could not get home, that they would be turned away from the boat. When you examine the regulations and the amendments before us today, what do they show? Amendments 19 to 25 tell a story, and they illustrate precisely the problems that the Executive has had in dealing with the pandemic and the inability to get on top of this crisis. We are debating here amendments to regulations that were brought in to ease restrictions and also that constitute the shutting down of society and economy. And again, as Colin McGrath had said, this is rather convoluted, if not highly confusing. How many more lockdowns will there be? How many more blows will be suffered by people who have struggled financially and emotionally throughout this pandemic? The approach has been inconsistent and incoherent, and the regulations paint that picture very clearly. The published plans and frameworks for decision-making, for easing and tightening restrictions, and we didn't follow them. Ministers argued and fought about reopening non-essential services that would increase transmission of the virus, and then, faced with the complete implosion of our health service, rushed to backtrack and impose tighter restrictions. The competing priorities of each of the executive parties has been compounded attempts to deal with COVID-19. And there has been a failure in the most basic duty to communicate simple, consistent messages to the public and give relevant information. One day we've got room to relax. Less than 2 weeks later, we have arrived at our worst point. You can mix with other households for several days over Christmas. Sorry, no, just one 24-hour period. Travel only if it's necessary, but there will be no restrictions other than that in and out of Tier 4 in England. All in Amendment 22, as outlined, and 23. Confusion, mixed messaging, and even simply no or very little information are all recurring themes, and we continue to find out what has been or will be discussed by the Executive through Twitter or Facebook posts by journalists. As MLAs, we are not given the information to answer to our constituents' questions, but perhaps it's just those in the opposition. But I appreciate that this is a very fast-moving picture, but people deserve information to get their questions answered, or at least to have an avenue to do so, and I fully support the call of Kelly Armstrong earlier on for a single point of contact for MLAs to utilise to get answers that our constituents need. And I will repeat yet again for my call for press conferences to be more regular, but specifically, when will the Executive Ministers conduct youth press conference? I have written to the First and Deputy First Minister twice now, both unanswered, not to mention the written questions on this, but when will children and young people get their questions answered? Today, the Education Minister launched the Northern Ireland Executive's Children and Young People Strategy 2020 to 2030. One aspect of this, apparently, stresses the importance of allowing children and young people opportunities to participate in society and have their voice heard and views represented, specifically on issues that affect them. Where is their ongoing opportunity during this most uncertain of years in their lives, dealing with massive changes and ongoing restrictions? Worst of all is the underlying tone evident in some communications that ordinary people are to blame for the virus getting out of control. As the Dean and Vice-Dean of the Faculty of Intensive Care Medicine in England noted, a troubling narrative now appears to have crept into some reporting of intensive care bed shortages to blame the public. Our NHS staff are struggling. They are frustrated, stressed and stretched beyond what we can only imagine, and they have every right to be angry with those that flout the rules. But it is not a few reckless individuals or young people that are responsible for the near collapse of our health service. It is not the whole public's fault that hundreds of people have had their cancer surgery cancelled last week. The BMA's Medical Ethics Committee pointed out, rather than blame the public, we should focus on how the timing and communication of restrictions have contributed to the current situation. We are also dealing with a variant that makes the virus more transmissible, which is especially dangerous for those living in areas of social deprivation where infection spreads more easily. Fundamentally, however, it is the chronic underfunding and lack of resources in the NHS that are driving staff to breaking point, not the public, who are doing everything they can to prevent our beloved health service from going under. There has been a failure to deliver an effective test, track and trace isolate system that actually compensates people who miss out from lost income. I have, sure like others, have had constituents contacting me, telling me that they were turned down for support, even for grants that are set up for them to apply for, being told that they're not eligible. And as an Assembly, we need to protect the most vulnerable, people who cannot afford to self-isolate, people who have missed out on forms of financial assistance for their business or livelihood. And as I have said, restrictions before us today were to be expected. We were warned that infection rates would rise and that our health service would become dangerously overwhelmed, but it didn't have to be this way. This pandemic is far from over, and what we need above all, Mr. Speaker, is a clear and consistent approach to deal with this crisis. No more confusion, no more ambiguity or toing and froing from pandering to populism. We must get on top of this once and for all. There has been too much unnecessary suffering already. The Executive must get support to those who need it. Thank you, Mr. Speaker.
Thank you, and I call Jim Allister.
Thank you, Mr. Speaker. I don't think for one moment that there's anything but extreme difficulty for any government in dealing with this pandemic, and I think that's the same for Stormont Government as it is for anywhere else. But those difficulties are nothing compared with the difficulties that our health service have had to cope with. And I think I want to join with others in saluting the dedication and call beyond duty of so many across that service. Though I acknowledge it's difficult to deal with the pandemic from a government perspective, I think this government in the Executive has had a number of steps and missteps which have compounded those difficulties. I think one of those is the flip-flop in the announcements. Ms Woods has articulated some of them. November we were told 2 weeks, that'll do it. Then Christmas, 5 days. No, it's 1 day. Then it'll all be over, or this current lockdown will last to the 5th of March, or to the 6th of February. Now it's the 5th of March. And I think that's leaving a public not just increasingly frustrated, but increasingly questioning whether some of those in charge actually know what they're doing. And I think the real issue that brings this to the fore is the matter concerning what the public were told was the key determinant here. The public for months was told it's the R number. Stupid. If we can get the R number down below 1, then we can ease things. Now the public's been told, well, the R number is below 1, but we're going to extend the lockdown from February to March. Where did the benchmarking to the R number go? I think the public are entitled to ask and to have that question answered. Does the R number not matter anymore? Yes, I understand the delay in working through the system of rising infections, rising hospital admissions, and rising deaths with a falling R number. But if, and there seems to be, there is that conjoinder between a rising R number and rising cases, and a falling R number and falling cases, then surely as we go forward with a falling R number, we should be anticipating a fall in the demands on hospital admissions. And we do know that there has been a fall, thankfully, in the number of positive COVID tests. So the lag for that, it works both ways. The lag now, hopefully, is working in the opposite direction. But the lockdown isn't. The lockdown, we've just been told, is reaching into March. And I think it's issues like that that add to the scepticism of a public. Yes, I understand our hospitals have to be able to cope. I'm not going to labour the point, but I will make it again, that if under devolution we'd looked after our hospitals, instead of taking out 2,000 beds since 2007 and all the attendant staff that go with it, we'd be in a lot better position to cope. I understand that, but when the R number is falling, surely the admissions are projected to fall, and happily the deaths projected to fall. And yet we're projecting extension. Why is that? And what about all the talk we had before Christmas from the First Minister and the Deputy First Minister? We have to learn to live with this virus. That's the sort of flip-flopping that I'm referring to in terms of the message, never mind even going to issues such as the catastrophic impact on messaging of the Storey funeral. So I think those are some of the problems that the Executive has had. But the other dimension of public disquiet, from what I hear from my constituents, arises in the disparate treatment of businesses. This point that some have made in this debate, that if you're a large supermarket, you can be open, but if you're a small retailer, not predominantly selling essential goods, you will be closed. So the draper, who sells predominantly clothing, is closed, but you can walk into Marks and Spencer's and kit yourself out in all their vast range of clothing. That is what really irks with so many small businesses on our high street. Yes, I'll give one.
thank the member for giving way. And on that point, would he acknowledge also that in many of the small independent retailers, the ability to actually social distance through an appointment basis makes it a much safer environment than those that go for their jolly shop in Marks and Spencer's and then venture on into the clothing sections they're in?
The member's absolutely right. And, you know, if I think of the main town in my constituency of Ballymena, we have a Range store. Now, Range sells a vast range, essentially, of household matters. They sell some essentials like toiletries, etc. But the great predominant sales are in their household goods. The Range is open. But Wise Buys, a local business, which also sells some toiletries, but which predominantly is household goods, is closed. Now, why is that? Why are those who would prima facie seem to be breaching the rules not enforced against? And does that simply mean that others should equally disavow the rules? Because that's the open invitation. Yes?
Would you agree with me that I have an example in my constituency where home heating fuel, which is an essential business but has a small car wash to the side, was fined by the police because it says that car washes can't open. Yet the multinational companies who do essential retail are allowed to sell their unessential retail, which is also listed in the legislation, and that it really does make the small local business feel like it's one rule for the big companies and a different rule for them as the small local retailers.
I agree absolutely. And if nothing is heard out of this debate but the pleas on behalf of small local business, then I hope that that at least will be heard, because it is imperative that either through proper enforcement or ironing out the wrinkles, let's be kind, of the regulations, so that there is not this disparity. Until that is done, you are going to build a huge pond of resentment. You know, I'm getting correspondence all the time. Here's one here. A garden centre. To help himself over the winter months, he sells a few bags of coal. He's had to be closed as a garden centre. Can't sell the coal. It's a minority interest. But the hardware store that can sell the coal can also sell the things that he would normally sell. The garden benches, all of that. Take another business. This one I see is from, Miss Hunter's not here, but it's from her constituency of East Londonderry. A well-established business, telling how every lockdown has had a massive impact on local business, while the big multinationals appear to be able to trade without any impact on their business, and are actually benefiting from local business being shut down. He says, I had to go into Asda last week for groceries. Was completely shocked by the number of people in some aisles in the store, not buying groceries, buying other stock. And he made the point that someone else made, that in fact, local small businesses have a better opportunity to properly control their customer input. So I do say to the executive, there has to be a readdressing of the disparity in this matter, which is becoming acute not just in its level of annoyance, but acute in its level of damage to the possibility of those businesses surviving. So I do trust that junior ministers have been listening, and that the next time we debate this, we won't have the same catalogue of complaints about the prejudice to small business. And if this debate serves any purpose, I trust that's the purpose it will serve. Thank you.
Thank you, and I call Jerry Carroll.
Thanks, Mr. Speaker. Mr. Speaker, I've been incredibly frustrated for almost a year now by the way this executive has implemented regulations, not solely because I believe their strategy of living with COVID is utterly reckless, which I'll come on to, but because of this nonsense charade whereby we're expected to retrospectively give approval or discuss regulations that have long been implemented, in some cases been out of date. There is no real semblance of oversight or transparency or accountability, and the latest regulations are cooked up behind closed doors, often diverging from health advice and pushed through without a picking of scrutiny. This is bad enough when governments around the world have been able to do this much more rigorously and effectively, but when those regulations are actively allowing a deadly virus to surge, when they are allowing for the criminalising of protests, when they are putting workers at risk, the lack of accountability and scrutiny is totally negligent. It seems clear to everyone, Mr. Speaker, that the current regulations will be extended to early March, if not beyond. But when will we debate those decisions? April, May, when the regulations have already been implemented? And why aren't we discussing on the floor, as others have alluded to, in the Assembly, the long-term strategy for dealing with this virus? This charade and the strategy of the Executive has left us with one of the worst records in the world at dealing with this virus, and it needs to end. The regulations, Mr. Speaker, in front of us today relate obviously to the Christmas period, in some cases just before. It's worth remembering that the Health Minister already has publicly admitted that the Executive got it wrong in terms of how it handled that period. How many cases, I would ask, Mr. Speaker, were unnecessarily contracted? How many people, how many deaths have occurred because of the decisions made by this Executive before the Christmas period, which we're only able to discuss some of them today at the end of January? One of these amendments, Mr. Speaker, allows for up to 500 people to attend sporting events, and I have no doubt that sport can help alleviate the pressure of isolation and COVID and lockdown generally. But it's utterly baffling to me, Mr. Speaker, that the Executive would permit such large-scale gathering while criminally punishing socially distant protests at the same time, such as the Black Lives Matter protests. Many people will be asking, have asked, where is the consistency? Where is the medical evidence which says that one gathering is permissible but the other is not? The only discernible difference is that you pay into one event but not into a protest, never mind questions around systemic racism. Amendment 25, Mr. Speaker, obviously allowed taxi drivers to operate after 8 o'clock over the Christmas period, and I don't think anyone has, but I don't think anyone would oppose that. But it is the case that some taxi drivers were approached by the PSNI for doing so, some while transporting essential healthcare workers home and to work. Regulations, Mr. Speaker, have been rushed time and time again, and half the time ministers aren't available on the airwaves or beyond a quick, curt press conference to explain the details, and many asking multiple questions online and also of MLAs. People are relying on WhatsApp and Twitter to understand the new rules, and it's clear to me that these regulations weren't understood, and taxi drivers were on the receiving end of that, and they should not have been approached by the police, and certainly they've been through enough already, and too many are still struggling financially to have to deal with the extra pressure that they've faced. I think the key question for the Minister today, Mr. Speaker, is when will the Executive learn the lessons of this failed strategy of designing rushed regulations behind closed doors, which risk the health of workers' communities by allowing the virus to continue to surge, then asking this Assembly to retrospectively give them permission, the regulations permission. Unfortunately, I don't think I'm the only person who doubts the lessons will be learned, and that there has been consistent talk of individual responsibility, and even a shameless attempt, Mr. Speaker, by some in the Executive to shift the responsibility to ordinary people. Yet here we are looking back at regulations from the Christmas period, at a time when the virus was allowed to spread once again. Where is the acceptance of culpability on behalf of the Executive? Where is the individual responsibility for the strategy advocated by this Executive? Mr. Speaker, there is a momentum growing for an entirely different approach to regulations, and that amounts to a zero-COVID strategy, something that has been raised already today and something I have raised many times in this House, but have been met with derision on many occasions. And last week I wrote to the 5 party leaders on the Executive about this issue. And I think, frankly, the excuses from the Executive and the Government for not implementing the zero-COVID policy are pathetic and dangerous, and the Irish Government is pointing the finger at the North. They say they can't implement an elimination strategy because regulations here are different and looser. Our reports could undermine their strategy and provide a backdoor travel to the South. Meanwhile, the Northern Executive muddies the waters by fixating on the differences between us and New Zealand. They have referenced the cost of an elimination strategy, while the cost of their own living with COVID strategy surges, both in terms of money, impact on the health service and lives. It has even been suggested by some that an all-Ireland strategy could be the first step towards a united Ireland. The border, Mr Speaker, is being cynically utilised by parties north and south as an excuse not to implement the necessary strategies and regulations to suppress this virus and to save lives. There has been no attempt to come together, to work together, to hash out a costed zero-COVID strategy which could be implemented across this island. The absurdity of allowing a man-made border to stand in the way of getting us through this pandemic is striking. It has been said over and over again, if this was foot and mouth or some other animal-borne virus, there would have been an all-Ireland strategy on day one. Excuses, obstinance and posturing around the border are pathetically transparent and patently dangerous. This is just one reason why the campaign for a zero-COVID strategy is gaining momentum. A zero-COVID strategy, Mr Speaker, is not about lifting the New Zealand model and dropping it over into Ireland. It is about working to achieve the same levels of elimination, suppressing the virus through reduced economic capacity and travel bans, rigorous testing and tracing, and the necessary financial and mental health impacts being put in place. It means listening to the growing calls from experts and working out how this can be done in Ireland. And I don't hold out much hope this Executive, on its own initiative, will implement such a strategy, Mr Speaker, but our party and others across the island are doing all they can to continue to put pressure on both governments to ensure that this is the way we force them to adopt such a strategy. Thank you.
Thank you, Gordon Maggott. And I now call on Junior Minister Gordon Lyons to conclude and wind up the debate on all of the motions. Thank you.
Thank you very much, Mr Speaker. I believe that standing orders mean that we have to be out of here this evening by 8 o'clock, so I will do everything that I can to make sure that I am finished up before then. I want to thank all of the members for their contributions this evening. I think, as normal, we have often within this debate gone beyond the regulations that are in front of us, and perhaps we've got into a more general COVID debate, but that's the way it has always been, and perhaps it will be the way that it will always be in the future as well. But maybe I could address some of the comments that members have made, and I'll begin with the Chair of the Executive Office Committee, and I thank him for the comments that he has made and the fact that the committee has recognised the united approach that we need if we are to tackle this pandemic. But I also note the concern that the member raised in regards to the complexity of getting the regulations to the floor of the Assembly. This is something that we have talked about in this chamber time and time again. Though I hope that all members would recognise the efforts that we have made to make sure that we can get information to MLAs as quickly as possible. For example, the ad hoc committee, and as Junior Minister Kearney had referenced in his remarks, after the latest decisions were made by the Executive, a number of ministers made themselves available to that committee so that they could address the issues and the concerns that members have. Obviously, today we are operating under the structures that were agreed within the coronavirus legislation, and that the Executive bring these decisions, make the decisions in the Executive, and then bring them in this way to the floor of the House. I know that that is not ideal. That's why we have tried to ensure through the ad hoc committee that there are opportunities for members to question ministers in relation to some of the changes that have been made. Paula Bradshaw spoke on behalf of the committee, and I thank her for the comments that she has made, and I understand the concerns that she has expressed and that the committee clerk has written to the department about the concerns that she had raised, and I hope that she will get a reply to that. In terms of consultations itself, obviously it's difficult. We don't have the time to go through the formal consultation procedure, but we are doing everything that we can to have that close dialogue with key sectors, and we have done that in a number of ways, and will continue to do that as well. Speaking as an individual MLA, she also raised the learning from reopening of sectors, and that is an important lesson for us that we will take into our planning for recovery. And she obviously rightly stated that the case numbers are horrendous, which is why we're under the restrictions that we find ourselves in. In relation to the new variant and the impact that it has, and the use of a travel ban, it's absolutely right in what she says, that it's transmitting too rapidly, and we're suffering the consequences of that. But we will consistently monitor that to see what further action needs to be taken. Mr. Buckley spoke next, and can I thank him for his contribution, and it was his passion for this is very, very clear, and I think that it's really, really important that we don't just nod these regulations through or in some way get used to them, because they are extreme. We can see that in a number of ways and the impacts that it has, and it is absolutely right that as MLAs we don't shirk our responsibilities in asking those questions and making sure that we're trying to find out exactly why it is that we are bringing these in, and to make sure that they are proportionate at this time. He raised a number of impacts that they are having on people, and he's absolutely right to do so. Let me mention in particular the concerns that he has in relation to cancer treatments. In fact, it's one of the reasons why we have these restrictions in place, is because of the wider health impact on cases and issues such as cancer. Because it's not restrictions that are preventing cancer operations from taking place. It's not the fact that restrictions are in place and so doctors are staying at home. It's because resources are being diverted to COVID cases. And that's why it's so important that we drive down the rate of infection, so that we do not have patients in ICU units, and those ICU units can be used and be ready, so that we can have operations on cancer and all the other really important things that he has raised. But he is absolutely right to make it clear the impacts that this is having on our health service. And we need to make sure that we are not only running a COVID service in Northern Ireland, but a health service, and that all of those issues are being addressed. And members will be aware that the Health Minister has approved the establishment of a new regional approach to ensure that available theatre capacity across Northern Ireland is allocated for those patients most in need of surgery, both during the surge and as we come out of the surge. And this will include seeking to fully maximise all available in-house health and social care and independent sector capacity. In terms of cancer and non-COVID health, it's very, very important that we recognise the impacts of that. But we also do need to recognise the impacts that this is having on other parts of our daily lives as well. And we have said time and time again that we will make our decisions based not only on the R number, but also on the capacity of our health service, and also on the wider societal and economic impacts. And that is the case that is frequently pressed with the Health Minister when he is bringing these restrictions to the Assembly. It is constantly raised with him about the impact on mental health. We frequently talk about the impact of poverty as well, and I've lost count of the number of times, for example, and I'm sure the CMO won't mind me saying this, but he always points to the fact that poverty is poor for health, that unemployment is poor for health, and we need to take into consideration all of these aspects. And I can assure the member and others that that is what's taking place within executive meetings, and that all of these issues are being considered, and it's not just COVID alone. And I'm sure that everyone in this House is aware of those impacts and the devastating impact of all of these restrictions that they are having on people here right across Northern Ireland and beyond. I am thinking about mental health and the impact that that's having on people here. And that is devastating, and I'm sure we've all heard stories about how that mental health crisis has gotten even worse over the last number of months. We can see a huge impact in terms of education as well. And as useful as remote learning can be, it is no substitute whatsoever for that face-to-face teaching. And I am concerned about the impact that that is having. We also see it in a number of other ways, and I think of special needs children in particular, and the stories that I have heard of special needs children not getting the speech and language therapy, the music therapy, the physiotherapy that they had been used to before. So lots of impacts that these regulations are having on our lives, and so it's absolutely right that we take all of these into consideration and don't just look at COVID alone. In fact, there is that responsibility on us to do that, and so I thank the member. He had also recognised the problems around click and collect, and I hope that I have answered that Mr Middleton also, as well with others, had raised. Ms Anderson is not in her place, but I will of course raise the issue of photographers. It does seem a bit odd that if you're going to a photographer you don't want to have a mask on when you're getting your family photograph done. I see what Mr McGrath is going to say. He's probably going to say that for some people that might well be an improvement, but it is an important issue, and if it's something that we can get flexibilities around, I think it is important that we do that. In relation to taxis and financial support, members will be aware that grants are being paid out and support has been put in place, and the members' concerns relating to taxi drivers will be raised with the Minister for Infrastructure. Alan Chambers had raised the issue of an exit strategy, and whilst I understand his point about it being difficult to get into current circumstances, we must start looking at our recovery now so that we are prepared, and that includes both how we come out of the current restrictions in the short term and also the wider economic and societal recovery processes after that. Members will be aware of the original Pathway to Recovery document that the Executive had worked on in late spring and early summer, and it was agreed at the last Executive meeting that that work will be taken forward for a new and updated document in relation to recovery, to make sure that we do have that plan on how we not only move from restrictions but into a better place of recovery as well. And I know that that issue was raised a number of times. Mr Middleton had raised the issue of churches, and Minister Kearney and I have had a number of engagements with many groups over the time that we have been in office. And I do want to thank the representatives of local churches here for the way in which they have approached our discussions. I think that they have always been sensible and measured and thoughtful discussions, and it's good that we're able to have that working relationship with them, as we do with many other leaders in other sectors as well. And I want to thank them for their input and for the discussions that we have had as well. He also raises the issue of funerals, Mr Speaker, and again, I absolutely agree with everything that he has said. I understand how difficult it is when you lose a loved one. We all do, and we want to make sure, don't we, that we are able to grieve in the way in which we're all accustomed to. We want to be able to have people with us sharing in our time of sadness and of grief. But I have to say, to those, and this goes beyond funerals, but to any event or to anything that breaches the regulations, I would say to them, what makes you so special? Why do you think that the rules do not apply to you? Because so many other people in our society are adhering to the rules and to these restrictions. Difficult as it may be, but they are adhering to them. So I think it's really important that we all send that message, that we need to show that leadership and that working together with other people as well. I note the concerns that he has made as well in relation to click and collect. And I get the sense from Mr Middleton that he's very concerned about being able to get flowers for Valentine's Day in particular, it seems. And I think that if we can make common sense adjustments to the regulations, that we should be willing to do so. Pat Sheehan made a number of comments, and I agree the pressure on our frontline staff has been immense over the last number of months. That's why we all need to make sure that we do work together, adhere to the rules as best as we can, and to the guidance so that we can relieve the pressure on them. The issue of travel is continually under review, both east-west and north-south, and the issue of people bringing the virus into Northern Ireland is, of course, a concern, and that is an issue that we talk about frequently with other governments across the UK, and, of course, with our counterparts in the Republic of Ireland. I think I picked up on him whenever he was referring to the proposed travel ban with the rest of GB. He said, I don't care who the scientist is that says that, but that was the advice, the evidence that we had gotten at that time within the executive, that the risk was small, and that's why we took the steps that we did in relation to that. I'm not going to give away at this time. Just moving on then to Kelly Armstrong. Kelly Armstrong began her speech bemoaning the negativity of the debate, and then proceeded to highlight her grievances with everything that was in the regulations that she didn't like. She also said that this was an orange and green debate, and I have to say, and I wish the member were still here so I could raise this with her, because I don't think that this has been particularly an orange and green debate. In fact, what I have witnessed over the last 3 hours has been people bringing legitimate concerns, and I think there's been a sincerity to these debates, which is always here actually and always evident, and I don't think there has been a lot of orange-green point scoring at all. I think that was evidenced by Mr Sheehan actually when he showed that he actually welcomed the fact that the army was coming in here to help. So I do disagree with her in relation to that. In regards to the main point of contact for MLAs, the main point of information is, of course, Northern Ireland Direct, which is updated regularly with the latest information relating to the regulations and restrictions. But we also have a team who deal with queries, and if the member is content, I will pass her contact details on to them. Very briefly.
Senior Minister, for giving way, I would just like to ask if my contact details could also be forwarded on to that team. Thank you.
Yes, I'm sure that can be sorted out. We'll try and make sure that there is information there, a point of contact for members. And can I just say, I do recognise, because as a constituency MLA myself, I understand what happens to your mailbox, your WhatsApp groups, your Facebook pages and all the rest of it. You get inundated with questions, and we want to help as much as possible with that. Can I also just speak briefly to Ms Hunter's comments? I share the members' concerns for the most vulnerable during this time, and we are committed to doing everything that we can to help, and I welcome her recognition of the impacts that the current restrictions are having on mental health as well. Mr McNulty had raised the issue of death, and that we will all likely know someone who has died. A sad but realistic perspective on what it is that we are facing. And he went on to talk about life returning to normal, and we obviously want to be in that position as soon as possible. And key to that, obviously, we've talked about exit strategy time and time again. Vaccines are key to that. we'll bring forward our recovery plan, and we trust that in conjunction with the vaccines and the recovery plan that we really see how we get back to normality. Ms Woods had a number of issues that was raised in relation to the pre-Christmas restrictions and relaxations that were put in place at that time. And I hope that the member would recognise that we're dealing with a rapidly changing situation. It doesn't always run smoothly. It isn't a straight line on a graph. And we've been reacting as best as we can. As I previously have said, nobody has ever gotten this right. And I think that if we had said to members of this House, 5 days, that's what you can all have for Christmas. And then if we did not change that piece of advice based on the evidence that was presented to us, we would rightly be accused then of not listening to the advice that was in front of us. So sometimes we have to make decisions, sometimes things have to be changed about quickly, and we thank the public for their patience as we do that. And so we're very much, to refer to her point about young people, we're committed to engaging with our young people. The First and Deputy First Minister did both engage in a junior press briefing in December with Cool FM, and we're actively looking at other opportunities to engage with young people in the coming weeks. I agree with what the member has said, insofar as we shouldn't just be paying lip service to our young people, but giving them real opportunities to engage, and I'm happy to look at any other recommendations that come forward. Very, very, very briefly.
Thank the Junior Minister for giving way. I would make one suggestion. There had been a Northern Ireland Youth Forum, political panel and press conference arranged by the Executive Office last year, and unfortunately that was cancelled because of political fallout. May I suggest to the Executive Office that they rearrange that as soon as possible with the Northern Ireland Youth Forum?
More than happy to take that back to the First and Deputy First Minister, Mr Speaker. Just then to come on to the comments made by Mr Alistair, the member asked why we can't start to relax restrictions now, because the R value is now below 1 and the rate of new infections is declining. The difficulty that we have is that we're a very high level of hospital occupancy, and we know that this caseload will take a considerable time to ease and reduce. Of course, it's not the policy of the Executive to get the R number below 1, it's the policy of the Executive to keep the R number below 1, and that's why we can't let up as soon as the number drops below 1. And I think I've covered most of the comments that have been made and raised by Mr Carroll in previous comments. And so, Mr Speaker, can I just again say that we do recognise the impact that these restrictions are having on people. This is not something that we take lightly, and I had hoped many months ago that we wouldn't have to be back in this chamber again, doing what we are doing now and bringing all of the negative consequences that come with these restrictions. However, I think something has changed now compared to what has happened in the past when we have been in front of this House, and that is that we have had this rapid rollout of the vaccine. And there has been tremendous progress. Great to see so many of our older people, so many of our care home residents that have been vaccinated, and I think we need to give credit to our health and social care services who have done so much to ensure that that has happened. And I hope that with the continued rollout of that vaccine, it means that we will not need to bring restrictions like this constantly back to the House time and time again. That's what we all want to see. So let me again thank all of those within our health service that have worked so hard to get us to this point. And my plea to the public would be, please stick with us. I know this has been difficult. I know people are fed up. I know that I'm fed up and want this to be over. But let us just keep going through these next number of weeks and months, and I've no doubt that if we do and if we work together, the normality that we all seek will be with us again shortly. Thank you, Mr Speaker.
Thank you. And the question is that the Health Protection Coronavirus Restrictions number 2, Amendment number 19, Regulations NI 2020 be approved. All those in favour say aye. Contrary, no. The ayes have it. The ayes have it. We will now move on to the second motion on the health protection regulations, which has already been debated. I will ask the clerk to read the motion.
That the Health Protection Coronavirus Restrictions number 2, Amendment number 20, Regulations Northern Ireland 2020 be approved.
Thank you.
Moved.
Thank you. And the question is that the Health Protection Coronavirus Restrictions number 2, Amendment number 20, the NI 2020 be approved. All those in favour say aye. Contrary, no. The ayes have it. We will now move on to the third motion on the health protection regulations, which has already been debated. I will ask the clerk to read the motion.
Amendment number 21, Regulations Northern Ireland 2020 be approved.
And I call a junior minister to move the motion.
Moved.
Thank you. And the question is that the Health Protection Coronavirus Restrictions number 2, Amendment number 21, Regulations NI 2020 be approved. All those in favour say aye. Contrary, no. I think the ayes have it. We will now move on to the fourth motion on the health protection regulations, which has already been debated. I will ask the clerk to read the motion.
That the Health Protection Coronavirus Restrictions number 2, Amendment number 22, Regulations Northern Ireland 2020 be approved.
Thank you. And I call a junior minister to move the motion.
Moved.
Thank you. And the question is that the Health Protection Coronavirus Restrictions number 2, Amendment number 22, Regulations NI 2020 be approved. All those in favour say aye. Contrary, no. The ayes have it. The ayes have it. We will now move on to the fifth motion on the health protection regulations, which has already been debated. I will ask the clerk to read the motion.
That the Health Protection Coronavirus Restrictions number 2, Amendment number 23, Regulations Northern Ireland 2020 be approved.
Thank you. And I call a junior minister to move the motion.
Moved.
Thank you. The question is that the Health Protection Coronavirus Restrictions number 2, Amendment number 23, Regulations NI 2020 be approved. All those in favour say aye. Contrary, no. The ayes have it. We will now move on to the sixth motion on the health protection regulations, which has already been debated, and I will ask the clerk to read the motion.
That the Health Protection Coronavirus Restrictions number 2, Amendment number 24, Regulations Northern Ireland 2020 be approved.
Thank you, and I call a junior minister to move the motion.
Moved.
Thank you, and the question is that the Health Protection Coronavirus Restrictions number 2, Amendment number 24, Regulations NI 2020 be approved. All those in favour say aye. Contrary, no. The ayes have it. We will now move on to the final motion on the health protection regulations, which has already been debated, and I will ask the clerk to read the motion.
That the Health Protection Coronavirus Restrictions number 2, Amendment number 25, Regulations Northern Ireland 2020 be approved.
Thank you, and I call a junior minister to move the motion.
Moved.
The question is that the Health Protection Coronavirus Restrictions number 2, Amendment number 25, Regulations NI 2020 be approved. All those in favour say aye. Contrary, no. The ayes have it. The ayes have it. The next item on the order paper is the adjournment, and the question is that the Assembly do now adjourn. Thank you. Assembly is adjourned.
Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary.